Can the members of the Budget Committee please come to the committee? We would like to begin the meeting. Can we have Budget Committee members please come to Committee Room 1 so we can begin the meeting? Thank you. I'd like to call the meeting to order. If everybody can take their seats, we're about to begin. Can I have everybody please quieten down? The meeting is about to start. Thank you very much. We have been in recess since yesterday with the 2016 Toronto budget. We are beginning our second day. Welcome everybody to another fun-filled day of talking numbers. Today we have on the agenda Toronto Public Health, the Association of Community Centres, Yonge and Dundas Square, Arena Boards, Civic Theatres, and Citizen-Centred Services B will be presenting to us today. So on that, I just wanted to mention to committee members and councillors that if you have any briefing note requests, please get them into the clerk as soon as possible. We are trying to make sure that we have a list so we can see what is before us. So if you have anything, and specifically from yesterday, if you have any briefing note requests, please get them into the clerk as soon as possible. Again, because this is one long meeting, we generally look at briefing note or doing motions at the end of the meeting, which would technically mean Monday. But again, depending on how many come in, we may move some of them maybe on Friday or possibly today. Again, but we need to see what is coming in first. So just wanted to let you know if you can get briefing note requests in as soon as possible, it'd be much appreciated. On that, we're going to start with public health. If they can come up, Dr. McEwen, welcome. And you'll be doing a presentation to us today. Then after that, we'll be getting into questions. Can I please have everybody quieten down? Seems to be a lot of chatter here right now. Thank you very much. I believe, Dr. McEwen, you've passed around your deck.
I believe so.
Okay. I'll leave it up to you. If you can just introduce everybody at the table for us, and then you can begin your presentation. Thank you.
Thank you, Mr. Chair. Members of the committee, good morning and Happy New Year. I'm joined by Councillor Joe Mihevc, Chair of the Board of Health, Yvonne DeWitt on my right, our Director of Finance and Admin, and Riaz Katcha, our Manager of Finance. I'm going to have a brief presentation which will cover both the operating and capital budget, and then I'd be happy to answer any questions that members of the committee and others may have. Okay.
Mr. Chair.
Can I please have the chatter in the room subside a little bit, please? It's hard to hear. Thank you very much.
Thank you. So we'll begin with our 2015 program map, which outlines at a very high level the wide range of programs and services that public health is mandated to deliver by the provincial government. We try and align our program map for the municipal budget purposes with the provincial programs, because that way when we're doing two different budgets every year, it's a little bit easier. Our budget is a bit complex because of the varied funding models of our different programs. I think it's simplest and clearest to understand our budget if you think of it in three parts. The first one is programs which are 100% provincially funded. They receive no municipal subsidy at all. They add up to about a quarter of our overall gross budget. Some of them are funded by Ministry of Health and Long-Term Care, some by the Ministry of Children and Youth Services, and the ones from MCYS are actually funded on a March 31st year-end basis, which makes it a bit treacherous to interpret our variance reports as we go through the year. We have had some new programs added that are 100% provincially funded in recent years, including dental programs, Healthy Smiles Ontario, enhancements to the Smoke Free Ontario program. But for those programs which we have had for many years, the main challenge we face is that the province has flatlined budgets. So we're trying to deliver the same services within a constrained envelope, and what essentially happens is our service levels gradually decrease as the cost of service delivery increases. The Board of Health has, of course, advocated to the province over a number of years to try and enhance those service funding so that we can keep service levels where the province wants us to keep them. Second component of our budget is a small number of programs which are entirely municipally funded. There are really only two of these, the Student Nutrition Program and the Seniors Dental Program. They add up to about 7% of our budget overall. These are entirely within control of City Council in terms of funding and delivery. The challenges that we face are really growing the Student Nutrition Program, which Council has supported in past years, to meet increasing cost of food and to address unmet needs in schools that don't have programs or don't have fully funded programs. And of course, with respect to the Seniors Dental Program, this is a program which has high demand. There are relatively few places that low-income seniors can actually get free or low-cost dental care, and so they're willing to wait quite a long time, so a number of our clinics have long waiting lists, reflecting unmet demand. The third and largest component of the budget, which includes most of the provincially mandated programs, are funded on a cost-shared basis, 75% provincial, 25% city. This is a good deal for the city. We can deliver public health services at 25 cents on the dollar. It adds up to a little more than 2/3 of our overall program. The challenge in this area really has been trying to make the most of provincial revenue. Generally, in past years, the provincial government has provided growth funding in excess of what the city has been able to match, so we've missed some opportunities. This year, starting 2015, for the first time, the provincial government developed a funding formula to decide how to allocate its funding to the 36 boards of health across the province. In that funding formula, which took into account factors such as the cost of service delivery and population needs for public health services, Toronto was one of 8 health units out of 36 that were judged to be underfunded from the province's point of view. And for the first time, at least in my memory, the province approved a provincial budget which was higher than we had asked for and higher than the city had approved. So we did have some provincial funding that we weren't able to use on a cost-shared basis because of that, but it will be there for us as part of our provincial base going into 2016. So those are the three components of the budget and how they operate. Our staffing trend over the past number of years has been one which saw a significant decrease in 2012 as a part of the large-scale cuts that happened in that year. We decreased by about 60 FTEs. Since that time, we've essentially been flat in terms of staffing. The vacancy analysis tells an important story for us. We have had a number of years up into 2015 in which we had significant challenges in recruiting staff, and our gapping levels were significantly higher than budgeted, usually about twice as high in the 8 to 9% range. And that, of course, had a significant impact on service delivery. When we don't have staff to deliver services, the service levels fall. It had an impact on other aspects of our spending. Through some collaboration with the city, with the HR folks who support our hiring process, we were able to finally improve hiring and recruitment in 2015, and now are in a position where we, towards the end of the year, have actually been holding positions vacant deliberately in order to come within our budgetary targets, which is something which we have not seen for many, many years. So good news is that we are able to sort of meet our budget targets and deliver the amount of service that budget provides for. Bad news is that we are now struggling against our gapping targets, and you'll see something in the budget later on which attempts to address that. So the 2016 preliminary operating budget, as you can see in these pie charts, especially the one on the right, is mostly comes from the province, but there is about a quarter of our budget that comes from municipal taxes. In looking at our service needs and priorities in 2016, there are several which you'll see reflected in what the board has recommended. The Student Nutrition Program, as I said, has experienced rising food costs, and we are in the midst of a longer-term, multi-year process of trying to expand municipal support for that important program. We have a significant area of non-compliance with provincial requirements in the area of day nursery immunization, and we made a start on closing that gap in 2015. Tobacco enforcement, our workload has increased due to new provincial and municipal regulations. That problem is being addressed through new 100% provincial funding, fortunately, so that is embedded in the budget. We got that new funding in 2015. It will continue in future years. We are looking at continuing increased support for community-based service delivery. The Toronto Urban Health Fund, which provides funding to small community agencies to do work in HIV prevention, drug prevention, and youth resiliency. The board has approved a 5-year plan to try and enhance that program. And finally, as I said, our struggle with gapping means that we want to try to maintain staffing levels across a wide range of programs in order to deliver the most service that we can within our approved budget. This is a summary of the 2016 preliminary operating budget. As you can see, it is essentially flat when compared with 2015 budget. The municipal portion of it is just under $57 million. Efficiency reductions have been one of the focus of this year's budget process, and that's familiar from previous years. All agencies have been asked to find efficiencies, which from my perspective is a way of reducing costs while delivering the same level of service as the past. We have been able to find some modest efficiencies this year. I think it's important to look at this in the context of our experience over the past 5 years, in which we have found significant efficiencies. We've absorbed inflationary costs for the past 5 years totaling nearly $1 million. We were able, through careful line-by-line reviews in each of the past 5 years, to reduce our non-payroll-based budget by about $2 million. And in 2012, of course, we had a very significant reduction of nearly 60 FTEs and about $7.5 million as a part of the constraints which were part of that budget year. And we will continue to strive to find efficiencies as we go forward. Of course, they become somewhat more difficult to find as time goes on. The Board of Health has recommended 4 enhancements to service levels which are not a part of the preliminary operating budget, and I'll just summarize them for you briefly. The Toronto Urban Health Fund, as I mentioned earlier, is a mechanism for providing services through small community agencies in the area of HIV prevention and drug use prevention. The board last year approved a 5-year plan to enhance this program. The first year of enhancement was approved by City Council in the 2015 budget. The second year of enhancement for a net cost of $37,500 is also being recommended by the board. We've also included an inflationary increase to the agencies which deliver these services, which totals $14,200 net. The day nursery immunization program is also part of a continuing multi-year effort to enhance this program, which is a gap in our public health standards compliance. It was funded last year by City Council. Year 2 of that process is estimated to be $134,000 net. The reduction in gapping from 5.8 to 4.8%, which is the gapping level which we had in years up to 2015, is an attempt to try and reflect what we believe is now our natural level of gapping with the improvements in recruitment and hiring processes, and an attempt to try and reduce the impact on service levels across a wide range of services of deliberately holding positions vacant. For perspective, I believe that the normal average gapping level in other parts of the city government is about 2%. So even at 4.8%, we are significantly above gapping levels which are budgeted for in other parts of the corporation. Finally, the student nutrition program. We were asked by City Council to revise the plans for multi-year enhancement of municipal support for this program, which we did do and report to the Board of Health in October. The board approved a revised plan which extended the enhancement strategy by 1 year to end in 2018 and adjusted it to ensure that all of the school programs by the end of that time would receive 20% of the cost of their funding from municipal budgets, and that all programs would have both provincial and municipal core funding, because we found that that core government funding is essential to the viability of these programs. So as in past years, the enhancement to the student nutrition program has 3 components. One is to keep up with the cost of food for the existing programs, which this year was relatively modest at 1.3%. It's judged each year based on the nutritious food basket, which is a survey of nutritious food costs. There's an expansion component which would add 49 new programs, each of which would then have both provincial and municipal funding. And there is an enhancement of the more than 700 existing programs to take them to a 16% level of support from municipal sources. So those are the 4 enhancements which were recommended by the Board of Health for your consideration. Mr. Chair, should I move directly into capital and finish the presentation? Great. So Toronto Public Health's capital budget is entirely composed of information technology projects because this is our predominant capital need. We implement these IT projects to enhance service efficiency, and recently this has significantly been in the area of mobile technology, giving our staff, health professionals who are out in the community delivering services, access to databases and information on a mobile basis so they don't have to spend as much time coming back to the office. Some of our IT solutions increase transparency, and there are some examples there. We're also trying to comply with provincial requirements. There are some province-wide systems which we have had to invest in order to meet provincial needs. And of course, all of our systems are subject to ongoing investment to maintain state of good repair. The 10-year plan that is before you will provide funding for 19 IT projects in total. Our IT needs have been determined through a review and strategic plan, so we're aligning all of our projects with the objectives and needs which are identified in that strategic plan. The preliminary capital plan and budget for 2016 is summarized here. You can see that there are 6 projects in 2016, 5 of which are continuations of projects which started in earlier years, one of which includes seed funding to look at the feasibility of a project which would continue in future years if successful. And you can see the rest of the projects are laid out over the 10-year period. We do have identified through our strategic IT plan some unfunded capital projects, so we've prioritized and put into the budget the ones which are most important for our operations, but there are some others that we have in mind and we'll be looking at as we go forward from year to year as priorities may shift. You may see some of these appear in future budgets as we go forward. Mr. Chairman, that's the end of my brief presentation. I'd be happy to answer any questions that the committee or others may have.
Thank you very much. We'll go to questions of committee members first. Councillor Layton.
Thank you very much. I'm just going to go through, there's a couple pages in the analyst notes that talk about discontinued services. I'd like us to go through and unpack what those are and why the proposal to discontinue them is there. Page 19, I'm starting with about halfway down the chart for environmental health. It's recommended that service levels reviewed and discontinued. What does that mean for each of those on that list?
It doesn't mean any change in actual service levels. In managing our programs, each of our services has an annual service plan, which is quite comprehensive, and the plan includes targets for service delivery and measures that we use to evaluate ongoing performance. A subset of those measures are imported into the budget documents. So this year you can see that there are fewer measures in 2016 than in past years. That's really a decision that was made to simplify I guess, the number of measures which appear in the budget documents. It doesn't imply any change in either the measures that we use in managing the programs and planning them, or any change in service levels themselves.
So I don't understand, because in the service levels chart, the service level for 2016 for the first one on this list is receive up to the 2011 for assessment and surveillance. It says service level reviewed and discontinued.
It's the service level measure in the budget document that's been reviewed and discontinued,
So
not the service.
Level will be maintained from the previous year.
Yes, there's no implied change in the actual service level to the public.
Okay. I think in other analyst, and maybe this is something to bring up with the CFO's office, in other analyst documents, I don't believe it's written this way. Is it if the service levels are maintained consistent with the prior year, they're not written in as reviewed and discontinued? It's a bit of a...
So through you, Mr. Chair, we continue to evolve the information that is provided here, and I think part of the discussion that's being had at the moment is one in which the levels of service that were being defined by public health were very detailed, and so what they're really doing is recalibrating the information that's coming forward. So it's really about what level of information you want around the service levels that are being provided. So the recommendation from public health is that some of these come off the list in terms of defining the service level publicly. So moving forward, then those would fall off the list.
And we wouldn't be monitoring the service level delivery of them?
Well, certainly we're monitoring the service level in all of these cases in much more detail than the budget documents provide. The challenge, I think, has been providing a coherent set of information through the budget documents for a set of programs which is extremely complex and numerous. Right? So we can give you as much as you would like to see, but again, in discussion with financial planning, we've cut back on the level of detail in the measures which are part of the budget documents.
For example, on page 27, under the infectious disease section, and I was going to ask about this, under disease prevention and health protection, the 2014 service standard was over 60,000 client visits to sexual clinics annually, wait times for clients between 2 to 3 weeks, right? Mm-hmm. And then the 2016 is approximately 55,000 client visits to clinics annually. And that, like, where it used to have 6 measures being measured as service levels, we're now down to 1. It's actually lower than the 2014. My question was going to be, is it in fact lower, like our service level is going to be lower, and why would that be? But this then speaks to what information we're being provided as just simply so that we can judge if appropriate levels of funding are being allocated to deliver services. So maybe that's something to take up later, in that we're going to need at least some detail. And if as in other areas, rather than writing service level reviewed and discontinued, which to me sounds like we're not doing this service anymore, rather just repeat the previous year's service level, if that's the intention. But can I ask specifically about the number of client visits? Is this true, and why would it be going down from 2014 to 2016 for the disease prevention and health protection section?
I can tell you that their service levels do vary slightly from year to year, and this is our best judgment of what we think the service level target should be for this year. I would have to get back to you on why there's several thousand difference on that particular one.
Okay. There was an unfunded service level that involved an inspection of fridges. Was that Toronto Public Health? I can't find it. I'm busily trying to. You were too quick on the presentation. Can I just confirm, it wasn't in your list of new services, I don't believe. I had Toronto Urban Health Fund, day nurseries, reduced gapping, and student nutrition. Does this other one fall under your purview?
I believe that what you're referring to is the
Last question.
cold chain maintenance. So when vaccines are distributed through clinics and doctors' offices, one of the roles of local public health agencies is to inspect and ensure that those vaccines are being kept properly, because there's a certain value to them, both in terms of disease prevention and also the financial value of the publicly funded vaccines. So yes, we do that. So in the case of influenza immunization, there's been a large expansion in the number of places that you can get a flu shot. There are hundreds and hundreds of pharmacies now in Toronto which can keep and deliver flu vaccine. So we have to inspect all of those pharmacies to make sure that they're maintaining the vaccine properly. We have received one-time funding in recent years from the province to do that, because it's a new program. We have been given some new one-time funding for this year, so it doesn't appear in our budget as an ask at this point.
But it was in the original presentation by the city manager of an unfunded. Is it not in your budget, or can we just get?
Yeah, it's
It was on one of these lists. I could find it.
yes. What you're probably referring to is a one-time money, 100% provincial, for that purpose. It may be an issue going forward.
Sorry, it is under the Public Health Board approved. This is page 98 of the presentation of the universal influenza pharmacy inspections. And it was 2 positions with 0 net. So it cost us nothing, but for some reason it was in our unfunded category. So now that I know what it is, and it sounds important, I suspect it's very important.
It is important, but it's not, because we do have one-time funding, it's not something which has been identified as a municipal funding need for 2016.
provincially funded,
What?
totally provincial.
Funny, because it's on our list of ones that are going unfunded. In the list here, page 98 of the presentation that we got in December.
Why don't we have the
Maybe we
CFO,
can-
let him look at that, and I'll get
Perfect.
him to come back and answer you on
Thank you.
that, so. Any other questions of committee members? Councillor Pasternak?
Yes, thank you. Thank you, Mr. Chair. On the student nutrition programs, budget line item for 2015 was about 8.3 million, and your ask is going up to about 9.9 million. Does that sound all right within a long-term goal of going to 15 million?
Yes, those numbers are all correct.
You know. And when it comes to this program and overall programs from your office, do you adhere to the philosophy of universality, where everybody is eligible under public health services and policies, or?
Universality in this program applies to once a program is in a school, children are not allocated as eligible or non-eligible, because we've found that children who are most in need will sometimes not take advantage of the program if it labels them as being in need. So the universality is at the program level. When it comes to allocating the partnership, the various funders and organizations that sponsor the program allocate programs according to school need for the most part.
So we don't have a means test. So children of millionaires could receive a nutrition lunch or snack or breakfast.
It's conceivable. I think that what we find is that schools that have lower levels of need receive less public funding because they're able to generate more funding locally from their own community and
They
from
raise
parents.
their own.
They raise more money, and they require less support from public sources.
Now, in your recommendations to council back in the fall, and this is for the second year in a row, you've restricted the student nutrition program's expansion to publicly funded schools only. Is that a pivot from previous policy?
Historically, there were some private schools a number of years ago that were grandfathered into the program, but it has been the practice for a number of years now for the partnership that runs the program to allocate to public schools.
So is that a decision approved by council, or is that emanating from your office, or?
It's an alignment, I think, with the provincial policy. Has been the province's policy for some years, we understand, to fund these programs in public schools as opposed to private schools.
We're getting Councillors Cole, Carmichael Greb, and I think in Councillor Mahevik's ward as well are getting complaints, I think, from faith-based schools that they've been rejected year after year. The rejection letter doesn't refer to the program being exclusive for publicly funded schools. That's not what we're telling them. So they keep calling. And I'm just wondering whether this prevents us from actually reaching people in need regardless of where they go to school.
Yes, I think that is a question. It's a legitimate question to ask. There are some challenges in answering it because, of course, the private schools are several hundred, very, very diverse, who don't necessarily have the same level of information about need as we can get from the major school boards, who all have statistics which allow them to rank schools and identify where there's need and where there's not. I think if council is interested in opening up its funding to schools who are private schools, then I think we would need to get some policy direction on that and see how feasible it would be to do that.
Well, I think in the past there had been a very small number of faith-based schools that had received funding. This actually looks like a change of policy to exclude those. You're asking us now to reverse what you're coming forward with, which is restricted to public schools, and now you're saying, oh, well, if council wants to change that policy. Well, we never changed our original policy, and that seems to be policy creep in a high-ticket item here.
Well, I expect that, I wouldn't describe it as policy creep, but I think that the practice which has evolved for a couple of reasons, as I say, partly because it's consistent with provincial policy and partly because of some of the challenges of applying a means test at the school and community level to a diverse group of private schools. But I acknowledge that it is possible the result of that practice is that some schools who have students with equivalent need to those which are already receiving programs may not be eligible in the current scheme.
Would it be your position that going forward, when we get to the 15 million mark, they would be for publicly funded schools only and could prevent even the city from incorporating these programs into community centers or community hubs?
It's your last question, Councillor.
I'm not sure I understood the question. I'm sorry, Mr. Chair.
Well, if the program can be, if your view is that it should only be funded and delivered through publicly funded schools, could it prevent us from delivering similar programs through our community hubs or community centers as part of after-school initiatives?
No, there are a small number of student nutrition programs which operate not in non-school settings, in community settings. They've been operating that way for a number of years now. School-based programs are probably the most effective in reaching people because that's where most of the students are. But I don't think anything in the current model prevents us from having programs outside the school setting.
Thank you, Councillor.
Thank you.
Next question. The CFO has an answer to Councillor Layton's question previously.
Thank you, Mr. Budget Chair. What we did is we took all the new and enhanced initiatives that were approved by all the boards and put them collectively as a package in our presentation and in the appendices. So we didn't say, you know, that one should go forward or this one shouldn't. We put them all there. Yes, it would be logical that, you know, the board approved this one. It's 100% funded by the province. That budget committee or executive committee would likely approve those, but we just showed them collectively. And for public health, though, they are in two spots. They are, as you said, summarized on page 98, and then we separated the public health ones that relate to anti-poverty, and we put those and showed them under the title of public health, and they are summarized on page 89. And yeah, page 89 in the bottom of page 88. So.
Okay, thank you. Councillor DiCiano is next to ask questions.
Thank you, Mr. Chair. Good morning, everyone. I'm looking at the capital budget, and on page 10, we look at the reprioritization of capital projects. And I see point number 2, staff scheduling. Project has been canceled as a result of citywide review of IT projects undertaken by corporate IT after considering readiness and capacity in the system. What, can you just elaborate a little bit on what kind of software or technology you could have brought in or you wanted to bring in to help improve your staff scheduling?
So this year, our capital budget, which is entirely IT projects, has been a little different because of a new process that the city has put in place for gating and approving IT projects generally. So some of the things that we had put forward as our priority needs were found through the process to be not a good fit or not ready for corporate investment, or it was found that there was other projects that the corporation was doing in other parts which would meet some of our needs. I think in this case it was a question of staff scheduling a project being out there that could help us so we didn't need to do our own. And we always try and leverage what's happening throughout the city. So staff scheduling, for example, when we are dealing with a major issue or threat, such as the H1N1 outbreak would be a good example, where we had to mobilize large numbers of staff to do something which they don't normally do. Our existing staff scheduling mechanisms were not well adapted for that. And it was really
What were the end results of that? Cost us more, it wasn't as organized, obviously. What were the end results of not being able to be ready?
Well, it was a great deal of work to gather all the information we would need and make the staff assignments to deliver the services that were required in that instance. So it's a question of complexity, ease of operation, and cost.
So if you don't have the right technology, when these scenarios come up, you're running in all sorts of directions. You don't know ultimately, you can't quantify the performance, you're spending more than you should be, and you're telling me that it was basically canceled because of the city's capacity to undertake or bring this technology forward.
That's my understanding, is that there's a city initiative which would address our needs, and as long as we get our needs addressed, that's great. We don't have to have our own project. In fact, it's more efficient if it's done once and meets everybody's needs.
CFO can answer, also answer.
Through you, Mr. Budget Chair, if I can explain. So we have a corporate project in IT for a new time and attendance and scheduling system. It's called TAS. We're implementing that as initially in 2 areas, because it's a brand-new piece of software called Kronos that we're implementing, and we're doing it in Toronto Paramedic Services and PFNR, Parks Forestry. So what we don't want happening, and what would happen before, for example, we have asset work management systems. We got 5 of them. We don't want to repeat that. So we are starting to approach things more on a corporate basis. We've got this Kronos implementation with TAS, the TAS project in 2 areas. We're going to implement that, and then, based on that experience, we'll be rolling it out to other divisions and other agencies where the need exists. We can't do everything all at once. There's limited resources, but what we want to do is a more measured corporate view on how we approach some of these corporate-wide kinds of technology improvements. So we're not saying, no, you can't do it. What we're saying is, not right now, but we will get to it.
Okay, so given the fact that we're spending billions of dollars a year on staffing, and on top of that, billions more to try to deliver services, and the fact that computers came out in, the 60s and now it's 2015, at what point are we going to have the ability to quantify the performance of our division, give our division heads the ability to quantify the performance of their operations? When is that going to happen?
As I said, we are working on some very major projects in IT that touch basically, several divisions. So our new asset management system, that's programmed in the 10-year capital budget. Our new work order management system, that's programmed. And then on the HR side, we've got a suite of projects. I think they're like $29 million. ESS, employee self-service. We have MSS, manager self-service. We have CATS, which is the payroll engine, and we have TAS, which is the time and attendance scheduler. 5 major HR-related, payroll-related IT projects. We just have limited capacity in terms of resources to do it all.
But our division, it's costing us.
We will get that.
We don't know how much extra it's costing us to deliver services because we don't have the technology to be.
We have a number of areas where we know we are technology deficient. We have a capital forecast 10-year of almost $500 million. I think it's like $466 million. We will get to it. We just can't get to everybody overnight.
And in the meantime, we don't know. Okay, so one more question.
In the meantime, they'll run their
Quick question.
Yeah, one quick question for you. Page 25, it says that the below-the-line projects have been reviewed by the Business Executive Committee. Who makes up the Business Executive Committee? Who makes those decisions?
So this is part of the new IT governance process, which we partially implemented for the 14 budget and now ran for a full cycle in the 2015 budget. This gating or IT priority setting process has a number of touch points in it. It starts with the Project Review Committee, then there's another review, and then it goes to BEC. BEC is the CIO, the 3 DCMs, so myself, Juliana Carboni, and John Livy, and who else?
Any counselors?
Oh, and Josie.
Josie.
Anyway, that's your
Okay, thank you very much.
time is well up. Councillor Carroll, you had a few questions, I believe? The briefing note?
Yes, thank you. I thought I would just ask some quick questions about the briefing note, but now I have to get back to it. The trend in expenses briefing note, which I was just looking at. I just noticed a briefing note in there that I hadn't realized was enclosed today. For public health, it's interesting because while we're looking at these expenses, they are also contained in cost-shared programs. So we've got a little more to delve into here. Just so that we're on the record, they don't always work out to a straight 75-25 percentage. I'm assuming that some of these expenses happen in 100% provincially funded programs, a couple happen in 100%, the two 100% city funded, so that's the reason the breakdown is a bit different?
Yes, it's difficult to interpret these when you look at it on the global basis for the
Yeah.
gross budget because of the different funding models. What we've done in the briefing note is we've taken out the municipal portion, so you can see the impact on
Yes, I
the
see
municipal
that,
budget
this part,
of trends,
yeah.
yes.
Yeah. So the question is, does somebody make sure to track things like, for instance, conference travel, if the conference has to do with something that we're doing because we do it on behalf of the province, but, you know, doing the intergovernmental work means going to a conference on that topic, is that something that we can go to the province to for the funding? Do they share in the funding of things like that?
Yes, absolutely. The province funds its share of the cost-shared programs, which includes things like staff learning and training and development.
Right.
And in the 100% provincial programs, they have their own 100% funded budgets for some of those things.
Oh, okay, so we don't end up absorbing the capacity building then?
No, we're not subsidizing
with
the
the
province in
training.
this area.
If the training is dental training, I guess we've got to do it, but if it's training in something, we're delivering a visually impaired program for them, if there's training in that regard, they cover it.
It's funded by the funder, in that
Okay.
case is the province, yes.
Okay, I just wanted to make sure of that. Thank you. Thank you.
Thank you, Councillor Carroll. Seeing no more committee members, we'll go to outside councillors. Councillor Cressy, to begin.
Thank you very much, Mr. Chair. Through you, just a few questions, if I may. The first is on the operating budget request. So my understanding is that the Board of Health approved an operating budget request of $249 million gross and $59.158 million net. That's what the Board of Health approved. But what I see proposed here is $56.942 million net. When did this change happen? The Board of Health approved a request, and somehow it has dropped by nearly $3 million. When and how did that change happen?
In past years, there's typically a city manager recommended budget and a Board of Health recommended budget, which are not always identical. And City Council makes a decision. This year, what you're seeing, I think, is a preliminary budget which excludes, in the case of public health, excludes all the new and enhanced requests.
So if I can understand that correctly, then you had gone through 4 new and enhanced areas.
Yes.
Around gapping, student nutrition, the day nursery immunization, and the Toronto Urban Health Fund.
Correct.
So are you saying that the Board of Health approved a budget request that included all of those, and that the city manager directed you to take those out?
No, that's not the way it works. But yeah, first part of your question, yes, the Board of Health did approve that request.
And sorry, did the CFO, was CFO coming in on that to explain?
Mr. Budget Chair, I just want to clarify. So I thought we were very clear on what we did. So we approved everybody's base budget is here for council and budget committee, executive committee consideration. Then what we did is all the requests for new and enhanced, because we couldn't meet the budget guidelines that were set by budget committee, we were very clear on slide 30 of our presentation of myself and the city manager. We were very clear. Here's all the requests from departmental new and enhanced, and here's everything that all the boards and agencies have approved that aren't in the base budgets that are new and enhanced, and they're here now for committee consideration. They were highlighted on page 30, and we did all of them. We did the TTC, the
okay.
public
So-
health.
So that's part of the
So
67
we're
million.
not saying yes, we're not saying no, we're saying
Yeah, so that's not the base budget pressure. You're saying that's the 67 million on top of that as part of the new and
yes.
enhanced?
Yes.
Thank you
So
for the clarification.
The difference is what's in that new and enhanced.
No, that's great. Back to you, Dr. McEwen. On the analyst notes on page 7, it was looking at the proposed budget around staffing, and it noted that the TPH staff would have a reduction of 11.4 positions. Can you provide an overview of what services programs are losing those positions?
If I remember correctly, there is some fluctuation in FTEs that occurs as a result of capital-funded positions.
Yep.
There are no reductions, if you like, in base budget staff positions that are part of the operating budget. But we do see, as a result of changes in the capital IT projects from year to year, that the number of staff required to support those projects changes, and that accounts for most of the fluctuation.
Most of the fluctuation. No programs or services are impacted by that decrease?
I'm reminded there's one other thing. We did have some positions that were one-time for Pan Am, which have also been removed from the budget, so that contributes a portion as well.
All right, thank you. I want to come back then to the new and enhanced in those 4 areas. And thank you to our CFO for the clarification on that. First of all, just on student nutrition, we have, is it a 4-pillar funding model that has been approved by the city? Is that correct? Where we have the federal government, the provincial government, the city, and others at a certain percentage we're seeking for each partner to contribute?
Yes, it's actually 5.
5.
There's all 3 levels of government, plus the private sector, and then local contributions from the school community, which include parent contributions and some very local fundraising.
And so on that 5-pillar model, then, the city's contribution is intended to be 20%, is that right?
At the end of the 6-year period, yes.
All right, and so where are we at the end of the 6-year? Was it previously a 5-year period?
It was a 5-year period, and we were asked to revisit that, which we have done, as I explained. So we've extended it from the previous 5-year plan would have ended in 2017. Now it goes out to 2018.
Okay.
And the target is a little bit higher because of increased provincial investment. We wanted to make sure that each of the school programs had both provincial and municipal support.
So we've already extended the time frame from 5 to 6 years. And in order for us to continue on the now longer time frame to meet our target, we would have to identify additional money, as this is now in a new and enhanced. Is that correct?
Yes, additional funding would have to be identified in each of the last 3 years, 16, 17, and 18 of the plan.
All right. And then just one final question here related to the student nutrition. So I just want to pick up on my colleague and the chair of CDR's questioning there. So the intention of the student nutrition program is to enhance the health of kids, in particular low-income kids. Now, I understand there's some concerns around access, public and private. If we had a full complement of funding, if all 5 partners were contributing their 20%, would we be in a better position to look at expanding access?
In general, yes.
So if we had additional funding, if we were meeting our targets, in fact, if we went above our targets, we would be able to more reasonably look at expanding access.
I don't think it's this funding plan doesn't contemplate that we would necessarily have a program in every school, but we want to make sure that the program is accessible to every child who could benefit from it. So within that, how you allocate should be based on need, should be the most important category.
Thank you.
Thank you very much. Deputy Mayor McConnell is next.
Find my microphone. Thank you very much. And thank you, Dr. McEwen, and thanks to Public Health for all the work you've done. I wanted to just look at some of the deliverables that are within existing, and then I'd like to look at what you did with your money last year, if I could. So within existing, there's some expansion. Is that right, of the dental program? Where did I see that? Yes. Is that right?
Within the existing budget, the base budget,
Yes, yes.
I don't believe there's any expansion of the municipal dental program. There has been a significant expansion of the provincially funded, 100% provincially funded program for low-income children over the past several
So what
years.
I have in my notes for service access that you're looking at is dental service expansion for Ontario Works. That's not you, is that the province that's doing that?
Well, I think you may be referring to planning work that's being done between Toronto Public Health and
Yes.
Toronto Employment and Social
Yes, sorry,
Services.
that's what I was getting at, yes.
Looking for ways that we may be able to expand
Right.
service access. Yes, that would be different ways of delivering services,
Yes.
which may be possible as a result of changes being made to programs for dental at the provincial level.
Perfect, yes. So
That's in
I'm
the
sorry,
planning
I asked it incorrectly. What I meant was, I was looking at the kind of deliverables that we're looking at getting this year through other service improvements. Okay, so that's that. In terms of the urban health, is that an expansion of the program or an enhancement to the inflationary cost of the program? I just wasn't sure.
It's both. There is a small amount for to keep up with the cost of inflation, but the board approved in 2014 a 5-year plan to expand that program.
Yes.
from 2015 through 2019.
Right.
So this would be the second year of that expansion is
So
one
we
of the
should see
requests.
this coming up each year because it's a
Yes.
five-year plan?
Correct.
And how many HIV programs do you have? Is it 1, 2, I just don't know.
Well, the Toronto Urban Health Fund funds programs delivered by community agencies in the areas of HIV prevention, drug use prevention, and youth resiliency.
Yes.
And the number I don't have in my head, but it's certainly, there may be 20 or 30 or 40 programs
Yes.
between those three streams.
And would
which
you
are
be
funded.
able to get me that list at some
Yes, of
point? I
course.
don't need it right now.
Yeah.
That would be great. And thank you, that's another good piece. In terms of last year, last year you were funded for the mobile food market. How did that work?
That expansion is in the works.
Yes.
And would be expected, I think, probably to double the capacity of the program by the time it's complete.
Great, great. So it's been quite successful. You've been able to use the money and you don't need any further enhancement at this time.
Well, I think the program enhancement in 2015 was an enhancement of an existing pilot. So I think as we get more experience with the program and see how it works on a larger
Yes.
scale, it's possible that we may identify a benefit to expanding it, but it's not in the 2016 budget at this point.
That's fine. You have some, within your budget, some work that you've been doing for seniors and for youth, for Aboriginal kids. I saw a great program that you were doing. In terms of that ongoing work, would you be able to identify a few of those in terms of the poverty reduction that you have been, because I think you've been doing a really good job of that, but it hasn't been, if I could say, top of mind. We haven't been able to kind of put it in our notes. So would you be able to give us a quick briefing note on that at some time, even if it's just to me, not to the committee?
I would be happy to provide whatever information you like. I think,
Yes, that would be
given
helpful.
what we know about the very strong relationship between income and poverty and health
Yes,
outcomes,
exactly.
it's possible to view a large portion of the work we do as being poverty mitigation.
Yes, I understand.
You know, because
Yes.
we are mostly working with people who have high needs, and many of those people are at the low end of the income.
I understand. I was more interested in what the new programming is as we're moving forward to look at the poverty reduction strategy, because food and health were very much part of that. And I see that also there's an enhancement, and I wasn't sure whether it was yours that was being asked for, which is, where was it? It was around a food incubator. Is that you? Are you doing that, or is that somewhere else that is doing that work?
Yeah, I don't believe it's within our budget.
All right, that's fine. And then on your...
Last question.
Last question is around student nutrition. And so I'm understanding that we're now in year 16, which would have 2 more years. I wondered why the inflationary number this year was only 109, but last year was 400, well, give or take. Given the expanded cost of food, and if you'd like to explain that and when it is and how it is that you'll get to 20% in the 3-year period of time. Thank you.
Each year, as a provincial requirement, we conduct a survey of the cost of nutritious food in stores in Toronto. So we have a very good inflationary number. It's not a number that's Canada-wide, it's local. And that's the number that we use to inform the ask in terms of the student nutrition program. So it was only 1.3% this most recent year. At other years, it has been as high as 4 or 5%. But
Yes.
we do what the data tells us in terms of inflation.
Excellent. Thank you very much.
Thank you very much. Councillor Doucette for questions.
Thank you very much. Sounds as if student nutrition is going to be one of our agenda items ongoing. I just want to confirm on this one. Well, we do have a 6-year plan. I mean, anyway. The cost of inflation of the food and the program we are providing right now, is that in our base budget, or is that going to be one of our enhancements we're having to recommend?
That's the enhancement that the Board of Health has recommended, the $109,000 that was referred to in the earlier question.
Right, so the board's recommended it, but it's not in our base budget. I'm getting a nod from there. I thought that was. Okay. Would you not feel that student nutrition would come under poverty reduction?
Well, I think it certainly is a component of poverty reduction, and it was considered that in part in the 2015 budget by City Council.
Just wanted to make sure, because I know that, there's a poverty reduction, seems to be a poverty reduction budget, and there seems to be a Board of Health budget. The day nursery immunization, this is something which came to us last year. We've started it in a 2-year phase. Am I correct that the province says we should be doing this, and yet up till now we haven't had the funding to do this?
Yes, it's probably our most significant area of non-compliance with the public health standards provincially. So we have, there have been years in the past where we've tried to put in a budget request, but it's a significant size program, so it's difficult to accommodate. We decided in 2015 that we really needed to put it back on the table, and we did get an initial investment from City Council, which enables us to take the next step, and that's what this year's ask is about.
And this is a shared cost program with the province?
Yes, it is.
So again, this is the second year of a program. It's not in our base budget. It's one of our recommendations of a program which should continue because actually it's mandated.
Correct.
Okay. I'm actually going to leave it at that because of everyone else asked wonderful questions. I do just want to point out, and I want to compliment Councillor Layton for being able to read the service level charts. At my age, I can't read them even with good glasses. So congratulations, Councillor.
Thanks a lot. Councillor Burnside next.
Thank you, Mr.
You suffer from being young.
Thank you, Mr. Chair. My question comes back to the gapping. You talked about reducing to historical levels. When was the last time the gapping was 4.8%?
To be clear, historical budgeted level.
Okay, sorry.
We budgeted at 4.8% for many years up until 2015 when we increased to 5.8%, thinking that we perhaps would never be able to achieve it.
Okay.
And we were surprised by our success, and in fact now can get down to 4.8% or maybe even a little lower.
When was the last time we were actually at 4.8% though?
Early 2015.
Or early 2015?
Yeah.
And so for 2015, it went up to 5.8?
In the budget, yeah, we budgeted at 5.8% because prior to that, the lowest level in recent memory was about 6%. So we thought.
No, I understand budgeted. I'm talking about actual.
Actuals were all well above budgeted for a number of years.
So actual, when was the last time it was 4.8%?
Before this year, not within the past. No, but before 2015. Not, you'd have to go back 5, 6, 7 years, probably, or more.
So what's the push to go from 5.8 to 4.8?
Because we now see this as our natural gapping level with the improved hiring and recruitment process. And if we don't reduce the budgeted gapping level, we won't have the funds to keep those positions filled at that level, which means there's an impact on service.
But to maintain service, you'd stay at 5.8, correct?
No, we'd like to maintain service at 4.8 because it's a higher service level and the service level which we were planning for through the budget process up until 2015.
But you'd be enhancing service if you reduce gapping because you haven't been there for however many years.
Yes, it would be. It's true. It would be a higher service level than the years where we were massively overgapped. Yes.
Okay, thank you.
Yeah.
Thank you, Councillor Mihevik.
Thank you. I'm going from that chair to this chair as going from defense to offense here. This is this is a question to our CFO. When we have a multi-year, say, IT program, and we decide in year one that we're going to do it, but it's multi-year, it does not show up as a new and enhanced in year 2, 3, 4, and 5. In this particular case with the Board of Health's budget, the Urban Health Fund and the Student Nutrition Program have been approved, reapproved, multi-year approved every year. And yet it keeps coming back as a new and enhanced. What motion do you need to stop this so that it doesn't get looked at and re-looked at and re-examined and frankly, over the top, navel-gazed, year in and year out?
So I think I heard 3 questions through that, and I will tackle them.
2 of which were rhetorical.
So through you, Mr. Budget Chief. Capital is totally different than operating. We have a cash flow budget, and when we approve a multi-year capital project, we actually have in the capital budget resolutions to approve is, okay, approve $5 for project X and approve 100, and so approve $5 for project X in 2016 and approve $100 for all of project X over 15, 16, 17, and 18. We actually get those approvals up front so that you're committing to not just the first year of a capital project that happens to be multi-year, but through the life and completion of the capital project. So that's the difference between capital and operating. Question one, sorry, your third question is, what do you need from a resolution approval? There are some, very few, because it doesn't happen often, where there are new and enhanced programs that council approves on a multi-year basis. There were 2 or 3 of them. We've included them in the budget. They were the Swim to Survive, and off the top of my head, I can't remember the first one. Most multi-year plans that are associated with a master plan, like the fire plan, like the plan to improve paramedic response services, they are done on an annual basis for the allocation of those resources, but there is a plan that we're trying to get to. So for example, on the paramedic services, there was a plan to increase response times. There was a plan to increase by some 50, 52 paramedics each year, but it was done subject to the annual budget approval process. This is similar like that. There's a multi-year plan subject to the annual budget process. If council wants to just pre-approve something, it's not a best practice because you want to look at things in their totality with competing resources, but certainly that's within council's purview if they wanted to do that.
There may be suites of things that we would want to approve year by year, but I think there are things that maybe this is a policy question. Do we need a policy mechanism where council does want to approve something but phase it in over a multi-year period? Do we need a policy mechanism that says, okay, this belongs in basket A, not subject to annual approvals, but part of the base budget on a go-forward basis?
So through you, Mr. Budget Chair, we actually do that through our multi-year budgeting now. So we have a 1-year budget, we have a 2-year outlook, and we're showing you the impact of things. I think what you're really saying is pre-approve it. And what we're saying the best practice is really the practice that we have right now. You have multi-year plans, we do a multi-year budget, and we show you the impact, and you take them 1 year at a time. And you approve your first year budget, and you approve, in this case, 17 and 18 would be as an outlook. If council wants to start pre-approving some things, it's council's discretion to do that. But I think it's always best that those are done at budget time when there are, like this year, we have some $67 million of priorities on the table, and you know how many you want to fit and how you fit them in and how you pay for them. The discussion really should be happening at budget time when everything is on the table. To try to tackle things on a one-off basis, that's not something I would recommend. Peter may, I don't think that's something that the city manager would recommend. That's what the priority setting process of the budget is about.
Thank you. And just on that too, we are looking at attempting to get to a multi-year budgeting process, and I think it's going to take 2 or 3 years to get there, but it incorporates a lot of what you were talking about. But we are I think, in the process of trying to get to that point system-wide, you know, as opposed to the one-off. So we're in that process, but it's going to take a couple of years to get there. I think there was a request for round 2, so I'm going to ding the bell. Round 2, Councillor Carroll.
So, can I ask, the answer that you gave just now was a very full answer, except that it starts after the decentralization of CPIP. If we go all the way back to when CPIP was centralized and student nutrition was included on that page, it was during that time that there was an intergovernmental driver to this. the province released their strategy, they were going to begin to bump up funding in substantial amounts. And the medical officer of health worked to make sure that we understood what they were going to do. We were going to match it, which gave them the confidence to get into the game in a much larger way, so that we were trying to achieve some parity of what we were putting into it. And at that point, it felt a lot more like an operating concern. It was at that time that council directed that everything in CPIP exclusive of student nutrition would get an inflationary increase, because prior to that it hadn't been, and some agencies were simply going out of business without addressing inflation. So we said we were going to do an inflationary increase to the CPIP envelope, and student nutrition was going to have these multi-year increases that would keep pace with the province. It seems as if it was at the moment that we started to decentralize the various components of CPIP that we just sort of dropped having a strategy and stopped thinking of this as an operating pressure that's there, because there is growth. Back to my argument yesterday that there is an operating impact of growth. So if we want this to be looked at more like an operating concern than a capital concern, aren't we looking at a resolution that's something along the lines of there's a standing order for a capital from current contribution that goes to student nutrition that keeps pace with the province?
Through you, Mr. Budget Chair. So this is, it's not capital, this is operating. But if council wanted to then say, perhaps deal with...
But you're treating it like a lump sum capital program in the answer you gave before.
We're dealing it with as every year the expansion
Yes.
is a new initiative. We're dealing it that way. If
Right,
council
so while
wanted-
not technically capital, you're sort of taking a capital approach to it.
an initiative approach.
Yeah.
If council wanted to say, you know what, I want to treat this a little different.
Yes.
I want to do the inflation is automatic and pre-approve that and give us the direction to do that, to automatically put in the inflation cost, certainly that's within council's purview and we could do that. If council wanted to commit in advance on a multi-year expansion of the program, again, council can do that if it wants. What we're saying is, and I can see a rationale for dealing with the inflation part a little differently than the expansion part.
Okay.
What we're saying is on expansions, I think the forum to do that is at budget time.
But may I ask, certain things, when we adopt them through the year in council, that's a council directive and we do them. When we get a report from Board of Health about student nutrition and we adopt it, is that not our direction at that moment? Because we do that throughout the year.
There are many, many master plans that are adopted by this council. And we are in the process of preparing our long-term fiscal plan and trying to quantify some of that. If we did everything, you will not be at an inflationary tax increase. You just won't, because there's so many plans, both operating and capital, that have been approved by council as master plans. But most of those master plans, the direction is, and the wording that I've seen is that we bring back, we approve a general goal, a plan, and we approve the resource requirements to implement that plan every year during budget time.
Unless it's transportation. I'm sorry, did I say that out loud?
Thank you. Any other questions? Councillor Doucette, you had some more questions?
Just one quick question. We just heard that if we wanted to put the cost of inflation into a program, it's council can do that. How do we do that? How do I do that? What motion do you need?
Pass a resolution to that effect and get it approved by council. And we could help you with the wording.
Okay, thank you.
Thank you. Seeing no other questions, Dr. McEwen, thank you very much for your presentation and the questions. Okay, the next set of, agencies coming up, there are no presentations that will be happening, but we'll be taking questions. So what I will do is I'll run down each of the, I'll run down them very quickly to see if, because we have, there's a number of people in the room, they may have to move around. So let me run down, and hopefully you have questions that you already have prepared. So Are there any questions on the Association of Community Centers? Okay, seeing none. Next are Yonge and Dundas Square. Any questions? On the Yonge and Dundas Square? Okay, I'm just gonna, so what I'm doing, let me run down quickly. Arena Boards of Management, are there any questions? Civic Theaters, are there any questions? No. Okay, seeing it, so we have Yonge and Dundas Square. If you can please come up to the mic or wherever you're at, I don't know, the representative from Yonge and Dundas Square, and Councillor Pasternak, I believe did you have a question for Yonge and Dundas Square? You can go ahead with your question whenever you're ready. Councillor Pasternak, you have the...
Yes, thank you. Thank you, Mr. Chair.
Can we have, excuse me, can we just have, I know some people are moving around, but can we just sort of do it quietly so we can hear the question? Thanks.
There were media reports this fall of a group, I guess it was a Christian evangelical concert that was denied a permit at Yonge Dundas Square. I'm just wondering whether you can provide any details of that, because we're relying on media reports, and whether it contradicts in any way the City of Toronto's anti-discrimination policy.
Okay, I cannot give you any details on that. I know it went, the group gave a presentation at the December 10th board meeting, and I have not seen the minutes of that board meeting at this point. I was not at the board meeting. So as far as I know, it's still in discussion, and there's going to be a follow-up with that group, but that is all that I know at this point.
Is it rare that Yonge Dundas Square denies permits based on the content of the presentation, or is this a one-off or a growing trend?
No, I don't think that I think it is rare. We have guidelines, and as long as the organization follows those guidelines, a permit can be issued. I am not overly familiar with exactly why the permit was denied, so I really cannot give you a full answer on that.
Right. Now, this group had this festival or series of concerts had occurred for several years prior to.
Yes.
So they were they met all their rights and obligations in the past.
I'm not so sure that they did. I think they were warned on numerous occasions, if I am correct on that. They were warned, but this time I think that when they determined what was going to be going on, they decided to not give a permit.
Councillor, I'm giving a little bit of leeway here, but can you focus your question on budget items, please? This is, again, give me a little bit of leeway here, but really this should be directed towards budgetary
Yeah,
items.
our agency boards and commissions are obligated to follow the city's new anti-discrimination policies. So, and much of the funding is contingent on that. So, I wanted some points of clarification, but I'm done.
Okay. Councillor, any other committee members? Seeing none, Councillor, oh, sorry, there we go, Councillor Layton for a question.
I note that in the issues impacting the 2016 budget, the top one seems to be competition from other civic squares, which I would note is probably a pretty good problem for a city to have so many beautiful public spaces, that competition between the two to attract the revenue from fees is a good problem. What could we do to address that to make it better for all the squares? How could we coordinate this so that it wasn't a competition, but in fact the squares were working together.
Well, my understanding is that the other squares don't charge permit fees, and we do. And so what happens is people come to us and then they determine that it puts their budget way over, so they'll go to Nathan Phillips Square as opposed to our square. I think that if they all took on the same model, where there were permit fees and costs associated, that it would probably then at least level the playing field.
But other squares also don't permit some corporate events. And that would be where Young Dundas Square would sort of have a corner in the market.
Okay, that I'm not aware of. Sorry, I don't know what's allowed at other squares.
Okay, thank you.
Okay.
Thank you, Councillor Layton. We'll go to outside councillors. Councillor Fletcher has a question or two.
Yes, just following up on that, but if the other squares are entirely public venues and public space, Young Dundas Square is not in the same, made from the same shape, is it?
Yes, that's true.
It's more, how would you describe it?
It was a new model when it first came into being, and the intent was, if I recall correctly, the intent was that it was to become self-sufficient and self-supporting. We were just trying it out. I'm not sure what they called the model, but it's governed by the board, and they determine what the rates are and so on every year.
Is it a city board or a hybrid board or a corporate board?
It's a public board, as far as I know. I mean, the councillor is on the board too, but it is made up of people from all across the city.
So maybe we should actually find out a little bit more about that governance, because you're suggesting that other squares would meet your model. Someone might suggest that your square meets our model, which is a public square, but the governance model wouldn't match that. Would you agree?
Yeah.
I just wondered about your revenues from advertising at Young Dundas Square. How much are those a year?
Our revenues from
Yes.
advertising? That would probably be our sponsorships, because we don't really advertise to get revenue. But we do have sponsorship revenue, and in 2015, our actuals should come in at $245,000, and it was the same in 2014.
Okay, thank you. And are there any requirements regarding just public space here? I just want to very particularly ask you about the Virgin advertising on the Dundas flankage.
Right.
Which actually prevents the public from seeing into the square. Is that part of your sponsorship revenue?
That is something that was negotiated in their contract. So they negotiated a contract for certain brandings across the square.
Virgin did?
Yes, they did.
As part of their sponsorship. And what is their sponsorship amount? It is not the full 245, it is the lion's share. I'm going to say it is around 200. Okay. And is there anything within Young Dundas Square, governance-wise or in your criteria, that would suggest that public space should not be blocked by advertising, given that it is a public board overseeing public space, albeit bringing in revenues?
I'm sorry, could you repeat that
Sure, I
question?
can.
Yeah.
Is there anything in the criteria for sponsorships and placement of advertising that would suggest that sight lines, that public space should not be obliterated or obstructed by an advertiser or a sponsor?
No, I don't think there is anything.
You have no guideline as to
Well,
where some-
there would be a guideline as far as what they would be allowed to do, and as long as they met those guidelines. I mean, I don't think it's so specific that says you can't put something up on the barrier kind of thing.
So, yeah, just questioning now, if Young Dundas Square has a guideline regarding
Right.
the viewing of the space by the public, the sight lines, the viewing of public space, you don't appear to have that.
I would say they probably don't.
You don't?
Yeah.
So, okay, thank you very much. And have you ever checked with the police or anybody else on the SEPTED as to whether or not public space of that nature should be obliterated by opaque advertising?
I'm going to say no to that, but I'm going to just ask you, do you mean like those, the signage that?
I mean, all the signage that prevents you from viewing the square from...
I'm going to say no at this point.
And of your total budget, the $245,000 in sponsorship represents what percentage?
Oh, goodness. I don't know off the top of my head. I'm sorry. I would have to get back.
I know the answer to that, Mr. Chair.
I think some of these questions probably may be better directed towards the board, just as, they're not all budget questions, and we can maybe deal with some of that offline. Thank you.
Well, that is a budget question.
The last one was a budget
Last one
question.
is, and
Last one
therefore,
was.
if you need that much money, if it's,
Anyway,
or do you obliterate space?
thank you. Thank you very much for...
I will get back to you on that.
Thank you.
Okay, thanks.
Next, we're going to take a 5-minute recess. We have Cluster B coming up, so why don't we just, because there's going to be some movement around, getting them all organized to do their presentations, so why don't we take a 5-minute recess? We'll be back in 5 minutes. I just, before, we're doing a break, but when we come back from break, I totally forgot about TRCA. I apologize, they're sitting at the back there, smiling. They thought they were done, but we may have some questions on you, so we'll come to you right after the break. I do apologize about that. Sorry about that. Well, I'm not sure.
One chance here. Somebody's here.
Can I have all Budget Committee members please take their seats so we can begin the meeting again? Can I please have all Budget Committee members come back to Committee Room 1 so we can begin the meeting? Thank you. Okay, we're back in committee. Before we get into Cluster B, I had overlooked asking if there were any questions for the Toronto Region Conservation Authority. So if everybody can please take their seats. Are there any questions of the TRCA, Toronto Region Conservation Authority? There are none, so now you can officially leave. Thank you very much for being patient all morning. Okay, we're going to start with Cluster B presentation. If you weren't here yesterday, what we'll be doing, Cluster B, DCM, Livy will be doing a presentation on the entire cluster. And then we'll get into questions of each of the individual divisions that are based or made up of into Cluster B. We will take questions on the basically the presentation on the overall cluster, but make sure if you have questions on that, it's strictly on the presentation, not specific divisions, because we'll get into that when we get into the questions. So, Mr. Livy, I will let you begin your presentation. I think everybody has copies of it, and It's all yours.
Thank you, Mr. Chair, members of the committee, members of the audience. Here to present Cluster B's preliminary operating budget, capital budget for 2016. We'll give you an overview of the budget, the service performance, the preliminary operating and capital plans, and I have some additional information and appendices if you need it. Here is the overview of the chart of tax-supported Cluster B. So just to be clear, we're talking about the bulk of Cluster B, but we've already dealt with the two rate budgets. So in terms of scale, the total cluster is 9,150 employees. 2,862 are in the rate side, and the remainder, 6,309 are in the tax-supported side. And you can see that those divisions here. You'll also see the org charts with the traditional view of our Cluster B divisions. I just point out that 87% of the positions seen here are frontline union positions in both 416, 338 in firefighters, and Local 79. Here's our staff trend excluding capital positions. And you can see that in 2008 we were at 6,188, and today the numbers are 57,878. So basically it's fairly flat. In 16 there a 15.7 position increase occurred primarily due to 7 new engineering construction services for Bell Smart City, and new positions for Toronto Building based on an Auditor General's recommendation on infill construction coordination, and 5 positions from Toronto Building will be transferred to Capital, as I'll explain in more detail in the presentation. The vacancy analysis that you have shows that our vacancy rate has declined from 6.3 in 13 to 4.5% as of December 1st in 15. Transportation, engineering, and construction continue to have issues with retirements and transfers to other divisions, and we've got an accelerated hiring program that we're attempting to expedite there, but we really do have a problem with a limited supply of top caliber talent in key business areas. I would say that a couple other points here. Last year it took us 86 days to fill a job. This year it's 67 days. It's getting better, but there's still significant numbers of people that are positions that are not filled over 75 days. Was 45% last year, now it's 38%. So we continue to work with our colleagues to try and get those numbers down and those vacancies filled. In terms of service performance, I'll spend a little bit of time on this slide. We very much we're committed to finding efficiencies in the organization, continue to do that. Continuous improvement is part of our mantra in Cluster B, as it is in the other divisions or other clusters. We track our key performance indicators on a monthly basis. I have a report that I get from each of my division heads on a monthly basis on KPIs. You see a snapshot of that in the budget. We've had success in MLS, ECS, and building and finding 2% efficiencies. That was the target. For example, MLS created a dedicated team of 6 specialized enforcement officers to respond to hoarding and complex property issues. MLS also consolidated offices, reducing 50 dedicated desks to 25 share desks. ECS achieved efficiency by reducing reliance on external engineering services and brought some of that work in-house. Toronto Building has achieved great efficiencies through the electronic service delivery. I'll touch on that in a minute. Transportation has increased the capital program delivery by 34% without adding additional staff. And in 2015, PPF&A found $500,000 of cost avoidance by improving automated account receivable processes involving 25,000 transactions. The next series of slides are accomplishments that I wanted to highlight quickly for you. I'm not going to read all these slides. You have them. They're a snapshot, a quick overview of the accomplishments. They're kind of the peak of the mountain of work that staff do in Cluster B. So I'm not going to read out each one of them. but they are an indication of the exceptional work of staff in the cluster, supported by other clusters, colleagues in Cluster A and C and the agencies that we deal with on a regular basis. So, for example, here in Pan Am, we were very active last year in Pan Am. Much credit goes to the staff for a flawless execution on fire, building, all kinds of things that happen behind the scenes. I can't tell you how much work went into this, and it was really literally flawless. So great kudos to everybody that was involved in that. City planning reviewed a lot of things. You can see the numbers here. And I think this is indicative of the demands of staff in the cluster. The supply of resources that we have, time, money, and talent, is far smaller than the amount and demands that we get for extra meetings, more reports, all that kind of stuff. You know that, but just to state the obvious, there is a great deal of pressure and demands on staff, and the resources that we have are constrained and limited. And I think you really have to thank staff. I want to thank staff for tremendous efforts above and beyond the normal call of duty that you all witness during the year as members of council and as the public. They've done some tremendous work, and city planning is a good example. Here you'll see that they provide a high quality of service, both quality and quantity, and it's evident throughout the division, and you could see some of the reasons and accomplishments last year. I want to add one more thing about city planning, and that is that we've taken on the front-end role of transit planning consciously, aimed at achieving good quality outcomes. You're going to see a lot of that this year on Smart Track and Scarborough Subway and Relief Line and other transit network improvements that are coming back. We're rooted in strong public consultation, strong use of analytics, and we're very much working hand in hand with the TTC, Metrolinx, our federal and provincial partners, our colleagues in the City Manager's Office, Finance, Transportation, Major Capital Coordination, et cetera. So I'm very proud of the work that city planning and the others are doing in this area. Fire service is another area of great distinction this year. We've improved our overall response time. It's made up of a number of improvements, particularly in getting our emergency calls down to less than 60 seconds. This is a North American accomplishment. This is significant work on the part of the fire services, the chief and his staff, to make some big improvements there. We've achieved turnout time, getting people onto the trucks and out of the thing faster. And we had a modest, minor increase in actual total time, because travel times are always challenging in a busy city. Municipal licensing and standards. This is the division with all the easy files. That was a joke. It's not the easy files. They've got all the hard files. I just have to mention taxis, noise, street food, hoarding, property standards, and animals. And there's more than that, but I got to say that these are difficult, problematic issues. We presented 20 substantive reports through committee last year, and many of these, as you see on the slide, make a difference to the people's lives here in the City of Toronto. I think we're catching up with the times in MLS, and we are now anticipating the next generation of change in a positive way. It's been something that we've been working very hard at, and a great kudos to MLS for taking on these big files and delivering substantive progress in these areas. Key accomplishments in policy planning, finance, and administration. This is our back end. We in Cluster B have a back end administrative function and paying invoices and credit notes and transactions and payroll. And this is a group that is dedicated to improvements in both using technology and processes, and they've made great strides in 2015. Engineering construction services. Last year was a big year. We haven't got the final numbers in, but we're going to be over 80%. As you know, they deliver the major capital construction projects that involve transportation, water, all the other services that go on in our plants, et cetera. And we've had strong project management there. You can see some of the compliance now with the bridge conditions were 100%. And the last item of the implementation of the F.G. Gardner Strategic Rehabilitation Plan, the accelerated rehab program, is well underway. You'll stay tuned for more information and reports in 2016 on that. Toronto Building, I would say ECS, or sorry, Toronto Building, that e-service delivery has hit its stride. And now over 50% of our applications are coming in electronically. It's providing the confidence in other divisions to take up the challenge. So planning, ECS, and other divisions will start to be adopting similar platforms for e-services. And finally, transportation. The Transportation Congestion Management Plan was approved in principle by Council. You can see the retiming of almost 2,400 traffic signals, traffic monitoring cameras. We're using devices, existing devices better. Extra cameras are being installed. We're working closely with police, TTC, et cetera. So many, many things on congestion busting has been on our agenda in 2015. And just to give you a summary of the operating budget variance, all divisions except for transportation will be on budget by year end. Transportation has faced an extremely variable cost problem over winter maintenance. We had a much longer winter last year, and it's cost us additional money. Utility cut repairs are still problematic. We are making strides, but it continues to cause us grief, and we are working hard with our partners on that. I have made some significant progress in terms of agreements on that, but have yet to fully implement it. And Ontario One Call has caused us all kinds of problems because of the timelines and requirements, and we will be addressing that in the 16 budget. So for 2016, in terms of the priority actions, key service issues, under city planning, we'll conduct additional avenue area studies, heritage conservation district studies and plans as requested. So we've annualized the 8 positions in city planning for that work. We're proposing an additional staff to meet the requirements of Bill 73 for Section 37 community benefit contribution and expenditures. So we need somebody to work on that. We would use the Section 37 interest to do that. In fire services, we continue to work towards getting to fire insurance grade 2. You'll recall we were at 3 with a warning we might go to 4. We got it back onto 3, stabilized it. I'll talk more further about some additional initiatives there. And I would also note that we put the dynamic staging and predictive modeling tool in place. It's actually now operational, and we're looking for additional technological devices to help us with monitoring how we get to fires. Municipal licensing and standard, we continue to advance service delivery. Uber /taxi / Boulevard Cafe, noise, et cetera, all coming forward. We're expanding our hoarding and derelict properties efforts. The last one, developing alternative response mechanism to non-life safety complaints. Some ideas about mediation with neighborhoods, issuance of advance notices, I think is important to us. We're looking at cross-training staff on illegal dumping, dogs off leash, et cetera. We're expanding our public education programs on dog ownership, tenants' rights, ground transportation. There's a whole series of issues around things that are provincial and federal human trafficking. We're looking at continued transformation of our business operations in the back end in terms of licensing. And PPF&A will help MLS and all the other divisions with that and continuous improvement. Engineering construction services, you can see on the slide, we've got a number of projects underway. The rehab of the Gardner is probably the biggest single thing, and in the budget we are looking for funding to support that effort so that the project management is solid and reliable. We've also now, I think, are in good shape on integrity of city infrastructure, but there is continued oversight and review of construction undertaken by Metrolink required, and they're giving us some money to help with that as well. The Bell Canada rollout is of Smart City program is being supported through money from Bell. In Toronto Building, we are going to sustain high volumes of building permit applications. Like I said before, we were up 18% last year. We're working with 311 to clarify some of the back end on incoming calls. Transportation services continue on construction, congestion management. I'll get into that, and you'll see that in a little bit further. Winter maintenance, now we have the new contracts. We plan on providing additional cycling infrastructure And we want to support that with some staff to deliver the cycling plan and some of our key initiatives. Okay, so here's the numbers. You'll see the bulk of the cluster of $1 billion operating budget are in transportation services, 36%, and fire, 41%. Most of it comes, 63% from property tax, the rest from user fees. The big ones are building permits. So Toronto Building's supported by its fees, 61 million. City planning supported about 45% by its fees on applications and development, the rest taxes. Transportation has a smaller proportion, 45 million for utility cuts, pavement degradation, lane occupancy, parking permits, et cetera, 20 millions. Sundry revenue, you can see them here, and MLS has $27 million in business licenses and animal service licenses. So here's how we did on meeting directives around the budget. With respect to the 1% reduction target, all the Cluster B divisions meet the target except for transportation, which is just under at 0.1% minus, and fire, which is 0.5% increase over 15. Transportation is incorporating the impact of the new winter maintenance contract, so that's the pressure that causes that, plus some street lighting pressure and traffic signal coordination study pressure. Fire services increase was due to the increase of salaries and benefits and a realignment of WSIB costs and the annualization of 25 new positions that we created in 2015 in fire prevention. And with respect to the efficiency targets, the 2%, as I said earlier, MLS, building, ECS all found the 2% or greater. PPF&A found 5% in cost avoidance. Transportation found about 0.5%, and is still working on seeing if they can do more. And city planning and fire, given the demands on those two divisions, actually had to accommodate more work than we had planned on in 2015, and therefore were not able to find those efficiencies in their budgets. In terms of new and enhanced services, I'll go through these. I don't know if you can read these very well, but this is the summary of the position, so I want to just make sure you understand this. So under city planning, that section 37 position, it's funded out of the interest on section 30 accounts. Engineering and construction services, SMART, Bell City program, 7 people funded by Bell. Toronto Building, infill construction coordination. This is something that was approved by council last year. It involves making sure that infill construction is properly inspected and coordinated. It's 7 positions funded out of building fees. The cycling network plan funded out of public realm. Metrolinx has given us funds for 2 bodies for reviewing some of their work on RER, et cetera. Strategic rehabilitation plan for the Gardner. Here's the 6 bodies dedicated to delivering that project through ECS with all the complications of federal, provincial requirements around accelerated rehab. Toronto Building, the 7 new vehicles are included in their fees. In transportation, bike parking strategy funded by capital, and the graffiti management's street art program funded by public realm. So what we have not got in the budget, which is important for you to understand in this next slide, slide 28, is a list of projects that were referred to us by council for inclusion this year in the budget as a consideration. Of that, the total is 9.2 million. An additional 42 positions would be involved. If we had the money, we would be looking at 11 seasonal inspectors in municipal construction and ECS to extend the hours to alleviate traffic disruption, and would be funded from the capital budget. Fire EMS efficiency review adopted by council and supported by the underwriter survey recommended a total increase of 115 prevention officers over 3 years. We started that 25 last year. To strengthen these and get to level 2 quickly, we've had a total of 65 added already. The remaining 15 were to be phased in over 16 to 18, and they are not included in the budget. due to financial constraints. Implementation of the change to 30K in the city, in Toronto and East York District, we have not included, although there was we were asked to consider this, 4 temporary positions from transportation cap to accelerate the changeover to the speed limit signs. We're doing them as we go in our normal maintenance and under our normal budget, but this would be what we would do if we wanted to do it in year in 16. So that's for your consideration. The funding of the Toronto Wildlife Centre was a $750,000 annual operating cost and a $6 million contribution towards a new facility. That is not included in the budget. Those are the numbers required to make that happen. And Uber enforcement, public education, we're going to obviously be coming back on that. We will be describing that. There's probably ways of dealing with what is probably a $1.6 million pressure, but I think there's some offsets that we can provide, but that's not in the budget as well. And in terms of user fee change highlights, there's some changes in fire services around false alarms, elevators, non-emergency elevator incidents, and the responses to vehicle instances on provincial highways where we have had a recent regulation that allows us to recapture some of our costs there. So that's operating. Capital. I hope I'm going quick enough for you. In planning, in capital, small amount of capital studies. You can see the area studies here. We reached an interim milestone on TO Core. We've done lots of civic improvements out of that small fund that they have for Spadina Road Bridge, Scarborough Library, various things. And you can see them all here. Engineering construction services. Engineering construction resurfaced 220 road lane kilometers. We did 279 bridge assessments. We looked at priority projects such as 6 Point Interchange. You can see here they have a portfolio of over 400 projects that they're working on. Total value in 15 was $550 million. Next year, $650 million, so it's big. Fire services, we continue to invest in the technologies, as I mentioned earlier, dynamic staging, predictive modeling, the use of repeaters and stations to get people on the trucks quicker have all been installed and are being implemented. We've got some self-contained breathing apparatus to acquire as well. And we continue to work on a variety of station improvements, new stations that's included in the budget of fire services. Summary of major projects in transportation, state of good repair. You can see we've installed nearly 6,300 meters of missing sidewalks for accessibility. Priority neighborhood improvement projects have been delivered, traffic control signals. You can just see the variety of things that are being done there. Total capital for transportation is $120 million, 120 projects with a value of $151 million for next year. And waterfront revitalization. Major projects completed in 15, the Pan Am, Parapan, and Athletes Village. Our oversight there on Union Station and TTC second platform. Working with Waterfront Toronto on Queens Quay West. Presented a report to Council on the Gardner East Environmental Assessment. 3 major real estate transactions, East Bayfront, Mond, Hines, Tridel, Aqua Vista coming on through the process right now. Oversight of Toronto Build Design Project for the Fort York Pedestrian Bridge. We did the announcement earlier this fall. And strategic review of the waterfront revitalization and Waterfront 2.0 poised to move forward. So here's the budget. Total of $383 million of capital program expenditures. 88% are transportation related. The bulk is debt. 7/10 of it is debt, 69%. And there's also what we're doing to maximize the use of DC's reserves federal and provincial funding is being courted. City planning, funding for major growth studies is included at similar levels from last year. A major investment in the civic improvement project is also proposed. On fire services will construct 3 new fire stations and rebuild an existing fire station consistent with the master plan, so that's all unfolding as expected. Upgrades in bunker equipment, trucks, reasonably normal spending in fire. Transportation services, significant investments in rehab and state of good repair. We've made great gains on major roads. I'll say to you, you'll see it later, but local roads continue to, state of repair gets a little bit worse. We've now got a plan on the Gardner, which is good. And we've got all kinds of traffic plant signals and other kinds of things that we need to do to move traffic and deal with pedestrians and cyclists in a proper fashion. So we've got a whole series of things like Gardner York Bay Young configuration, 6 Points interchange, Redley, Steeles Avenue widenings, Ingram, all included in portions of the budget as you see it. And cycling improvement, big push on cycling improvement on infrastructure, nearly 14.25 million. Engineering studies, you can see the list of things. Audible signals for pedestrians, 2.3 million. Major signal modifications to over 2 million. And in waterfront revitalization, we've adopted in principle the second phase of the revitalization. The Under Gardner project is underway, as you know. The Fort York pedestrian bridge is off and running. We're continuing the precinct development West Donlands, East Bayfront. We do due diligence and are ready to get provincial and federal funding for the Lower Don flood protection and the new mouth of the Don. And we're poised to do a reset on transit in the waterfront. So here is the summary of the 2016 to 25. This is a 10-year plan, so I'm just going to briefly go through this. You'll see the quantums are similar. Now, if you take a look at planning, fire, you see we've got a longer list of fire stations, transportation, more of the same in terms of state of good repair and major projects. Waterfront revitalization, obviously, the ones that you all know about. So, where do we get the money from? Where does the money go? You'll see that 96% of the capital program pertains to transportation. 2/3 of it's through debt. We're maximizing our efforts to attract federal provincial funding, development charge, and reserve funds. You'll see a very spiky chart here. That is the payment in 2023 on the strategic rehab of the Gardner that makes the bulk of that 2023 cost. It's probably going to shift as we find out how the formula will work with the concession payment, et cetera, and the approval of council. So stay tuned on that one. Here's the state of good repair backlog. You can see in colors here, the ones you should pay attention to is kind of that purplish color, which is that is local roads, and I can't read my own slide. Local roads is purple, and the blue on the bottom is the Gardner, so it gets better. Local roads, in terms of state of good repair, local roads, that greenish color?
No, green is major roads.
Oh, green's is major road, yeah. It gets better and then it gets a little bit worse. So we still have a big bill to come on state of good repair post-2022 kind of thing. And it's part of that $23 billion part of that list that Peter has provided you previously. So cost drivers, is that next? Well, that's it. Thank you.
Thank you very much for your presentation. Now, so what we're going to do is, as yesterday, questions on overall Cluster B. You know, and again, if it gets into specifics on a division, try to keep that for when, because all the divisions will have an opportunity. So are there any questions on the overall Cluster B presentation will begin with council members or Budget Committee members, of course. Councillor Layton to begin.
Thank you very much, Mr. Budget Chief. I know that it's broken up into several individual divisions, and I'll be asking about them individually as well. Are you able to give us an idea of the total across all of Cluster B, what's being spent on preparations for the Scarborough subway?
I don't have a figure right off the top of my head. It's principally in planning, so we can give you that planning number. I'm not thinking there's many other divisions that I have a budget for.
Are you able to give me a similar number for the Gardner? I'll ask planning individually. What I'm looking for, though, because I suspect that it also has legal, it also has
Yeah, there'll be some time from legal, yes.
some city manager. It also has some construction and technical services division. Sorry, I mucked up their name, but
Yeah, ECS.
I'm still there. You go. So I'd be looking for that for the Scarborough subway and for the Gardner East portion. Do you have any idea about what the sort of total cost?
So we've got some specifically identified costs for the Scarborough subway work that city planning does in terms of the EA and the TPAP process. We probably would have to estimate, and it would be simply an estimate of legal or any other collateral division that might be involved in reviewing or commenting, but we don't typically do it that way. So we could do an estimate, we'd have to do an estimate.
So what about the Gardner work?
The Gardner EA has been funded, has been identified in the work that we've done. 8.4 is the number of the total cost of the Gardner environmental assessment. And we have some additional monies to spend this year. I'm going to say about, 780, I was going to say 800,000 to finish that portion of the work off.
And across what divisions?
Well, that's the EA. And again, we didn't and don't estimate the time involved in legal or others commenting, because that's typically part of the budgets that they generally just provide. We haven't broken it down that way.
So they would be using their regular budgets
Yeah.
for the time that they spend
Yeah.
on those items.
That's correct.
What other divisions do you think would be involved in that? Transportation, legal, construction services, anyone else?
Major capital coordination, which is through Jeff Clemens, but is a very small part of his, it would be microscopic. I think you've captured the major ones.
For Smart Track,
Yeah.
do we have an idea of the total across divisions about how much staff time and cost is going into?
Again, in city planning, we have the monies that were allocated by council to the project last year, and we're carrying through into 2016.
And his
again, there isn't any particular assignment of the staff cost in individual divisions supporting and commenting on that.
So those aren't included?
No.
Then it's good thing that planning's up first, because I'm going to be asking about what divisions did you go to for comment, just
Yeah.
as a quick one.
Correct.
Okay, thank you.
Okay.
Thank you, Councillor Pasternak.
Thank you, Mr. Chair, and thank you for the presentation. And once again, congratulations on the Pan Am festivities. I went to a couple of events, the field hockey and the diving with my daughter, and of course the dress rehearsal for the opening ceremonies with my wife, and it was all excellent.
It was.
First rate. So city staff are to be commended.
Well, Cluster A in particular needs to be commended.
And it was it was the city at its finest. I guess it was about a year ago where we got a couple of bills from Metrolinx, correct me if I'm wrong, but about $85 million for sunk costs on work on the Scarborough LRT and $100 million for infrastructure municipal improvements for the Union Pearson Express. Are they really expecting that money? Have we made any arrangements to pay them? And is it embedded in the budget documents?
So that was probably a question for the CFO treasurer.
Through you, Mr. Budget Chair. So those monies, a 10-year plan was approved, I think it was spread over, I forget now how many years it was spread over. That was approved last year, and it was put in the 2015 budget. They're here again. We have not paid anything yet. If you recall, council put a couple conditions on the actual finalizing of that deal. One related to our contribution to GO, the annual contribution that was about $20 million that was removed from the budget, and those discussions are ongoing and have not been finalized, so hence we haven't paid any monies yet.
Is there contingency in what's before us for $18 million? Should council decide to start this payment plan?
So the monies are in the budget, we just haven't paid them. There is no contingency in terms of the, I believe it was $20 million of monies to pay for GO expansion capital. We've removed those. If the province, digs in their heels, there's no contingency for that.
So it's an offset. There's no offset.
That was all funded from CFC, and it was removed from the budget last year as one of the ways to get the budget tax increase down. And we are maintaining that we're not paying that. It's technically, we've called it a suspension, but there were 3 years remaining in that deal, which we have removed from the budget.
So when the budget leaves this committee, it will have to have some kind of decision from this committee on whether to pay and how those negotiate. Will those negotiations, will there be a recommendation before us by the time this goes over to executive?
No, that decision already was made last year, not to pay the city's contribution for GO Capital.
No, but I'm referring to the 10-year payback plan on the other.
Again, that decision was made last year to pay it, conditional upon that we get Metrolinx's agreement and the province's agreement that we don't have to pay the GO Transit. So that's the decision council made. That's the decision we support, and we're actively trying to get that.
Okay. One other question on the capital plan by funding source. I was looking for a little line in there about tolls. And in the future, council has spoken, councillors have spoken through various committees and through consultations through the City of Toronto Act. When do you envision tolls kicking into one of those columns to help offset the capital costs?
Through you, Mr. Budget Chair. So one of the resolutions and recommendations that was approved when the Gardner EA plan was approved last fall is that we are to come back with a fuller report on tolls and how they could work and with an implementation and more specific information on revenues and types of tolling. And so when that report comes back, that would be the decision point.
Well, it's come through executive once. Is it?
Yes, and we were asked to report back.
To come back.
Again.
Okay. Thank you.
Thank you. Any other questions of committee members? Councillor DiCiano.
Thank you, Mr. Chair. Good morning or good afternoon, everyone, in 5 minutes. Can you just let me know, page 16 of your presentation with respect to Toronto Building, the e-service delivery process.
Yep.
Can you just confirm the reason why, my understanding is the reason why this e-service delivery was implemented was because it was essentially legislated that we reach certain timeframes. Is that correct?
I wouldn't say that e-service is rooted in the legislative timelines. It made it possible to improve our timelines. It's actually improved the flow. We have to meet the timelines stipulated, and we've increased actually upwards of to 95% of meeting those deadlines, so we're exceeding their targets today, and it's in much part due to the hard work, but also to the introduction of that technology.
Thank you very much.
Thank you. Any other questions from committee members? Seeing none. Outside councillors, Deputy Mayor McConnell.
Thank you. I was just writing, sorry. I wanted to first of all ask you about the charges for development as opposed to
Somebody has
DC.
feedback on a mic. Does somebody have a live mic on other than you?
It seems to be that mic there.
It was exciting yesterday as well. So, thank you.
It is your mic. There we go.
That mic?
Yeah, I guess.
Okay, now.
Yes, it's an exciting mic. Okay, so with regards to the development charges, not just the DCs, is there a legislative reason why we do our building permits when the buildings are above grade? Or can we pull the building fees, the permit fees, upon bills? Can you, is that possible?
Well, it's a very timely question because you may recall, Rob can probably wade into this too, you may recall, through you, Mr. Chair, that we opposed what was a proposal to require us to collect fees at the first permit. They have actually implemented that over our objections. They've actually implemented that.
Okay.
And the difficulty with that is, of course, it doesn't capture the increases that happen in timing. We put the conditional permits for below grade, and we didn't collect it until the first above ground permit was, but now we're going to be forced to do something at the conditional permit, and there's a report coming later in the month to deal with this dilemma. And so sort of stay tuned, but obviously we are concerned with what's happened, and we will be making efforts and recommendations to you to address that concern.
Okay. And is that a similar situation with DCs?
Yes.
Okay.
It is DCs, yes.
Okay, okay. The next question I had was with regards to coordination, if I could. And that's particularly around the curb cuts, the enhancements, and so on. So, for example, I see that River Street is on the list, but Hydro are saying they won't move the post for 18 months. So now we're stuck. Are we moving forward with Hydro in order to be able to coordinate some of this work so that we're not always dragging behind our Hydro policies and staff?
So, Mr. Chair, another very timely question, because today on my desk,
Good.
I have the final
Yes?
proposal that's being worked out with all our divisions through Major Capital Coordination, Jeff Kleinman's, with Hydro, to allow us to be the contractor, including hydro poles and hydro equipment,
Yes.
and do it on their behalf with a fee schedule that's been negotiated. We've had some little things at the end where we're still trying to work out, but it's basically done. And within the next couple of weeks, we should be able to have that.
Hallelujah. That would be terrific, because we've had terrible problems with Hydro, as you know, dragging their feet. And on bike lanes, particularly around the 4 kilometers cycle tracks. So my understanding is that we're having difficulty getting what I would call like kind of the high quality of cycle tracks, so that we're not coming back and back and back and having to do state of good repair. Have you put your mind to sort of that piece of the infrastructure so that it has a life cycle that is more than 18 months and the paint's all off it, or the bars are all broken or whatever? Because those cycle tracks are not lasting.
Yeah, so I would say that in the maturation of our cycling network,
Yes.
and with our now understanding that they're critical components for the city, we are confronting some of these issues of some of the early interventions in cycling infrastructure, and now we're going to the next level.
Good.
Steve can answer more specifically, but clearly
Yes, and
we've got
I'll
to,
ask
when we
him.
do it, we should do it properly.
Yes, I agree. And then my last question has to do with, it's a funny question, with parental leave. So you've gone from gapping from 6.3 to 4.5. But parental leave is 12 months. And my experience with some of the departments in terms of replacing staff who are on parental leave. So pretty well you know that the baby is going to be born, let's say in November, and you're going to need a new person to come in. But what happens, in my experience anyway, and is that you know, we start the process somewhere in January or February. By the time we have the temporary person in place, we've got them in place for 3 months, and then we know perfectly well that the parental leave is over. So that is one of the areas that I think we can tighten up on, and I would ask you if you would put your mind to that, maybe with human resources or whatever it is, because it is what I would call a predictable gap. We know generally how that's going to work out, right?
Thank you, Councillor.
Except for Councillor Layton, who doesn't need parental
We'd be
leave
delighted
because
to
he's-
look at that more.
Councillor Cressy, you're next for questions.
Thank you very much, Mr. Chair. To our DCM, just a couple broad questions for Cluster B. The first of all, just as it relates to the operating. So we see an ongoing population growth in our city and in the region. Is that putting increased strain and usage on a lot of our infrastructure?
So in my introductory remarks, I made the obvious point that the demands on the staff that we have far exceed the resources of time, money, and talent that we have. But we do a great job, I think, our staff do a great job in meeting those demands. There's sort of an insatiable appetite for that. Plus, we are a growing, successful, attractive city, and that generates some additional tax revenues, some additional revenues, but it clearly does not generate enough to offset the increasing demands.
Well then, so building on that, understanding the great work staff are doing, but the increasing demands, the 2-year forecast, I know department by department, as I've gone through, I've seen the 2017 and 2018 forecast for what will be required just to maintain the service we have now. Do you have a Cluster B overall amount that will be required in 2017 and 2018, either by an amount or percentage, to maintain what we have now?
We've taken an initial stab at the pressure that's coming in 17 and 18, and it's in the it's in a chart embedded in there. I can show that to you. But I would say that it doesn't reflect what we inevitably know that's going to happen, and that is additional issues come onto the table, additional demands, additional problems with, any number of things, including emergencies and weather. And so it's almost always understated. Then we come into the budget cycle somewhere around June or July, and we've discovered that the number's a lot bigger than we'd expected the previous year, and we start to try and deal with it as best we can, but we clearly are strained to meet the demands that are being asked of us.
So do you have, I think it may be in the chart here,
Yeah.
Do you have that understated number that on an annual basis tends to be larger in terms of what the forecasted demands will be?
So it's understated when I say that the total incremental impact that we see for 17 is 1.5% on our base,
Yeah.
1.3 on our base in 18, but I can tell you that when I come into the budget next year, it will be a lot bigger than 1.5.
All right, so next year will, in your professional opinion, be more than 1.5
That
we'll
will be the
need?
opening pressure, yes.
Okay. If I could come to capital for a second then. I know when we got the overall presentation from our CFO and city manager, it was noted that there are $22 billion in unfunded capital projects.
Correct.
Do we have the number for what within Cluster B is unfunded?
16 billion.
16 billion. So 16 of the 22 billion in unfunded capital projects that have been listed come from. Are all of those 16 billion in unfunded capital projects, are those council-directed projects?
They range from things that have been talked about, things that are aspirational, some that are in EA, some that are not. It's a mishmash. And of course, it's also expected that some of that money would be offset by federal provincial contributions and/or other ways of using revenue tools.
All right, so we have, and what's the 10-year capital budget again, just the overall figure for Cluster B?
It's 5, hold on. I have my slideshow. 10 years is 5.512 million.
All right, so our 10-year capital for Cluster B is 5.5 billion, but there is an additional 16 billion in unfunded.
Over a longer period of time, yes.
Over a longer period of time. Okay, thank you very much.
Thank you. Any other questions from outside councillors? Councillor Davis?
I had a couple of general questions, and I apologize, I was not able to see the presentation, so I'm trying to catch up here, but I've noticed the rate of inflation is used differently throughout each division. So this is to the CFO. What was the rate of inflation that was used in each of these divisions? Was it the same? And what was the rationale behind what the rate of inflation, what rate was used?
Through you, Mr. Budget Chair. Basically, it varies by division, but in the end, everybody was asked to eat their inflation and to absorb it because the guidelines came in, the guidelines that were set were at a -1%. So every contract is looked at independently. Each business, because they're very different, has its own inflationary pressures, so they vary.
So is
but
there
in the
a
end,
way,
everybody was asked to absorb it.
is there a way to see, I want to understand how that works. Is the inflation, we're using an inflation number of 1.3% is inflation, then we have 2.5% is inflation, and 2.56 is the rate of fee increases in the business services for inflation. Who calculates inflation? Everybody does it themselves, is what you're saying, every division?
Sorry, I think there's a number of, Josie can explain in more detail, but there are a number of things that are different. So, for example, where does that 1.3% come in terms of the tax guideline that the budget chief and the mayor would like to come? That is the estimated CPI at the end of October, I think it was, because that was the date that we had.
Okay.
And as I said, for each division and each contract, they all can have their different inflationary pressures and cost parameters. Josie can provide more details.
So through you, Mr. Chair, annually through the budget process, in the past, we would provide all divisions with a list of inflationary increases that were specific to particular
Notional, you put in a notional amount and said,
We stopped that about 3 years ago, and essentially what we do now is say, only those things that we know that are fixed, much like a water rate increase, a utility increase, gasoline, 3 or 4 items that we apply to everyone because we know they're fixed. Then what we ask staff to do is if you have specific cost escalations in contracts, apply those.
Okay.
And that's what gets used when we're looking at these inflationary increases because those are fixed. For user fees,
yes,
okay, the policy says that you use inflationary increases associated with the basket of inputs that go into that service.
okay, so the basket of inputs going into MLS, for instance, was different in all of those divisions, and they created a blended rate, which came to 2.56% for both business licensing, even though business licensing, the overall cost in business licensing was significantly down. And yet the business license fee has gone up based on a blended rate across all divisions, all services within that division. So is that the way every division did it?
So the fee is associated with a particular service.
Yes.
And it's the cost of that particular service. So if the percentage of staffing, that input of salaries and benefits, it's whatever the percentage increase would be on that cost. If there was a food or a salt or whatever, that would be applied.
All right.
Specific to a service's cost structure.
So one of the things that, obviously there's gapping, to be able to have these departments come in where they are, there's been reductions in staff of various kinds, changes in staffing, but there has also been a significant increase in the amount of work contracted out over the years. We no longer have any snow removal in-house. We are contracting out project management at a rate that we've never done before. We've expanded contract management. Is there a way for us to see the contracted services in this budget and the inflationary costs associated with contracted out services?
That's your last question.
Either by division or, I mean, because we don't seem to be, we don't see in any evident way in these either consulting services contracted out services and the rates of increases in those contracts, multi-year contracts. So snow removal, we've got a 7-year contract. I don't know what the inflation rate is. I remember seeing the contract had some formula that said it would be based on, the cost of living, and if there were various factors, and inflation costs on contracts, each contract was quite different. So if we have, for instance, employment costs going up at 1.5%, but we have contracts going up at 3%, I want to understand that somehow in what we look at
So
financially.
we can get you the total cost of contracted services and what falls under that cost category. If you're looking for specific information to each contract, that is a manual exercise.
Don't you think we should be looking at the inflation
That would
on these
require a lot.
contracts?
Now, I would direct your attention, so in each of the analyst notes,
Yes.
and at the summary level in the presentations here, there's our cost drivers. So
Right.
big ones have been identified in there. But if you're looking for each individual contract,
I am not looking for
that's
each
a
individual contract. What I want to understand is the cost of inflation on our contracted services.
That's what I'm saying, to single out the inflationary portions of that would be a manual exercise. 'Cause we can tell you for each division, contracted services in 2015, contracted services in 2016. That just tells you the total change. That could be a price times a volume.
Well, if you
We
can
would
even
have to
start
go-
there, that would be useful. How much of it is additional?
Thank you, Councillor Davis.
That's-
We've gone well
That's the
over.
manual part that would require investigation.
Any other questions from outside councillors? Seeing none, thank you, John. Appreciate that. Okay, now we're going to be getting into, just before lunch, we're going to start with city planning. I think Councillor Layton had some questions, as I recall, so why don't we begin with Councillor Layton?
Yes, thank you very much. I'm just to start off, where are we at with the heritage hiring, the annualization for this year? Did we get all those hires done last year? In 2015, we were able to hire the heritage planners to initiate the.
Through the chair, that's correct. All of those positions have now been filled.
And so earlier this year, I think all councillors typically get emails of OMB appeals of C of A committee hearings, and they get them in their inbox, and that is what tells us what's getting appealed. Otherwise, we actually have to look on a regular, like on a weekly basis, and somehow know the file number, which we often don't as an office. Those stopped for a couple of months, and it was based on there was apparently just a shortage of staff hours to get done. Are we at a concern of losing that as a service to both as a city and as councillors? We're good, that's going to continue? I just want to make sure, because if not, we've got a bit of a problem.
Through the chair, that's absolutely correct. There was a gap in service. We, in fact, had a significant number of vacancies for a period this year in C of A. At the same time, we had record-breaking volume. Those two things are conjoined. Staff get overworked, they give up. We, in fact, are using the revenues from the higher volume of applications to add some additional positions. The service that you've identified will continue. There was a gap in service for a part of this year when there were those vacancies in place. We are now hiring some additional temporary staff to assist with the backlog.
In all likelihood, we're also going to need additional resources for a local appeals body. When would we likely see that coming down to budget?
Through the chair, the local appeal body initiative is being led through the city manager's office, and will, in fact, there'll be a report coming forward in the upcoming months making recommendations as to how operationally it ought to be implemented. It's important to note that there's a variety of administrative functions that are new to the city that will be required as a result of the local appeal body. But from a city planning perspective, there are no additional impacts with respect to staffing, because it's an initiative that will be housed outside of city planning.
Okay, thank you. I'm going to start in the reverse order that I asked the deputy city manager. Smart Track, planning's had a lot to do with this. but I suspect that you've also circulated to other divisions. Any idea of what other divisions and the cost to planning of the work that's gone into reviewing whatever Smart Track is?
Through the chair, there are really 4 key partners that are involved in reviewing Smart Track at this point in time. City Finance has a role to play. City Planning, of course, is playing a critical role. There's been a very small role for Economic Development, and the City Manager's Office has been playing a coordinating role. And in fact, the money that was allocated to Smart Track was done through the City Manager's budget. That was approved by earlier in 2015. It was an amount of $1.7 million. There were no additional dollars made available for staff resources in transit planning, so the work that has been undertaken by city planning, both in strategic planning around the land use analysis for station locations, as well as the technical work around the building of the infrastructure and the clarification of the service concept, that has been integrated into the existing work of our transit team.
So the 1.7 million was the city manager's budget for reports and studies, but planning wasn't given any additional money. Do we have an idea, or can we have a ballpark about what and how much time planning has put in?
Through the chair, there's been a significant amount of work that has been undertaken over the course of the past 8 months on collaborating also with Metrolinx, who is a critical partner in advancing Smart Track. We have a very tiny transit unit, a total of 8 people and 1 communications person. That unit is responsible for the Relief Line and the Scarborough subway, as well as all network planning. So there has been significant ebbs and flows, and people have been moved from one project to another as the deadlines have demanded it. There are no full-time dedicated staff who are working on the portfolio, but in fact, a variety of staff are being pulled in and out at various times.
Your last question, why don't we can do a second round? I'm just trying to, we'll get through everybody first, and we'll come back to you, so that's okay?
I think she knew what the next question was going to be, so I'll ask it again.
Okay. Any other committee members have questions? Council, we'll start with Councillor Pasternak.
Thank you, Mr. Chair. Just following up on Councillor Layton's questions about the heritage studies. So staff were added, I guess, in 2014 and 2015 to work on those heritage studies. Are we getting ahead of the curve? Are we catching up to the backlog that was there?
Through the chair, we are in fact very well positioned for 2016. 2015 was a difficult year because we had been directed in 2014 to proceed with enhanced staffing levels, but you will recall that in the 2015 budget process there was a debate as to whether those positions would continue. So we in fact put the work program on hold, and we put the hiring on hold as we went through the budget process. This means that for a good portion of 2015, we did not, in fact, have the full staff allotment. These are also highly specialized positions. There aren't heritage planners with this expertise sitting around waiting to be hired. So there was quite a bit of work that was undertaken by my heritage team to fill these positions with, I must say, excellent candidates. Those positions are now filled, and we are fully ramped up. We did not meet our service level target as a result of the gap that took place in 2015, but we're confident that in 2016 we can advance the work program and respond to the service level that has been established by Council.
So your feeling is that, by the first quarter of 2016 or first half of 2016, we'll have completed the backlog? And
because we did not have full staffing for 2015, we completed 2. So now we have the added challenge of having staff that are charged with delivering 5 HCDs, but now on top of that workload, they have to address the backlog from 2015. So it's going to take a couple of years, I believe, to account for that 6-month gap where the work program couldn't advance because we didn't have the certainty as to whether we would be proceeding with the 2014 decision. There was a significant implication of that delay.
On another issue, the affordable housing issue, it's widely felt that housing allowances and bricks and mortar, the building of TCHC buildings alone will not solve our affordable housing crisis. And in fact, the way to solve it, as I certainly have discovered from a local perspective in Ward 10, is through negotiations through your department with developers who are looking to build high-density or mid-density residential buildings, and that we make a condition or a requirement that it have either affordable ownership or affordable rental. As your staff, are you prepared to be extremely robust when it comes to working with developers and their applications and making sure that that affordable piece is embedded in any kind of proposal that comes forward?
Through the chair, absolutely. We recognize that this is a critical priority of both council and the mayor, and in fact, we have secured over the course of the past 6 months in a variety of secondary plans a significant amount of affordable housing, in part due to the leadership of the chair of PGM, Councillor Shiner. Tippett Road is an excellent example of that, where we've secured in the secondary plan affordable housing. That being said, the best way that we can secure affordable housing through the development review process would be as a result of inclusionary zoning, and this is something that we continue to work closely with the province on advocating for. In the event that the legislation comes forward, there is going to be work that needs to be undertaken on our part in order to determine the criteria and conditions around how that inclusionary zoning will be implemented. And I'll just add that last week I learned that the City of Boston has now implemented inclusionary zoning.
Thank you. Thank you very much. Thank you, Mr.
Thank you, Council. We'll go to Councillor DiCiano, and then we'll probably have to break for lunch, but it looks at the time here. So.
Thank you, Mr. Chair. Questions for the Chief Planner. During our informal review process, there was a series of questions asked. One of them was, what are your barriers that may prevent you from achieving best practices and efficient operations? And I think we all understand there's been a historic underinvestment in technology in the city to help our divisions become more efficient. But one of the suggestions was made that the next round of efficiency savings would be related to the use of technology, both within the division and externally. Have we gotten to the point where we are going to be making those investments, or do we understand what technologies we're going to be using, and what will these new technologies be able to do for you?
Through the chair, we're moving very slowly with respect to using technology in the organization in a more sophisticated way in city planning, in part because we don't have the budget to do so. It's important to note that the project for the continuation of e-services with respect to Committee of Adjustment is in fact going to be advancing. That's advancing in an incremental way. It could advance more quickly if there was more funding to do so on an annual basis.
You're talking about the e-circulation pilot?
Correct.
How's that going? Can you elaborate a little bit on that?
We, in fact, have initiated a variety over the course of the past year, e-services in part in partnership with Toronto Building that has moved to permitting through e-services. There's a variety of technology and infrastructure upgrades that are required in order to deliver. We began a pilot project in our Heritage Preservation Services and have met with significant success, including much better service. We've been exceeding our service level standards as a result of e-services. That required new technology for staff. It required larger monitors because we were no longer reviewing drawings on desktops. In order to implement that and roll it out across all of city planning, there's a significant amount of new technology that would be required for planning staff, as well as new equipment. The equipment planning staff are working on is very dated.
So council's inability to provide proper funding to give you the technology you need to become more efficient is a barrier to making your department, or anybody's department, more efficient in this city.
Through the chair, that's absolutely the case. In fact, I was shocked to discover when I got here that many of my planners cannot PDF a document. They can now, but when I arrived, they couldn't, and in fact had to get someone else to PDF a document for them. So this is absolutely one of, I would say, the biggest challenges facing the modernization of our city services.
Thank you. The actions 40 and 41 of the city's planning strategic plan specified that I guess you guys would hire a consultant to bring forward new KPIs that would be able to allow you to better measure, assess the achievements of the department. How is that coming? Have we gotten to a point where we know what those new KPIs are going to be, or are we still in that process?
Through the chair, in the fall of 2015, we hired a consultant in order to respond to that action in the strategic plan. We are expecting a draft within the next couple of weeks of those new KPIs. We expect to be rolling them out in the spring.
Will that be coming to planning and growth for review, or?
Through the chair, absolutely.
Okay. One last question. At a community planning level, with respect to staff productivity, we were told during the informal review process that quarterly volumes of applications received and processed in relation to staffing levels are reviewed. So once you, I think, you know, and it might be a lack of technology again, but it's a very, to me, it's a very simplistic way of measuring productivity, just simply by looking at outcomes. So once you have that information, what's the benchmark that you're comparing that to? What are you looking at other cities? Are you looking at other departments? How do you, is there a benchmark that you're justifying the productivity levels at?
Through the chair, this is in fact it's very challenging because there are so many different inputs and so many different variables in the city planning process, including we rely significantly not only on other divisions, but also on other partners. And much of our workload, almost 50% of our workload, is driven externally. It's not driven by us, it's driven by the applications that we receive. One of the objectives in reviewing our KPIs is to have better measures that could determine the extent to which we're delivering against the expectations established in the context of the official plan, the extent to which we're delivering affordable housing, for example, so that we can begin to measure in a strategic way and collect data in a strategic way, also in a longitudinal manner that allows us to identify whether we're becoming more efficient in meeting the objectives of the official plan or not.
Okay, just one last question. So you have hundreds of planners, but you don't have the ability from a technological standpoint to really assess your best performers versus your underperformers. You don't really have that ability from a technological perspective to analyze that, do you?
Through the chair, well, I would argue that there isn't really a technology that can determine that's something that comes through strong management and management relationships. And as a result, what we've been working on in city planning has been building talent and training, and we implemented in 2015 a mentoring program, and a third of the department is participating in this mentoring program, and it is a strategic initiative designed to ensure the transfer of knowledge, because one of the biggest challenges that we have right now is planners that do not have, for example.
See you at 1:30, everybody.
Would members of the Budget Committee please come to Committee Room 1 for quorum? Thank you.
Okay, we're going to start the meeting again. Welcome back, everybody. We are in the middle of asking questions, I believe, on, well, actually, we just started asking questions on city planning. Now, did we have, were there any other, oh, Councillor Carroll, you would have been the next one to ask questions on city planning. So you are up.
Pardon? Oh,
City planning.
I'd rather ask them to planning, not just of planning.
Can somebody see where our Director of Planning is? Yeah. They'll be here quickly now.
Mr. Chair. Mr. Chair, point of order. Most questions are rhetorical anyway, so they don't need to be here.
Joel, the nicest guy on council.
Seeing no more questions for planning. Oh. Councillor Carroll.
Yes. Well, just before lunch, I can't remember who was asking the question. Someone was asking the questions about inclusionary zoning. And it was Councillor Pasternak was asking, what sort of policy do you need? How do we get to the drop-dead point of affordable housing has to be included every time? We've tried various policy approaches to this, and it doesn't actually, it's still, there's an over-reliance on the fallback of cash in lieu. I don't know if you're aware of the questions I was asking of Affordable Housing Division yesterday. Would it be more helpful for planning, for community planners? Would it be easier for them if we were to sort of extricate from this big bundle that is all things housing and have the three pillars so they could really see a separate affordable housing program, financially speaking. They could see if they built something into a planning deal, they could see, there it is on the affordable housing books, there's my project, I can track it until the funds arrive from the applicant, et cetera. Would that actually drive it as much as just setting a policy saying, yes, we must put affordable housing in?
Through the chair, I think it's possible that would, in fact, depending on how it would be structured, provide more clarity.
Some structure to go along with the policy that provides clarity. Okay, those are the words I'm looking for. Thank you. Now, the other thing I had were revenue questions, but I think the answer I got asking offline has to do with Councillor DiCiano's questions about benchmarking, because I think that's long been a frustration. How do you know if you're doing well there? Revenues, we are increasing the user fees again, but we don't see a big revenue growth there. In fact, a slight dip. That doesn't mean that work isn't going on, I understand. I understand there's a lot of walk-in informal stuff going on right now, but not necessarily formal filing.
Through the chair, as a point of clarification, we expect our revenues to continue to increase in 2016, and we in fact are 16% over what we anticipated for 2015.
That is not what I noted in the analyst notes. I'm not sure what I was looking at then, because what I saw in the analyst notes looked like. Okay, I'll go back and look at that and ask further questions offline. But with regards to benchmarking, we can't just look at number of applications formally filed and number of applications formally approved, can we, in terms of looking at level of workload?
Through the chair, it's quite complex. In part, there isn't as much of a direct correlation as there should be, or we'd like to see, between the level of effort in an application and the user fee. And one of the challenges that they are in fact being reviewed in 2016. One of the challenges that we see today is that we have less applications, but they are in fact more complex. Case in point, your comment with respect to affordable housing. When we add affordable housing consideration into the review of a development application, there's a series of additional players that we need to bring into the development review process. So there's a complexity that is increasingly becoming more and more normal in the review process.
So if we were to inject KPI into this, it would, if we did have KPI, if planning and growth, for instance, got a dashboard once a month, it would tell us how you're making your projections around revenue, et cetera. It would also give us some pushback. If applicants come in and say, you guys move so slowly and nothing ever happens, we'd be able to say, well, X happens. Here's our latest dashboard. But it wouldn't necessarily give us performance evaluation of community planners.
Through the chair, as a point of clarification with respect to Councillor DiCiano's question and your question, my understanding of Councillor DiCiano's question that it related specifically to the performance of individual employees, which is different from the overall aggregate KPIs of how we deliver with respect to meeting our established timelines. We do, in fact, have current KPIs that we report out on a regular basis. The challenge is those key KPIs only measure timeliness, and timeliness is, in fact, the least of our worries. We, in fact, in Ontario are the second fastest with respect to processing development applications, faster than any other large city in close proximity to us, at an average of 15.9 months per application. Yeah. Our bigger challenge is quality. Our bigger challenge is securing affordable housing. Our bigger challenge is ensuring that we have the public amenities associated with the new development that we require. This is the reason why we're evaluating our KPIs to ensure that they're truly measuring the objectives that we set out in the official plan. Right now, the only thing we measure is time, and that's an area where we are, in fact, strong.
Okay, I just had one more question, and it goes exactly to your answer. The quality piece is the piece I want to know in terms of the budget. We now have the hiring up to snuff. There's a minimal amount of gapping going on. But there's still, anecdotally up and down the hall, the question of when you have a difficult application, one that's going to require a working group to get to yes or get to wherever we need to get with that application, it's often what we get back from the community planners is time-wise and budget-wise, I can only give you so many evening meetings. With the hiring and the redistribution of the applications, are we at the point now where there's a problematic application that needs a community working group? We have the full availability of that planner now if we need to meet every 2 weeks until we get the community to a place of understanding?
Through the chair, this is a very difficult question to answer, in part because a planner typically juggles a series of files at once, and if all those files are very complex or exploding at the same time, that's what results in the work pressure. This also gets to the point I raised earlier about sometimes the disconnect between the user fee and the level of effort. We often recognize that the city has an interest in putting together a working group and putting in a higher level of effort in order to get a better application. But at that point, the fee's already been paid by the developer, but we're putting in more time and effort. So this is the reality of juggling applications, and the workload of each individual planner makes it very difficult to accommodate, other than having some surplus capacity within the system to respond to these situations. And of course, we don't have surplus capacity within the system.
Okay, thank you. Those are my questions.
Councillor Carroll, I'm just going to follow up with a few more questions just on sort of that, and Councillor DiCino. So how do you measure time in your department? So you have, and I'm sort of looking at this as clients' hours billed. When you're looking at, you'll get a development charge, you'll be charging a developer for X amount of money to put a plan. How do you know how many hours go into each individual application, and ones that, could be months or weeks, and how do you measure the time with regard to the planner's work on a particular file?
To you as the chair, there are a series of case studies that were undertaken several years ago looking at a variety of different types of application and assessing in the process the level of effort that was required for different types of application, whether it's a site plan or it's a complex application. We, in fact, use this analysis, which is quite robust, in the context of the review of the development charge process. So it's constantly being reviewed, it's constantly being adjusted. Last year, for example, we added additional time as a result of additional community meetings that are going into the process. So it's really done on a case study basis, and from that case study, we extrapolate what the expectation is, knowing that there's going to be variances depending on the complexity of a file.
Okay, so would you be able to be, again, understanding that, I'm looking at the average time, which could be defined in hours, on your average application or development. I mean, so I'm trying to get, if I was to ask for, average amount of time or planning hours on a particular file, would you be able to provide that kind of information?
Through the chair, we in fact have that assessment on a given application as a result of calculating the development fee. We've estimated the amount of time, not only for the city planner, but also for parks, for legal, for engineering services, for transportation services on every application. So we have that. What we don't rigorously do today is track actuals. In order to do that, I would submit that you would need some software to track actuals in an effective way.
Looking at whether or not you can do the actuals. Okay, thank you. Outside councillors now for questions. I have Councillor Cressy first.
Thank you. Just as a starting point, a point of clarification, and this perhaps is to the Deputy City Manager, but though I'll defer to you if it's to the Chief Planner. During your presentation, you talked about the new position for as part of the provincial requirement on Section 37. Did I hear you correctly that this is being funded on the interest that comes from Section 37 accounts?
That's correct.
Is that a new practice, or is that something that's been done in the past? Has the interest not traditionally stayed within that Section 37 agreement in order to account for inflation?
We would describe it as orphaned interest. It's available. We've identified that as a proper and legitimate funding source.
Has that been used in the past?
No, it has not.
This is a new practice?
Correct.
All right, I think councillors might want to know that. All right, then to the chief planner. So in the analyst notes, it looked a little bit about the future forecasting in terms of the number of applications in our city, both whether it's rezonings or CFAs. This was on page 2. Do I understand correctly that the number of applications, both for CFAs and rezoning, is expected to grow in targeted growth areas, but also as the city as a whole in 2016?
That's correct.
All right, so we're seeing an increase in the number of applications, rezonings, and minor variances. Some of the general questions I had, I was looking at where the line-by-line savings were achieved. On page 29, it noted that city planning received a 16% reduction in materials and supplies budget. How did we do that while we're having an increase in the number of applications?
Just as a point of clarification, it's not 16%, it's $16,000.
It's $16,000.
It's $16,000, and as part of our line-by-line review, we were directed to reduce our budget by 1%. So we, in fact, went through line by line and found areas where we shaved off amounts, and this was an area where we have tightened our belt straps, so to speak.
Aren't we expecting, with the increase in the number of applications we're receiving, that we will need more money for those supplies, not less?
Through the chair, that's correct.
Okay. On gapping, so I know that city planning was asked by PGM to come back with a budget with no proposed gapping, or at least I understand that was the case. If I understand correctly, this budget retains a 3.8% gapping rate. Can you elaborate a little bit on this?
Through the chair, that's correct, but the operational implication for city planning is moot, quite frankly. In 2015, we will have spent 98% of our budget. We typically have a very low gapping rate of 5%. It's not an intentional vacancy number, but in fact, just given the turnover that we have, which is common in an organization of our scale, we have a significant number of retirements, we have maternity leaves.
Okay.
So at any given time, we have between 12 and 15
So you don't expect
vacancies.
it to impact service?
We don't expect it to impact services, and in addition, we have initiated a practice over the past 2 years of hiring before retirements happen, and that's why we're at 98% with respect to the spending of that money.
Great. If I could come to heritage for a second, or heritage preservation services. I know in your responses to Councillor Layton, you noticed that as it related to the Heritage Conservation District studies, that we didn't meet our service levels last year due to the staffing uncertainty. So are we now 1 year behind our planned outcomes of 5 per year?
Through the chair, as a point of clarification, I would not go so far as to say we're a year behind. We're several months behind, more like a quarter or two. We have tendered 3 more heritage conservation districts, and I can clarify that in fact we expect over the course of 2016 to catch up on the delay that we had as a result of 2015. So that's actually much better news than I had stated earlier.
That's great news. Well then, alongside the Heritage Preservation Services, I know there's a significant backlog of properties to be reviewed for listing or designation. How many properties are currently on the list to be reviewed for potential heritage value?
Through the chair, we currently have over 10,000 properties on the Heritage Register, and there is approximately 450 that are backlogged on the list waiting to be reviewed.
And with the current staffing complement, how long will it take to review 450 backlogged applications, to say none of new applications or requests?
I don't have that information before me, but I believe it would be, we don't expect to catch up anytime soon. And we are faced with a further challenge, which is that as we complete heritage conservation districts, they then need to be managed. So we flagged this 2 years ago to City Council that there will need to be operating staff who then can maintain those heritage conservation districts, because the objective of the HCDs has been to significantly increase our heritage inventory.
So if I, excuse me, ask one final question to wrap that up. With the current staffing complement, we don't have the staff to assess the 450 backlogged requests for heritage review, let alone the anticipated increase in number because of our own HCD targets that will then come.
Through the chair, that's correct, and we flagged this in 2014 and we flagged this in 2015.
Thank you. Councillor Doucette is next.
Thank you very much. I just want to start by saying that you do have fantastic planning staff in at least Etobicoke, and I've heard good words from downtown and other areas as well. And even though, yes, we have had quite a change in faces in the last year, the people who are stepping up to the plate are doing a great job. So most of the HCD stuff has been covered. I'm thrilled to hear that we will be catching up by the end of this year. Looking forward to seeing the list of the HCDs being done for 2016 and into 17. My question is this: for your funding for your Avenue local area growth studies, is that funding in line with what you had hoped you would be able to do for the number of studies you're wanting to do, which we haven't done in 15, to do in 16?
Through the chair, our funding and staffing levels are matched to our service levels, so we are confident that we can deliver on the service levels as established by City Council with respect to studies.
Okay. And then actually just my last questions, a lot of questions have already been covered off. When we were going through the mid-rise policy review, one of your comments had been that you no longer had the funding to have a individual staff member do any changes we residents and councillors were looking for. Have you been able to put into your budget to have a person continue doing the revisions to the policy, or is it now on the corner of someone's desk?
Through the chair, that's correct. There is no longer any person assigned to the mid-rise. In the context of the review of the mid-rise, when it became before PGM 2 months ago, we were asked to do a more comprehensive review. We have not, in fact, added this to our work program because we do not have staffing allocated to it.
Okay, thank you very much.
Thank you. Next is Councillor Davis.
Just wanted to go back to the issue of revenue from user fees and to get just some real clarification there. So in the section on development review, decision and implementation, so in the table on page 7, it shows this remarkable a net percentage of 3,483.7% as the change in the revenue, but it's not a big amount. This says you're getting 1.3 million more in revenue from development review, from fees, than you actually spend on the process of reviewing development applications. Is that correct? In other
Through the
words,
chair, that's absolutely correct.
so there's essentially a profit, I mean, it's not the right word, but there's a surplus of revenue over expenses for that period. We charge more fees than we spend on development review.
Through the chair, this is true, and given that it's a user fee, it's a challenge because it means we're being expected to do the work, but we do not actually have the staffing positions to be doing that work. So the money is sitting as revenue.
So through you, Mr. Chair, just to be clear, we have set up a deferred revenue account so that when we get the actual revenue in place, we put it at year end at the disposition, we put it in back into a reserve, and that enables city planning to have the revenue in the event that they need to actually cover costs to continue with the applications.
No, but we're charging more than we're spending on user fees.
As a point of clarification, we are collecting revenue, and that is driven by the applications that come forward. We have a static number of staffing positions that have been approved by City Council. If the revenue goes up because there are more applications, meaning more work, the positions remain the same, there's a gap, and that becomes what Josie has referred to as deferred revenue.
Okay,
We
does
established
that-
a reserve fund to try and access that money.
Does that convert into a delay? Or if those positions, if that revenue was used to add more to the complement, to add more positions, and we spent the money, would that not mean we could process applications faster?
So, yeah, I'll jump in, just through the chair, just for clarity. What you're seeing is there is a net revenue within that particular service, development review, decision, and implementation, because that's where the revenue will come in and be accounted for. But that revenue offsets costs that are embedded in the other services in city planning that help deliver that service that's being provided. So there is no net revenue that is being generated through this service. We're at essentially trying to achieve 100% cost recovery on delivering the service, ensuring it's funded through the user fees.
So how do we, I mean, I just at the break went through this on MLS. How do we really then track user fees to service if it's split up amongst different divisions then? Where would the difference be? Policy development? So if there is a net
Yes.
revenue that comes from development review, decision, and implementation, and you're saying there really isn't a net revenue, it's being spent somewhere else, where is it being spent?
So just, all right, just for clarification, are we speaking to the actuals or the budget? Because when you first asked the question, I believe I heard a 1.3
On page
net revenue
7.
on page 7.
The middle column on development review, decision, and implementation, there is 2016 versus 2015.
Has a net revenue of 1.319 million.
Yes, so we will have,
Yes, and if you look at city building and policy development, there is a net increase in cost of 1 million.
right.
So what you're looking at is you're looking at the change in budget versus budget. So there's different factors that come into play. You have other revenues that come in there, such as changes that are happening on recoveries from capital, changes that are happening on adjusting for the actual revenues being achieved, as well as the adjustment for inflationary increases to the cost. So this is essentially all of those elements combined together to show you the changes from 15 budget to 16 budget.
Right.
And
I
in terms
understand
of the service itself, where you look at the service itself, 2016 budget has gross expenses of 23.684 million, revenues of 24.966 million. The difference between that is a net revenue of 1.282 million, but if you look at the other two services that are within city planning, you'll see they have a net cost of 16.6 million and 15.3 overall, showing that those costs are actually supporting expenditures that reside within city building and policy development.
Yeah, but there's still a net reduction.
That's your last question, Councillor.
So
You can maybe take it offline to finish your
I just think
understanding
there
of-
is this question of how we defend user fees against expenses if there's a net increase, and or why we don't provide the service equivalent to the user fees we collect.
Thank you. Councillor Wong Tam, you're next for questions.
Yes, thank you very much, Mr. Chair. And through you, I just want to understand, there's a modest saving under the category of external legal services, and it stipulates that it was achieved by aligning actual experience results with, I guess, the internal legal representatives. What does that look like? Did the city lawyers have more work, so therefore we outsourced less legal work? Is that what happened there? The savings is modest. I'm just trying to understand what was the cause and effect there.
Sorry, Councillor, could you refer to the page you're referencing?
Sure. It's page 9 in the operating budget, and you talk about a reduction in external legal services, and I was noting that it is a minor savings, but I'm just trying to understand how was that achieved? You aligned. You were able to offset some external legal costs by bringing that in-house. Is that what I'm understanding?
Through the chair, as a point of clarification, that line item speaks specifically to external legal services that were retained specific to the zoning bylaw.
So that was the one and only saving?
That's correct.
And so we shouldn't be able to, we cannot anticipate seeing that occur again?
That's absolutely correct through the chair. That is a one-off.
Why would it be one-off? I mean, we're constantly doing policy work. We will require additional legal services. How can that just be a one-off? If we've identified a way of saving money by doing things differently, is there no case to be made by replicating that?
Through the chair, there are various phases to the zoning bylaw, and we are in the phase now where we are using our internal staff. We have 3 staff internally, as well as legal staff that are working full-time on defending the OMB. This was for a specific issue related to the OMB where there were monies set aside that were not fully spent, so it is an anomaly.
Oh, I see. So basically, it fell short on the expected budget to be spent, but you didn't spend the full amount.
That's correct.
That's seen as a savings. Oh, okay. Can you, and I know that this has come up at the Planning and Growth Committee, but considering we're at the Budget Committee, can we dig a little bit deeper into local appeals body? I would just like, and I apologize if the question was already asked, I just want to understand, have we made a clear business case for that? Because every year it comes back onto the discussion either through a staff report or it's coming through budget, but we still don't have it implemented, and it's still unclear to me on what that business case is.
Councillor, I'm sorry, I have a feeling this has more to do with the city manager, I mean, with the local appeals. He'll be bringing a report to us, so this is actually not a planning question. This would actually be a question of the city manager, who is, even though it, I think, will fall within planning, the city manager is bringing that report and is responsible for that kind of a question.
Okay, the only reason I ask is it's sitting under the city planning budget notes, that's why.
I think that's why, but that kind of question would probably be more directed to the city manager when that report comes, as they're working on it, I understand.
Okay.
Through you, it's coming forward in January, the report.
Okay. Then maybe another question that doesn't require the city manager's attention, but perhaps our chief planner can respond to it. I think there's a reduction of one position that was removed from staff complement, and that's on page 7. What was that position removed? I'll read it to you. Approval of the 2016 operating budget will result in city planning reducing its total staff complement by 1 position. Are we losing a planner? Or?
Through the chair, that is a reduction. We have in fact reduced 2 positions in the zoning bylaw team as we are transitioning the work from writing the zoning bylaw to defending it at the Ontario Municipal Board. The work program has shifted.
So it's a reduction of 2 persons, is that correct?
That's correct. It's 2 positions from the zoning bylaw team, but we've in fact added a new project coordinator position, as was mentioned, for Section 37, which is why you see it appearing as 1 staff reduction.
But the staff complement that will be added to manage the new Section 37 component of the work, that's a different quantum than what is identified as a reduction of the amount reduced by 1 position here.
Your last question.
So it's a difference of 79,000 versus 373,000.
Through the chair, it's a change of net 1 position. The Section 37 position is, as was mentioned earlier, funded in a different way. It's through the orphaned interest from past years in Section 37. We had to do some detailed work to ensure legislatively that was in fact something that would be acceptable to the province, and it is. So it's a net 1 change, net 1 position change.
Okay.
Thank you,
Thank you.
Councillor. Councillor Mihevc.
Thank you very much. I have 2 questions. One is around transportation planning specific to the bicycle infrastructure. Is that your department, sorry, I'm seeing Stephen, it has nothing to do with planning, or is it totally within transportation?
So I can begin, and then Stephen Buckley can chime in as well. We, in fact, have a memorandum of understanding between Transportation Services and City Planning with respect to roles as they pertain to cycling planning infrastructure. Stephen's group is responsible for the planning as well as the implementation and the operation of the infrastructure. However, frequently there are projects and larger scale policy initiatives that involve cycling infrastructure that city planning is engaged in. For example, the design of the street right-of-way for Eglinton Connects, which includes 22 kilometers of cycling infrastructure, was designed through the design work that city planning undertook. So the bulk of the work is undertaken through Stephen Buckley's team.
Great, okay, so I won't ask on that. My only question, and I was trying to find the page, is around the Committee of Adjustment applications. Your chart here had something like 60, 70% within 60 days. We are, well, honestly, we're getting complaints that it's taking 90 days, sometimes 120 days. And I'm wondering, is the block the lack of meetings, or is the block the staff time to prepare the documents for the meeting?
Through the chair, there's a really significant challenge with the Committee of Adjustment today, given the volume that we see, and the volume continues to increase significantly. This is one of the reasons why we are, in fact, creating some temporary positions to help with the backlog and address the backlog. There are two challenges. One is the receipt and review of the applications. The other is the capacity of the committee to just sit down and how many applications they can actually process in one meeting. We're experiencing pushback right now from our Committee of Adjustment members that the volume is too high at each committee meeting. They simply cannot deal with the volume of content that we're putting before them. Sometimes they're spending just a couple of minutes on applications. So the challenge has to do simply with the threshold of volume.
So given that we're wearing our budget hats here, is this something that if we were to invest more dollars, we could do that more efficiently, recognizing that at the end of the day, we need to renew the downtown core, we need to renew the older parts of the city. They are being renewed, and some people are being not pushed, but they're being not demoralized, but they're being disincentivized because the process takes so long. We're losing business as a result.
Through the chair, I believe that the key change that we need to make here is, in fact, around additional staff. We are hiring those staff through temporary positions in order to respond to the volume that we see. We have the funds to do so because it is a user fee-based model. So the funds exist, the funding, the money is not an issue. The issue is whether we eventually, a year from now or 2 years from now, see this volume as continuing and determine that we ought to make those temporary positions permanent positions. But at this point in time, the issue is in fact not a budgeting issue, it's not a budget constraint. We simply need to, and we are in the process of doing so, hiring the temporary staff that can respond to the surge of applications that we've seen over the course of 2015.
So your benchmark of 60 days, your benchmark is 60 days, right?
Correct.
We should expect that to, I think you had a completion rate of something like 70%, maybe even 80%. If we want that to 95%, you have the money now, or will have the money with these temporary positions to be able to achieve something like a 95% 60-day rate?
Through the chair, I would be very careful with making any kind of statement of that nature, in part because this isn't simply, as I mentioned earlier, an issue of staff being able to process. It's also the volume of how many applications a committee can in fact sit and hear. So we might need to, in the future, look at a new model where we have additional committees with additional members in each of the districts so that a higher volume of applications can be heard on a regular basis by the committee. But the challenge right now is twofold. It's on the staffing side and it's the volume. If you solve the staffing issue, that doesn't address the capacity of the committee to actually hear more applications.
So should we be asking council to get more folks on the Committee of Adjustment to have, let's say, downtown area? I think there are 2 panels maybe a third panel. Is that an
Last
answer
question.
too?
Through the chair, we're in a process right now as a result of a direction through PGM several months ago at looking at continuous improvements for the C of A. And we have a roundtable that we're convening in several weeks that is looking at what kind of strategic operational changes that we can make in order to improve our KPIs. So I believe that we have that direction underway, and we will be making a recommendation with respect to changes to improve the service level.
Thank you, Councillor. Seeing no other questions from oh, sorry, Councillor Nunziata, I didn't see you back there.
Sorry, just a couple questions. You responded to one of the questions that was asked earlier. It takes approximately 15 months to process a planning application?
Through the chair, 15.9 months, that's correct.
And that is rezoning, depending on what the application, if it's just
That's correct.
2 townhouses, it shouldn't be 15 months.
That's correct. That's an average. So you can
average.
imagine that there's a significant number of applications that are shorter, particularly those that go through the Gold Star program.
Right.
And then on the other end, there are applications that, as you know, take years.
So how long would that take if it was just a small, very small application, development application?
Through the chair, one of the problems we have in the review process right now is that the scale of the project doesn't in fact determine the length of the review. So for example, we've had many large-scale projects where we're working with a very sophisticated developer who understands the requirements of the city and is able to move through the process very quickly, even though it's a very large project. And then we might have a small developer who's never developed before, who's developing a couple of townhomes that doesn't get us the arborist report or the stormwater plan, and it takes months and months to in fact advance that application. We are better at determining how long a process will take by the experience and expertise of the developer and the developer's team than the scale of the project.
So would it not be helpful when those applications come in and you have a developer that's not experienced, that is not familiar with the city process, to give them, have that communication at the beginning of the process, to give them that information so we can speed up the process?
Through the chair, absolutely, and that's one of the key directions in our strategic plan is to be more proactive in our communications. So for example, next month we have a brochure that is all about Committee of Adjustment. It's a user-friendly guide to the Committee of Adjustment, and it's precisely intended for that reason, to educate people that are engaging in the process so that we can meet with more success and shorten the process.
As far as the avenue studies, so what is the backlog on avenue studies? And how many have been completed and how many have been appealed?
Through the chair, I don't actually have the breakdown of only avenue studies, in part because the data I have in front of me links them together with area studies, regeneration studies, secondary plans, and transportation master plans. But over the course of 2015, we completed 20 in all of those categories. I believe we completed, specifically in terms of an avenue study, I believe there was one that we completed. In 2014, of course, we completed one that was equivalent to 7, which was Eglinton Connects.
So how many have been appealed? Because you've got here on your presentation, page 11, that St. Clair Avenue has been completed, but that was appealed.
Through the chair, most of our avenue studies, in fact, are not appealed, nor are secondary plans, although some of the big ones have been, such as on St. Clair and
St. Clair has been appealed.
Central Waterfront, but the St. Clair has been appealed, but most of them are, in fact, not appealed.
So on page 11 in the presentation, so what does that mean where it says completed several aerial studies and you've got St. Clair Avenue West that's been completed when it's been appealed? Is that the same avenue study or is that another one?
Through the chair, this is a very important question because we, in fact, measure completion when it is approved by council. We have to measure what we control. So if something's appealed, that is after we've met our KPI of completing our work, bringing it forward to City Council. It's been approved by City Council. we will mark that in our KPI as a completed study. It might still then be appealed and not yet implemented in regulation, but we measure that as a KPI as a completion.
But if it's being appealed, that you would still need staff resources through the appeal process, no?
Through the chair, that's absolutely true, and that's why it's very important to have clarity as to what that measurement in the KPI means. It does not mean that staff work ends. St. Clair is a good example where there continues to be a significant amount of staff work, even though we have in fact completed the KPI and it has been measured as complete.
Okay, does that have time for one more question?
Quick
No.
one, yeah.
One? Okay. Committee of Adjustment applications, you've got 3,336 that were submitted from January to October. How many were appealed? Do you know what the amount is that have been appealed that's, that we're sending legal staff?
Through the chair, I don't have the exact number for 2015, but I know from previous years, and I can in fact get you that number, it's very low. It's between 4% and 5%.
Thank you. Seeing no other outside councillors, thank you. I think we're all done on planning. Next, Waterfront Revitalization Initiative. Questions of committee members. Councillor Layton.
You know what, if Councillor DiCiano, and just as I'm pulling
Okay.
it up, if that's all right.
Councillor DiCiano, you want to go?
Thank you, Mr. Chair. Through you to staff. In the overview of the Waterfront Revitalization Initiative, it talks about what the original 1.5 billion was to undertake. One of those processes was brownfield remediation. Are we remediating land only ultimately that's going to be used by the city or for sale as well?
Through you, Mr. Chair, it's the latter. So Waterfront Toronto has been entrusted to remediate the lands which mostly are contaminated, or mostly are, quote, brownfields in the waterfront. And it is remediating both lands for public purposes like parks, but mostly for the redevelopment activities that they joint venture with the development community, like Hines, like Tridel, like all the people that we are engaged as partners in the waterfront revitalization.
Remediating sites is a very, very time-consuming and expensive process. Would you agree with that?
Mr. Chair, yes, I would.
Have we done a cost analysis on whether we save money by selling lands dirty versus cleaning them? Because in my experience, the private sector has always been able to do it cheaper than the government. Has there ever been a cost analysis done on whether it makes sense to clean it ourselves versus just sell it off?
Mr. Chair, the specifics are, it's the devil's in the details on this one. So on any particular site, the type of compounds in the soil, the type of contamination is entirely determinative of the type of remediation that has to happen and the extent to which soil has to be shipped off-site. So it's a completely site-specific record of site contamination and methods of remediation that's required. So you wouldn't do an overall analysis. Obviously, the lands in the waterfront are important to the city for city building purposes. It is our intention to make the best and highest and best use of that, consistent with our waterfront plans. And we use Waterfront Toronto and trust Waterfront Toronto takes that site-specific analysis with all the proper environmental safeguards that are required.
Would you agree that the private sector could possibly clean these brown sites cheaper than we could?
Mr. Chair, I don't think there is an easier answer to that. I don't think that really is the condition that we're dealing with in the waterfront. The waterfront is being redeveloped through private sector work. It has the type of studies that are, when we engage either for a public or private sector client, the proper expertise. There's a group of consultants that do this work. There's a set of standards, and they're reviewed by the appropriate peer reviewers and the Ministry of the Environment when required.
Is all the brownfield remediation complete at this point, or is there still more to go?
Oh, there's still more to go, Mr. Chair.
Okay, that's all for now. Thank you.
Thank you, Councillor. Councillor Layton is next.
Thank you very much, Mr. Chair. Has the city utilized the Federation of Canadian Municipalities Green Municipal Fund for any of the cleanup efforts to date, or do we have plans to access?
I don't think we have through Waterfront Toronto. I'd have to check offline for you, Councillor, just to confirm that, but I don't think the FCM fund has been a source there. Obviously, the big site is the Pan Am site. I mean, that's the really big one through the province of Ontario, largely done by them. So it wasn't really Waterfront Toronto, although it's gone through our books in some fashion.
Okay.
And I don't think we've used it on Hines or Tridel or First Gulf.
Not sure.
But I'll check. I'll check on that.
Can it be used on privately owned lands? I'm not sure.
Well, there are some public elements, so potentially some of the public elements could have been done that way, but I don't think so. I think, no.
The cost estimates for the second phase of waterfront revitalization priorities total $3.1 billion. Right? How much of that is below the line? How much of the city's portion is below the line, and how much have other levels of government already committed to for that?
Good question, Mr. Chair.
On page 19,
Yep.
the preliminary cost estimates for the second phase of waterfront revitalization. Yeah, the 3.1 billion.
You, Mr. Budget Chair. I don't believe any of that's funded.
No.
And a financing plan, something has to be developed. And if we take the previous model that we used of one-third, 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 that, that's going to take some significant intergovernmental relation work with the federal.
Supports from other levels of government.
Yes. Yeah. And I think that's what's being, we're engaging in that kind of exercise right now. But there's no funding for that.
So we've gotten a preliminary cost of the East Bayfront transit line, right?
Yes.
And how much do we have budgeted compared to the actual?
We don't have any money.
No, actually, we have $10 million identified for a project that
So you're going to
currently
install
is
like 1 meter of
estimated-
track, right?
yeah, it wouldn't get you very far.
The waterfront transit reset, where's that sitting, and how is it gonna, how's it work its way from budget to from bullet point 2 on page 20 to reality? And how likely is it that we'll actually see that work done?
So we're coming back as instructed, the first quarter of 2016, to show you what a waterfront reset would look like, taking into account both what's happening east of Yonge and what's happening west of Yonge, as far over as the border in the west and as far east as, I believe it's Woodbine Avenue. And we're trying to be eminently practical what could be done, and looking at some of the problems we've had with pinch points, like the stretch up Bay Street for the East Bayfront LRT, which is basically the majority of the cost of that East Bayfront LRT project. Looking at the approved EAs and the ones that are sort of been hanging pending out towards Roncesvalles and across the Gardner. So we're looking at all those things, and we'll be reporting in the first quarter, as I said.
That'll include an evaluation of the waterfront west?
Yes, it will.
Was the Waterfront Revitalization Initiative responsible for the EA for that, or was that a TTC driven?
It was TTC.
Okay. Okay, thank you.
Thank you, Councillor Layton. Councillor Carroll next.
Just a quick question. I'm wondering if it sort of has gotten lost over time in history. We used to have a comment in here years back around the issue of brownfield remediation. It came up when we were talking about the studio under the whole TEDCO deal years ago. And there was an evaluation done at that time, I think internally, that there's a nexus of if you're not selling the land outright, but you want to do some sort of partnership, the value of the land and bringing in truly viable partners, the remediation really had to be done on the public side because you didn't get the top flight partners unless we did the remediation, not because of the cost of it, but because of the liability. It's not just doing the remediation, but then who is then forever on the hook for, did you do it properly?
Yes, that's largely true. But again, coming back down to the specifics of individual sites, there's specific agreements that are reached with the development partner to see who assumes which part of the risk. I would observe that our worst fears have not been realized on many of the contaminations. In fact, we've been able to remediate sites at things that make the deals work. So we seemingly are able to work our way through this in a commercial sense with the, but you're right, the sharing of that risk is important. There is an environmental reserve that we had set aside for the waterfront secretary. We have not had to draw on that as a result. And yes, we did actually separate out TPLC, Toronto Port Lands Company, from build because we felt there was an environmental risk or contamination risk that we wanted to separate. And that is probably diminished, in our opinion, in import from the times that decision was made.
Point of order. Can I just get clarification on the liability component to your statement?
Well, perhaps my next question will help
Not
you with that.
necessarily a point of order, but I think you asked the question to
Not
clarify.
really points of order on Q&A, and I'm in the middle of still asking my Qs. Let's get the As.
It was a good try.
Yeah, nice try. But what we heard then also was that if you left the land sitting there fallow and you didn't do the remediation, it doesn't appreciate in value. It sits there continuing to be a low-value land because it needs to be remediated. Versus as soon as you do the remediation, along with market forces, the appreciation starts to really go because you've done that remediation. So its potential is going to net the city more in the end.
Mr. Chair, I wouldn't actually agree with that. The lands continue to escalate in value, either in raw or an improved state. I take your point that if you do remediate, it creates greater value, but we see the prices of land, both contaminated and remediated, continuing to rise in the waterfront.
Yeah, which is sort of the statement. The statement, including a discussion of liability, it was early on. It was in my first term of office. I'm gonna go on an archive hunt for Councillor DiCiano.
Thanks a lot. Seeing no other committee members, Councillor Cressy, you're on.
Thank you, Mr. Chair. Through you, Mr. Chair, to the DCM. Just for the background, so Waterfront Toronto was initially set up in 2001, is that right? Or in that?
2001, yes, Mr. Chair.
2001. And when it was initially set up, it was set up to have a specific set of public policy-driven objectives to guide the work as opposed to simply a redevelopment profit maximization for the city bottom line. Is that correct?
Absolutely correct, yes, sir.
And what were some of those objectives?
Well, a number of, the revitalization of the waterfront generally, the provision of public spaces and open spaces, affordable housing, waterfront transit, economic vitality, interests in innovation and strong economy, telecommunications, et cetera.
So the economic impact was but one of a series of objectives that have been determined by all three levels of government to guide waterfront revitalization.
That's correct.
Okay. There was a recent third-party review of the first phase of Waterfront Toronto that was conducted. I know it came to council in the spring, I believe. What were some of the findings of that review?
So the review indicated that based on a report, I think it was Urban Metrics did for them. I've got the numbers here. 16,200 full-time jobs were created. $620 million of tax revenues were collected primarily by provincial and federal governments. $2.6 billion of private sector investment had been made under Waterfront 1.0.
So 16.2 thousand full-time jobs, 620 million of tax revenue for all levels of government, and the economic impact was $2.6 billion?
Of private sector investment.
$2.6 billion of private sector investment. And for those outcomes, how much public sector investment was put in?
Approximately 1.5 billion. We're about $100 million short of that right now.
Pretty good return.
Yes, sir.
In the spring, Council endorsed Waterfront 2.0, with Waterfront Toronto continuing as the lead implementation agency. So in the analyst notes, you go over some of the future priorities to guide that work.
Yep.
Can you give us a top-line summary of what some of those priorities are?
Well, the first one that's been a long-time priority and is now reaching some culmination is the Don Mouth renaturalization, the flood protection that it will provide, freeing up hundreds of acres of land in the Portlands and south of eastern area. Flood protection now is provided by the berm on the west side. That's basically a $1 billion project. We're in the process of doing the due diligence to make sure soil costs are in the ballpark. Then we're engaged with federal and provincial partners in the work that needs to go, including the funding to support that. Servicing of the area, we've got servicing commitments of about $150 million. Public realm for about another $300 million is earmarked. We've got transit. I think it's probably in the order of $1.7 to $2 billion worth of transit that's yet to be found in terms of funding, but the time is appropriate now for us through the reset to identify what it is that we can do to attract federal and provincial dollars to waterfront transit.
Okay. So with those priorities, did I understand correctly that, well, and based on our early assessment, it's around a $3.1 billion price tag?
That would be the total, yes.
Yeah. And so further to Council's direction and endorsement of Waterfront 2.0 with Waterfront Toronto, the next stage is for a call to action from our mayor to work with other levels of government to secure that funding. Is that correct?
That's correct.
So the city's portion of that funding is currently not within the 10-year capital plan, right?
Not entirely. There is some development charge dollars for some of the infrastructure identified in the current development charge regime, and there's an intention to have an area-specific development charge for flood protection as well.
Okay.
So I wouldn't rule out, I wouldn't say all of it is not there.
Yeah.
There is some there.
Wonderful. Okay. Thank you very much.
Councillor Fletcher, you're next.
Thank you. Thank you for a comprehensive report this morning. It was very good. A few questions on a number of areas, this one being one of them. You'll have to correct me where I'm wrong, but it was my understanding in the previous year that we had committed $333 million to the Don Mouth to realize the dream of naturalizing the mouth of the Don, and that we were simply looking for the companion funding from the other levels of government. And that was, Waterfront Toronto was very clear that we had anteed up our dollars and all that was missing were the other two levels. And what I've seen now in the presentation, the first go-around, was that that's not in the budget. So how do you, how do we
I'll try and
rationalize?
clarify. So the current DC bylaw has about $200 million identified in it for items that are included in the $975 million ask that we have made around naturalization of the Don Mouth. The area-specific, the quantum is yet to be determined, and we will see what that does, but it will largely close the gap. So between that, I don't think we're very far off on the city's portion, and that was the spirit in which we suggested that we were basically there on our share.
So I don't understand how it's on, maybe I'll ask the CFO, how after that explanation that it's somewhere on a wish list rather than a real list.
Through you, Mr. Budget Chair, it's because it hasn't been budgeted yet. We haven't finalized a financing plan for it. And to be honest, and we've met a lot of resistance, hesitancy to try to close that gap between the 200 million and the billion just on area-specific local DC. I don't think we'll be able to do all of that, so there will remain a gap, and that's the gap that we're trying to chase. We've made an application with the Building Canada Fund, and we're going through that due diligence process.
Just if I can, I understand the gap isn't between the billion, that we have a portion, 333 million, that was committed previously quite publicly, actually. And then the other levels of government each have a $333 million, which leaves $1 million out, I'm sure.
So I would say, Mr. Chair, if I could just.
So it's not $1 billion.
No, so there's, roughly the total cost is $1 billion. There's $200 million that we know for DCs for the infrastructure involved. They're citywide. For example, the sediment pond, the bridge over the lake shore, those are things that we know they're in the charge and are earmarked for our contribution for this. It didn't get reflected maybe in the notes quite as accurately as that, but that is the case. We know we're going to do an area specific. We don't know what the quantum of that is. It'll be, somewhere between 50 and 100 and something million dollars. I think it will be very close to, if not close the gap for the city's portion.
Yeah, the city's portion. Would you not agree with me, though, that we have publicly said that we're ready?
I believe we are. We just have to detail,
But
we just have to close the financial details on the area specific, have it adopted by council, have it committed into the budget formally so that the accounting all matches up with our intent.
I understand. However, it is on the wish list rather than a budget list, and that is of concern. So the other thing is, on the Gardner, on the hybrid, where are the extra funds coming for in order to realize the hybrid? I'll ask you, Mr. Rossini.
So through you, Mr. Budget Chair, we have put in, remind me now, Steve, we have put in the hybrid, which level in? The hybrid base case into the budget numbers that are now before.
And that is how much?
And 2.3 billion? What is it, 2.2, 2.3 billion, the total?
Sorry, couldn't hear you.
Steve's getting, I think it's 2.2 billion.
2.2 billion base case for the hybrid, and how much of that is coming out of DCs?
For you, there's very little in DCs because this
Very
is
little.
basic, this is not a growth-related project.
Is there no way, since the hybrid is going over the mouth of the Don, we're at 2.2 billion, and we're looking for 200 million, that we wouldn't consider somehow dovetailing those projects to make sure we're making best use of our hybridization and the Don mouth, which are very close to one another?
Your last question.
So, Mr. Chair, when we finalize the detailed design this spring on the Gardner hybrid option, whether it's option 1, 2, or 3, we'll have a detailed costing that we then can feed into the Gardner Strategic Rehabilitation Project. We would expect that that project would carry both the rehab on the deck portions and the bridge structures across the Don together, because we think by bundling them, we'll get a better price from a consortium and attract potentially some federal and possibly provincial monies.
Thank you, Councillor. Deputy Mayor McConnell for questions.
Thank you, Mr. Chair. Thank you very much. So we're still, are we out of the OMB yet on the East Bay front? Are we finished with those?
We're not yet, but we're very close.
Oh, I've heard that for years. But we're fingernail clippings away, yes, is that right? Everybody is nodding. Oh, my Lord, hopefully before I get too old. All right, so within that, we will have accomplished quite a number of those targets, including affordable housing and some of those opportunities, correct?
Yes, Mr. Chair.
Great. The next piece is really about a concern that I had when reading this, and it's the same concern as you've heard from the other two councillors, which is really about it being on a wish list rather than embedded into our budget. I would have preferred that the hybrid would have been on the wish list, and that we would have been realistic about what has to happen in terms of our waterfront. And, you know, am I correct that we are getting pretty close in terms of the federal government and the provincial government committing their portion of this? Isn't that correct?
I would agree with that statement, Mr. Chair.
Yes, and I think that certainly in all of our conversations, particularly with the new Minister of Finance and with the new infrastructure, who turns out to be a great pal of Toronto and FCM, that we're kind of on the quick trip to a resolution. And what concerns me, and maybe what I need, is some timelines before the end of this budget as to how it is that we can close the budget without having our own monies embedded so that we are able to match any monies that are coming forward, especially since the expenditure of those are not obviously this year. So, you know, when we're not even in the 10-year plan, and we hear that we're almost out of the OMB, that we've almost got the three amigos back together, and that somehow we don't have our money. We have council approval, but somehow we don't have our money.
So, through you, Mr. Chair, the key to this is a report that comes to committee and council detailing the area-specific flood protection works that remain. That report, I hope, will address any gap.
Good.
And if not, if there's some residual gap, we will recommend ways of closing that gap, eliminating that gap, so that that will not be an issue for any federal or provincial funding.
But the other reason that I'm asking about this is that the area-specific DCs, we're starting to get to a point where developers are already building, and so when would we expect that report would come? So that I'm just trying to make sure we're lined up correctly, right?
We are doing that work this year on the area-specific DC.
Yeah, but when you say this year, like I'm talking about within the next month or two, because I've got developers that are in the ground. And,
I'll have to check with staff when they're exactly this year, when they're bringing it in, and I'll check with Joe.
okay, because I think that, I would like it in the first quarter. Like, I don't think that we can wait. I don't know what others are saying, but for me, if we're out of the OMB and got three amigos, we better have our ducks in a row so that as the developers are cutting and breaking ground, we're able to have the right stuff in place, or we'll end up with an area specific for an already developed area. So, is it possible that you could report on that to us before the end of the budget? Oh, that is great. And then finally, if I could, my next question has to do with all of this, because the development is happening in my area as we speak. We had a commitment to all of those developers who are putting in the monies that were identified to Councillor Cressy, I guess the $2.6 billion private sector money, that we would have rapid transportation. Is that not correct? That's in our agreements, is it not?
Through you, Mr. Chair, that is correct.
Yeah. So it's in our agreements, and so, but we do not have a budget line that supports it, since we moved the budget line for the east to the west in order to continue to Queens Quay. And then we had a hard stop, expecting that we would, by this time, have a resolution. Isn't that also correct?
Through you, Mr. Chair, that is correct.
Yes.
Thank you,
okay.
Councillor.
Thank you.
We want to come back into committee to ask another question.
Just some follow-up questions on development
Councillor
charges.
Pasternak.
And just through you to staff, by normal course of policy, are development charges directed locally through building applications?
So to date, the only DCs, all our DCs are citywide. When we did our, in the fall of 2013, when we did the latest update to our DCs, we recovered a portion of the Portland servicing costs citywide, and said that we would come back with that portion that relates more specifically. So, and if we do end up doing a local or area-specific DC, it would be the first one that we would be doing, yes.
So this is actually breaking with city policy to direct development charges generated from projects along the East Bay front to that transit project. And in fact, it's setting a precedent for the rest of the city.
No, sorry. It's not that we would be taking DCs collected in that area and using it just in that area. We have all our DCs broken up by service. We would have a area-specific DC for storm management or water services. And it's just that monies then that would be collected specifically against the developers in that area and then reinvested for the infrastructure for that area. The other DCs for transit, for roads, for parks and libraries, they will continue to be citywide, collected from that area and applied citywide.
So other than local infrastructure, how are DCs generated for East Bayfront?
Right now, we've put a portion of the costs citywide, and there's some, I believe it's some $200 million. And so they are collected like our regular DCs and applied to projects. When that project gets final approval, we would fund it. And now there's a portion of the costs, though, that are going to relate specifically to that, to those areas, and that's the portion of those costs that we are looking at a local or an area-specific DC to be recovered just against benefiting landowners for that particular infrastructure. It is a different way of doing this because we've never done area-specific, but is not uncommon in Ontario for area-specific.
So theoretically, through this precedent, council could direct citywide DCs to very targeted transit projects within a catchment area.
We, for transit, we have numerous amounts of projects in there. We collect a DC citywide, and we apply them to those projects all over the city. The difference with transit feeds into a citywide network, and you can hop on and hop off anywhere in the city. What we're talking about is more localized infrastructure that benefits a well-defined specific area, so we have a separate DC just for in that area, just for those benefiting projects and benefiting landowners. It's a little different.
And was that embedded in the development application?
I don't understand the question.
Was that part of the development application?
You mean the development charge bylaw?
So we don't have that local or that area-specific development charge bylaw. When we bring it forward, it would be a requirement of every developer, every development to pay that area DC once and if it's adopted by council.
So it was done with the disposition of the land, at the time of disposition of the properties.
We're veering a little off topic here about waterfront. We're getting into a bigger discussion here, so I will...
Okay, fair enough. My questions are answered.
Councillor DiCiano, you have a second round of questions.
Yeah, thank you, Mr. Chair. I just want to follow up on Councillor McConnell's points that I find somewhat concerning. Did you say that we're working on area-specific DC bylaws for the area that Councillor McConnell's just spoke to?
Just for the Portland's stormwater drainage service. So one particular area for one particular service, and we made that clear with the landowners and build when we were doing our new bylaw update that was passed in October, November of 2013. So those discussions have happened. They know that we're doing that, and we're in the process of doing that work.
But if developers are already building, what did you charge them in terms of DCs if you haven't identified the needs yet?
Nothing has been built in that area yet. Nothing.
Oh,
no, so
Councillor
it's not
McConnell
like
said
we've lost
they've
development.
started building.
It's a different area.
No.
Okay, I'll take that offline.
Yeah, there's no development. No
Okay.
building permits had been issued yet for
That's
that
good.
area to which this local or specific development charge could have applied.
Great, thank you.
Councillor Davis.
Just, sorry.
And maybe, Mr.
Can answer
Chair.
the question on
Oh,
the
sorry. Okay.
timing.
Okay.
Q2, we're going to be bringing forward that
And
local DC.
what month of Q2, please? All right, never mind, I'll bug you
Take that
later.
offline. Councillor Davis, you had another question?
Our development charges bylaw has been challenged in the court now, and for the Scarborough subway extension, I have some questions about how development charges are being assumed in this budget, and I'm wondering, you've raised this. This is a more general question I have, and I'm wondering, will we have time, and where would it be? Under non-program? Are we going to spend some time on non-program this year?
Yes, we will. So just to answer your question, how have we assumed, or what have we assumed for development charges, to you, Mr. Chair? We've assumed revenues and the forecast that we have under the current stream, and then in the capital financing strategy, we've assumed even additional of revenues from DCs once the old bylaw expires and we do a new one.
Well, I also have questions about other developments and the financing schemes that are pending. We're waiting to hear all about how we're going to finance Smart Track, and we're looking at a whole number of other. Could we please talk about, spend some time on development charges?
Let me speak with financial staff, and I'll get back to you. I can't answer you. Okay, let me get back to you on that.
Because these are different strategies that we are using for Scarborough Extension in particular.
Yep, okay.
Okay, thank you.
Councillor Cressy, you had a very, very quick question.
Very, very brief to either the DCM or the chief planner. Under the planning regime, area-specific plans, using DCs or levies, are permitted and in fact have been used many times in the past in other areas. Could you confirm if that's the case, and just for the sake of everybody here, identify some of those other areas like the railway lands or others? Or the Shepherd sub.
Area specifics have been used. They've been used in other places in Ontario. They've been used in other places in the city. This one is very specific about the landform that we'd have to provide on the east side. That's a benefit to the existing landowners who will now not be flooded. Unlike the bridge across Lakeshore Avenue or the sediment pond, which benefits the entire city, that landform is directly tied to the benefit to the adjacent landowners, and therefore is eligible for an area specific and not really suitable for a general application.
And just as the follow-up, some other instances, you mentioned province-wide, but in the City of Toronto, where this has been the case, whether it's the Shepherd subway or the railway lands, those are two?
Yeah, it's a sense of value capture scheme, yes.
Thank you.
Okay, Councillor Fletcher, your second question will be as quick as your first, of course.
It will, actually. I just want to go over a couple of things. One is the Lower Dawn EA, and that was finalized. It was done in 2010, reconfirmed 2012, and the price tag was put on sometime there. We knew the cost of that a while ago, around $1 billion.
It was approved last year? Last January.
What, the money?
No, the EA.
The EA, but we've known the price tag for that for a little while.
Yeah, and it's got components around flood protection, it's got components around infrastructure like bridges and other civic infrastructure.
I'm just going to note that tandem to that, in exactly the same area, is the Gardner Environmental Assessment, and being very familiar with them, they weren't interwoven in any way, and they agree with me. I think that the intent of the Gardner EA, when it was brought forward, was simply to bring the Gardner down. So then what council's approved now is the hybrid, which means that I assume we'd be doing work on flood protection and the Gardner linkage around the same time? Or would those be two separate projects going in twice to the same area?
Thank you for the question, Mr. Chair. First, I want to make sure you understand there has always been coordination between the EA for the Gardner East and the flood protection. So locations around pillars and how it affects sediment ponds and the flows and all the dynamic modeling state work that's done by TRC always has an assumption about various options, and we've got a model that takes care of that, so we're completely coordinated on implications for flooding.
Since we moved the hybrid in 2014.
We are, every model run, it reflects the new, and there's been times when design has come forward that has to be influenced by the flood protection characteristics. It continues to be closely coordinated.
So I'm just interested if is there not any chance to look at dovetailing some of the finances between the two projects rather than having them separately? And I don't know if you can answer that today.
I don't know that I can answer that today. The obvious one for us was the bridge construction technology being used for the Gardner rehab, It's a bridge technology, and oh, by the way, the hybrid is a bridge. So we thought it was pretty obvious to twin the bridge construction for the hybrid with the rehab project for the Garner. That makes sense to put that together. We will look at whether or not there's any synergies between that and flood works, which are predominantly moving soil, building armor stone, installing vegetation and other things. I'm not sure that there is, but we could look at that.
Thank you.
Thank you. We are now on to the next item, which is fire services. We're going to start with questions of committee members. First, Councillor DiCiano.
Good day. Thank you, Mr. Chair.
Welcome, Chief, by the way.
Welcome, Chief. Good to see you.
Through you, Mr. Chair. Thank you, members of committee.
A couple of questions for you, mostly on the capital side. You are bringing forward some technology advancements that include the implementation of predictive modeling that apparently will ensure or will aid in ensuring operational resources are positioned across the city in the most optimal locations. What does that mean, and does it save us money?
Predictive modeling is a tool, through you, Mr. Chair, that we use. Is connected to our computer-aided dispatch through another tool called business intelligence. And what the predictive modeling tool will do for us is that it's a live interactive tool. It'll show us at any moment in time where all our apparatus or trucks are. It'll show us, for example, if we have a working fire in South Toronto, the impact to the rest of the community around it that have a depletion because of that call or calls going on. It'll suggest movement of equipment to cover that gap due to the potential delay in response times. It'll also show us, for example, we could look at where better to position our fire pumps, our aerials, our district chiefs at any time. So it's a live interactive tool to demonstrate to us if we have deficiencies of response time based on busyness of resources at any moment of the day or night. So it's a live interactive tool that's connected to the GPS system and our computer-aided dispatch system.
So it means that if you're fighting a huge blaze somewhere in the city, this is, it's a form of analytics essentially, where it's now allowing you to say, okay, you've got so many resources, real time, you've got so many resources in this area. In order to make sure the rest of the city isn't deficient or, you know, we have a liability, we're going to move certain things around in real time to better serve the population of the city.
Through yourself, Mr. Chair, to members of the committee, that's true, and it looks at 10 years of previous call history, and it'll tell us based on that the probability of different stations or different units having a call, so therefore which is the best options to move and which is the best coverage. Now we do that, each of our 4 commands independently makes a decision. It may be the best for their command, but it ultimately may not be the best overall. But it's very difficult in a city of this size for an individual trying to manage the complexity. With this modeling tool, it will be able to do us for it. We're now doing tests on it, it's up and running, and as soon as we're assured that it has all the factors and the complexities, we'll then put it into service, and we're very close to doing that.
Very impressive. Do you know of any other divisions in the city that are using this type of analytics to perform better or more efficient?
Unfortunately, I can't speak on behalf of other divisions because of the uniqueness of the fire tool. There's very few fire services, probably the leading fire service in the country that's using a similar tool is Surrey, British Columbia, and they're probably the earliest integrators of technology like this. So we're using, and that's the predictive modeling tool. The second tool we have that we have up and working, I've got it on my tablet, it's called dynamic staging. It's a tool that uses captured data, up to 10 years of call history that we can review. I could look at performance by call volume. I can look at it by over-goal calls. I can look at by station, platoon by platoon, district. I can look at by ward. I can look at the number of calls, type of calls, the delays. So we have all that data now. So with that analytical tool, it'll help us look at where we have historic issues and how we can look at performance improvements. So it's really a performance tool. Second part of that is a modeling tool. We can look at repositioning stations in the future, where if we move a station and rerun years of history, it'll tell us if that would have improved the results or diminished the results. So as this city grows, we need to be looking at a model based on our master plan of looking at new stations. My average station is 63 years old. I have 3 stations 130 years old. We need a renewal. Many stations need to be either rebuilt, but do we need them replaced in the same place, or are there better locations and better partnerships through what I call storefront stations?
So you're using technology to do more with less, more effectively?
The answer is absolutely, and we can demonstrate in the last year alone the performance improvement using technology, and it will continue.
Thank you very much.
Thank you, Councillor. Any other committee members, questions? Councillor Layton?
Yes, thank you very much, Mr. Chair. And first off, Mr. Chief, I understand a member of your service was injured in the line of duty yesterday, and I hope, are you able to report to us of his condition and if he's okay?
There were, through you, Mr. Chair, there was actually 2 individuals injured at the same fire. It's what's called a backdraft and situation, but both injuries were relatively minor, and both were released from the hospital.
That's good to hear. I ask not only because I was hopeful to hear the answer, but also that this fire happened in a tall building, correct? At a lower story, I believe, of a taller building.
That is correct, both counts.
What can we report, or what can you report on the response times to tall buildings and how they've been addressed over the last year?
Again, with in 2014, through 13 and 14, we embarked on a major change in our communication center, the way we answer calls, the way we manage calls. We've been able to improve in 3 years by over half a minute getting calls out of our dispatch centers. So we went from 4 years ago at 1 minute and 47 seconds. Today we're dispatching calls in 52 seconds 90% of the time. It is one of the best benchmarks in North America. And we're also have improved by almost 30 seconds our turnout time. So doing a better job dispatching and turning firefighters out gets us to a call quicker, gets us to a high-rise building, typically that 1 minute faster. So what we're doing is we're analyzing how many high-rise fires we have, where the fires are, how to get to fire calls quicker. Some of the technical tools will help us improve our performance. We've still got a continual vertical challenge. Part of that we're addressing with our new strategy through education and code enforcement to educate people about the higher challenges in buildings, especially high-rise, and also looking at make sure all buildings meet the fire code and are safe.
So can we talk about that, about this plan to delay hiring of the fire prevention officers, to do it over 3 years rather than 2 years? Why would we do that? Is there any reason besides budgetary pressure in the 2016 year that would cause us to delay the hiring of the 50 fire prevention officers?
I'd have to say it's strictly a budget challenge.
Strictly a budget challenge.
We've done all our modeling last year. I was asked the question by members of council, did we have an NFP standard for prevention pub education? My answer was not yet, but it's coming. We do have it now. It's called NFP 1730. We've done the modeling based on the new standard. The numbers of people we asked for is right on target with the standard.
So the 50 fire prevention officers is would it help us achieve that?
That's correct. We would not be able to get even close without the numbers of people.
And that standard would allow us to achieve this level 2 rather than maintain level 3.
Through yourself, Mr. Chair, that is correct. That's one of the aspects. The other is the improved technical, which we've done. The other is improved communications, which we've done. The last item was a pre-planning program with the operations group, which we are doing as well. So this would be one of the last hurdles and the largest hurdle.
So the Professional Firefighters Association have suggested that there would be a monetary savings to certain classes of buildings should we be able to meet the level 2 rather than the level 3. Is that generally considered accurate?
Through yourself, Mr. Chair, to members of the committee, when fire underwriters did the modeling, they looked at the 318,000 plus buildings in the commercial sector, did an analysis of fire rates at different classifications, and suggested to us that the difference between the classification 3 and 2 would just be over $7.2 million in savings.
$7.2 million could be saved once we achieve the level 2. How long will it take us to achieve the level 2 in what you're proposing here?
Originally, the proposal was by the end of 17 with the additional people and the other elements in place. If we do it over 3 years, it will take till the end of 18. But right now, the numbers of people are actually below the line. They're not part of the proposed.
So if we did it in 2 years, we'd be able to achieve the savings of $7.2 million to these businesses in.
So, Mr. Chair, I have to interject. It wouldn't be savings of 7.2 to the city of Toronto.
No, it would not.
It would
It'd
be to the
residents of Toronto, to those paying their insurance on these particular class of buildings.
Commercial sector,
But-
commercial.
So we're not interested in saving the commercial sector money on their insurance? Is that something that,
I wanted to make sure it was not
okay,
inferred
it's
that.
not a savings to the city of Toronto?
And
Yeah, I'm a little concerned about this, trying to work this out for
I
business.
didn't mean to mislead you on that. It's commercial savings.
How much does it cost to hire, if the difference is in between, with the 50 officers, what's that in a total value? How much?
I think 50 officers would be roughly just over $5 million annually.
Okay, and what happens if we don't hire those 50 officers?
Well, to meet the classification 2 requires a number of, we'll call them merit points, a number of categories. We wouldn't have enough points or get enough credit in all other areas to get to the desired value to reach our classification 2. One of the biggest shortcomings in the modeling was prevention and public education, and we need a score of over 80%. This is worth almost 6%, so it's a large component. Our programs are typically suffering because of lack of resources, and that's been a historic problem. We're now focusing more on education and code enforcement than ever before, but it's a high resource.
Your last question, Councillor. Well, if we need a second round, I'm trying to be fair to everybody. Councillor Carroll, I believe you're next.
Trying to get this answered offline, but it's too late now. I haven't found it in the notes then. There's the chart of user fees that are being brought forward and they're being rationalized, increased to address inflation, but there's no note right beside the appendix, so I guess I'd have to fish for it. So the proposal is they're going up by 9.8%.
Yourself, Mr. Chair, to members of council, the province of Ontario has set the rate, started with setting rates on provincial highways for motor vehicle accidents. That rate was set more than a decade ago at $400, and there was lots of pressure from the Ontario Fire Service to ask the province to look at a reflected rate more reflective of today's times, because it's been more than a decade. So now the province has agreed, and they've made it $450 as well. As there's also a cost of living indexing attached to it. So this is the first time the province has done it. Historically, what we've done when the province has raised the rates across the province, that was a reflected rate that we demonstrated in our bylaws.
Okay, so on those ones, on response fees that we bring in, they're catching up. So what about our false alarm? Because I'm looking at overall, in terms of the preliminary budget as a whole, I'm looking at the revenue picture, and it looks like you budgeted a real revenue increase in 2015, and you came in slightly, you're projected to come in slightly shy of that in actuals, and you're projecting an even lower amount of revenue, despite the user fee increases, a lower amount in your revenue line for 2016. Is that because people are behaving better?
Through you, Mr. Chair, I think I'd have to say the answer is we are finding in many cases better compliance. I think the goal when council created the bylaw was twofold, was to have compliance to make buildings safer and make sure fire wasn't spending an enormous amount of time responding to calls that were false alarms. And, you know, as a deterrent, there was a fee. So for a while, there was a high revenue, which means there's lots of false alarms that we could charge now, and there's less of those. So the actual call volume is being reduced. So it is having an effect, but as you see from the revenue, there's still a lot of people
Significant number,
that
right, yeah.
aren't.
And we're able to collect on that. The actual represents, we don't have there isn't folded into that a collection assumption that it hasn't actually come in cash. We are collecting it.
When I came in 2012, we found that there was a high percentage, a percentage we weren't able to collect because of the time it took to get the invoices out, and now we've added additional staff resources and really focused on it. We find that the quicker we're able to invoice, the better chance we have of collecting. So we've done a better job of collecting at a higher percentage.
Okay. And then back to the unfunded fire prevention and public education staff. That's part of a phased approach. Several staff have already been hired. Are we relatively confident they're all hired, but also really embedded in the operation? They're fully operational, the staff that we've added so far?
Yourself, Mr. Chair, members of the committee, the answer is yes. We typically don't bring in, for example, the 2015 hires that were approved weren't brought in until September. They finished the training program in the middle of December, so really we didn't see the quantum of activity because they're only out in the floor for basically 2 weeks. But we'll see in 16 the advantage of that additional group of 25 staff. So we don't bring them in until the budget's approved, and then based on the annualized cost, we go through a selection process and a training process. So they graduated about middle of December of 15.
So, but you did include the next 17 in your original draft proposal. So the question is, you'd like to see them in the 2016 budget because you think at some point in the year you'd be fully able to hire up and absorb them?
We proposed them in the last 4 months of the year. Similarity, we'd bring them in September, train them. They all come in with 2 or 3 year pre-service program and other qualifications, but they also take a unique Toronto training program, which is in class as well as in the field under an experienced or knowledgeable public educator or prevention officer. But is there the need? Absolutely. Is there the work for them? Absolutely. Can we put them to work immediately? Again, absolutely.
So if they don't make it into the budget, then you'd be stuck. You want them for the last 4 months, but if we don't put them in the budget, then you got to wait through the budget process. You wouldn't be hiring them until halfway through 2017 then.
Well, again, that would be up to the members of council if they approved any additional hires in 17.
Yeah.
Or 18, because again, when council approved in principle the 115 fire prevention, it was based on an annual budget process.
Right.
I suggested at that time there was no way I could ever manage 150 new staff all at once. A, it was a large cost, B, it would be difficult. So I wanted to do it over a 5-year period.
Right. Okay.
Thank you.
Okay, thank you.
Councillor Pasternak.
Yes, thank you, Mr. Chair. With the delay in hiring the fire prevention officers, is there a possibility that we could trigger overtime costs on existing staff?
Through yourself, Mr. Chair, and members of the committee, typically the answer would be no. What we would do is we'd just look at perhaps not such a energetic campaign in some of the areas. For example, under the new NFPA requirements, commercial buildings, institutional assembly, are typically would be inspected once a year. Historically in this city, some were not inspected for 5 and 6 years. The goal is with additional staff, we'll continue creating improvements to that to get to a 1 year. Without the staff, it may be have to settle on a 2-year program versus a 1 year. So we'll still be able to make improvements based on the staff we had the last few years, just not to get to our target as quickly.
Regarding WSIB costs listed on page 26, I think the prediction is that such costs are going to skyrocket in 2016, remain high in 2017. I don't see any projections for after that, but it seems paradoxical in some way that we're adding more and more capital funding into safety, and yet it's anticipated that our claims costs are going to continue to rise exponentially.
Through yourself, Mr. Chair, a number of years ago, the provincial government enacted legislation called presumptive legislation, and in North America and across Canada, cancer is at a very high incidence in some forms of cancer within the fire service, 7 to 10 times in some cases. And so the province of Ontario, as well as other provinces, named 8 cancers at that point in time that were prevalent. There was a number of back claims. They allowed the claims to go back to 1960. There's a requirement to have continuous service in the fire service. Claims can be made. Sometimes there's lump sums or continuations. In 2014, another 6 cancers were added. Those new cancers also came with the provision to go back to 1960. So we now have back claims, so to speak, from other forms of cancer where we'd lost fire staff or have existing fire cap to display those type cancers that are eligible for WSIB. So working with our WSIB providers and corporate staff, that's the best estimate we can have in the short term, because the 6 additional, each one comes, I think, 2 per year for the next several years. So there's additional forms. We're not sure how many back claims may be coming forward. That's one of the challenges we have. So we have, in many cases, lump sums and annual requirements of payments based on the new WSIB legislation.
Have you taken delivery of the new bunker suits yet? Are they coming in yet?
We extended the purchase in 2015 to purchase enough to carry us over for the year of 16. We're now doing a comprehensive 10-year RFP to start in 17 for the next 10-year cycle. There's a requirement in regards to frontline bunker gear, how many years they can be in service. So we have to meet this standard. So that's what we do within this city.
Okay, thank you.
Thank you, Councillor Pasternak. Just have a couple questions myself. A couple years ago, we had a reduction in trucks if you recall, I think it was 2 years ago. I've noticed that last year and this year, there's been no request to add any more new trucks. My assumption is that reduction in trucks, there's been no impact to safety, no impact to response times. I do recall asking, again, a couple years ago for a report on that to see whether or not, or the impact of that reduction. Is there an impact on that reduction of trucks we had a couple years ago?
Through yourself, Mr. Chair, to members of the committee, at this point in time, the answer is no. There was a lot of study looking at the 4 trucks that we looked at the call volumes those trucks had and the ease of coverage from other stations and a lot of different variables. But because of the improvements in communications, the improvements in turnout time, we've been able actually to improve our performance with less trucks. We're improved not because we have less trucks, but in spite of it. So we've actually made some significant improvements, and the reason is, again, because of a very good improvement in dispatch. We're getting trucks out 30 to 45 seconds quicker. Firefighters are out of the station 30 seconds quicker. We have some challenges with road time, which continues to increase because of challenges on our roadways. But we've overcame that, and we've been able to do a very good job. We're doing a very good job getting our what we call first alarm response, which is the firefighters required on numbers of trucks or most type calls where we need multiple trucks. We're doing a very good job. We have pockets in the city where we have challenges getting the first truck out. But that's based on either challenges on the driving or the location of the existing fire station. So we're going to be looking at that as part of our modeling.
Okay, and you mentioned the first response. What about the second response? And I'm looking at specifically from what I recall, the station out in the east end that the truck was removed from, and the concerns of not the first but also the second response.
right now, when we talk at the second response, like typically you send 1 truck or 4 trucks or more, and we do all what we call the full alarm or first alarm response. We're actually doing a better job across the city because all trucks are getting out of stations quicker. Because of the first 2 components, firefighters have been able to turn out, but because of better technology and better dispatching, so we're doing a lot better job of getting them on the road quicker, about 1.5 minutes on average. That's overcame any deficit of not having the second truck in those 3 stations or not having Runnymede. In the Runnymede area, 424, we've actually went from 92% compliance, we actually improved to 94.
Okay, thank you. We'll go to outside councilors now. Councillor Davis is first.
If I can go back to the fire prevention and education plan that we approved, I guess I want to understand, why is it not in the budget? Why is it not the annualized cost of the decision we made to add these firefighters in the budget?
Through you, Mr. Budget Chair. So the annualized cost of the enhancements that were done last year are in. If you look at the resolution that was adopted by council, it did refer to the budget process annually, each installment. And as I said to a similar question yesterday, is we could not fit everything and sit in the guidelines, so we've taken a different approach this year. It's an eyes wide open approach, so we've said, here's where the budget is. This is all the things that aren't included that were referred to the budget.
So the answer is you decided to change council's decision
No.
about what would go in the budget?
No, absolutely not. The master plan, I looked at the resolutions themselves. The master planning resolution, when the fire master plan was approved, it referred it annually to the budget process, the 4-year plan.
Well, that's not my memory of it, but I obviously stand to be corrected. Because I do know that the fire underwriters rating that we got was premised, or the fire underwriters report was premised on hiring these prevention officers and education officers because that I will. Just because that rating that we got from prevention and inspection was significantly higher because we discovered that our inspection and prevention and education programs had fallen so far behind. And the conclusion of the fire underwriter study was, we should not reduce fire suppression staffing until such time as these other measures were in place. It was the new technology and those officers, those new fire prevention and inspection officers. So now we've delayed, and there's been no change in our policy decision that I'm aware of. So if you can find the decision that said we were going to delay this, I would appreciate that. And
So, Mr. Chair, I just have to jump in just for the record. We got a letter previously for the fire underwriter survey saying that if within a year we didn't address some of the issues that they'd identified, they would have to drop our rating from a 3 to a 4.
Right.
We came back and we resolved that by hiring the 68, I believe, fire prevention and other things that got us back up into a 3. And the additional staff, which we agree was in the master plan and which we would like funded, but if, because of the financial situation, not put, other than in this extra part of the budget, but not put in the budget, would get us to a 2. So it was, we corrected the, getting from the 3 to the 4, from the 4 to 3.
Okay,
We're back at 3, and this, the last 50 would get us points that would get us close to, if not to, a level 2.
we approved it before the master plan report. It was approved as a budget decision. It was approved as a budget decision in 2014. So I'll go back and look. I'll find it because and we were promised site-by-site impacts of those reductions, and I just want to say I'm still waiting for the analysis of what's happening in my neighborhood as a result of the reduction of a truck. The other thing that I wondered about was whether or not there actually is a plan. What I heard you say, Mr. Chief, was that you were hoping to meet the fire code requirements, although it may not be a fire code requirement, of doing inspections annually, that we would have to change it to maybe semi-annually if we don't receive this scheduled implementation of those positions. Can you provide us with very specific changes in how we will proceed with fire inspection, public education, and fire prevention programming if we don't hire these additional officers?
Through yourself, Mr. Chair, to members of the committee, we can demonstrate, based on the new standard, with existing staff, what we are able to do, and without the additional 50, what we're not able to do. And again, instead of doing it annual, it'd be actually biannual, once every 2 years versus once every year, so it's versus semi. So we wouldn't be doing it twice a year, we'd be doing it once every 2 years.
So
Thank you.
where's the
That's your
service
last-
standard?
Thank you, Councillor Davis. That's your last question. Thank you.
Where's the service standard?
Councillor Burnside, next.
Thank you. Chief, I have actually 3 questions. The first one comes down is about the elementary school fire safety presentations. Who gives those?
This would be done by the public education group.
So they're lower paid than the fire prevention or safety officers and whatnot?
Today, the staff doing prevention and public education are duly qualified, so a group of them will do pub ed, a group will do suppression, or sorry, prevention or code enforcement. In the future, we're going to look at 2 separate groups. One group trained to do education with prevention as a background and versa. We're getting to be such a special challenge in the field. We need experts in the field. So,
but for the elementary school kids, we could would it be safe to say you could use someone with fewer qualifications?
It'd be someone with a 2 or 3 year fire prevention technology program, which includes the code enforcement and education, as well as someone with a Toronto-based training.
Okay, thank you. The average station, would you have an idea of how much downtime there is for firefighters in the average station on a 24-hour shift? Ballpark?
I'd have to probably do an analysis. When we look at the call volume, time on call, we look at the training time, station time, I'd say probably in the 20% range.
Okay. What's the cost of maintenance at the 83 fire stations across the city in terms of
You got that number?
mopping floors, cutting grass, you name it?
Through yourself, we've got 104 buildings, including training establishments and offices. In the fire stations themselves, 84, the cost of mopping floor and janitorial would be 0. The firefighters do all that work, so they do their own work in the station. So whether it's a station for the apparatus floor or inside the building, they manage it themselves. Corporate facilities, through contract in 2016, will be providing, as part of a corporate contract, all the outside landscaping and snow removal and grass clearing is done, and then they do what's called an internal charge back to us.
But okay, so that's part of your budget. But prior to amalgamation, like snow removal, didn't every station have their own snow blower?
Through yourself, of the 6 old cities, several did, majority did not. It was done in some cases. In most cases, it wasn't.
Do we know what that contract is worth for snow removal?
Salt and plowing for all our sites, again, 104 sites. Contracted services, the internal costs we would pay are $734,324 is proposed.
Okay, thank
Sorry,
you.
$767.
Okay, thanks. And then the big question I have is, you're a trained paramedic, correct?
I haven't been in the field for 20 years, so to say the answer is no.
But you were trained as such?
I did fire an EMS, correct?
Correct, yeah. Would you agree that it's probably time that we go down that road, looking at combining the services? Like, are there savings either in terms of money or in terms of response time, in better improving response times?
I think that when we look at models, if we look at our American model, all major American cities, they've gone down that route. It seems that historically, in U.S., where the same cities manage all three emergency services, they look at some form of integration or amalgamation for service efficiency or cost effectiveness. In this province and in this country, historically, paramedicine has been under the domain of the provincial government, so there's been a different model in this country.
Fair enough, but when you're going to 53,000 medical complaints, would you not be more effective to have trained paramedics going to those?
I think it's a matter of combining the paramedic operation with the fire operation and looking at how, it's got to be based on two parameters and two only: improve service and improve cost effectiveness. Those that have to be looked at and determine the values of that. Our
Have you
American
ever looked at it?
counterparts model that and find it works for them.
Have you ever looked at it on even a cursory level?
I guess that for 25 years I came from that background, so it's,
Do you think it's something that it's worth looking at?
well, I guess that's something that would be up to, the council to make a decision. It's really up to political will.
No, but I know I recognize that. That's our problem, but just from a professional opinion, a respected professional opinion, do you think that's something that should be looked at?
I'm always looking at and be interested in anything that can improve service to our citizens and save costs to our taxpayers.
Thank you.
Okay, I can't even read my writing. I think the next one is Councillor Cressy.
Getting put in the corner.
Can't even read my own writing here.
Thank you, Mr. Chair.
No.
Through you, Mr. Chair, to the chief. Can you elaborate a little bit on what the fire prevention officers do? I understood you talked about fire inspection services. I understand building plan approvals. What do they do?
Well, I happen to have their job description close by. The major responsibility of a fire prevention inspector, through you, Mr. Chair, inspect and conduct investigations in all types of new and existing buildings to ensure conformity with an application bylaws, codes, regulations, reads and interprets building plans, blueprints, installation guides, construction plans and specifications, as well as notices of violation, receives complaints to investigate, inspect, and test fire protection equipment and systems, prepares reports and maintains records detailing information about property infractions, prepares written information for court and appears in court to testify and give evidence, interviews members of the public to resolve unsatisfactory situations, prepares and presents seminars on fire prevention and safety to groups, conducts educational programming, and this is people with a 2 or 3 year fire technology.
So if we don't meet the council-endorsed strategy of hiring an additional 50 this year, the impact will be that it will take longer to inspect sites, that it will take longer to do building plan approvals, all the things you just went through. Those things will either be done at a slower rate or not done. Is that correct?
Through yourself, Mr. Chair, to members of the committee, again, going back and looking a number of years back, it would take on average 5 to 6 years to do what I'd consider a cycle. And in many cases, inspections are done upon a complaint only. We need to move to what's called a frequency-based system for the safety of our residents and safety of our people. That, the standard requires a minimum of once a year, every commercial building.
And if we don't hire these officers, will we meet that standard?
We'll probably, at this moment, with the existing staff, be able to do it once every 2.5 to 3 years.
Instead of, okay, so we won't be meeting that standard.
No.
Now, I understand, so this was in 2013, a council direction to hire 115 fire prevention officers. We hired 15 of them in 2013, 25 in 14 and 15, and we were supposed to hire 25 this year and again next year. Now, I heard from past councillors the notion that these will now be phased in over 3 years instead of 2, by hiring 17 a year, but in fact that's not the case because those 17 aren't even in the proposed budget. Is that correct?
That's correct. We have, of the 115, we have 65 that are in the field now working.
So the proposal is to hire 0 this year, not 17.
Correct. Again, with the budget challenges, that's where we're at.
Okay. So to the CFO, how did you said you defined new and enhanced based on the language that council endorsed. The City Council resolution stated that City Council approved Toronto Fire Service strategies to improve the public fire protection classification from 4 to 3. Where is the code word in that I'm missing such that this became a new and enhanced service?
So if you look at when the POMAX report was approved, and I don't have it with me, but I looked at that, we looked at the wording for both the EMS, paramedics, and this, and it did say that there was language there that it was subject to the budget process.
So
I don't have it in front of me, but I have seen it with my own eyes.
So my
We will hunt
concern,
that down for you.
my
We'll get
concern
that.
here on this is I've just reviewed it, and under questioning to the chief, I understand we cannot meet the fire protection standard without these officers. And the resolution states that council approve Toronto Fire strategies to improve the Toronto Public Fire Protection classification from a Class 4 to 3 and 3 to 2 standard, which we now can't meet because it's being defined as new and enhanced. So what is the code word that city councillors must put in a council-directed resolution such that you will always adhere to it?
This is not a question of us adhering to it or not adhering to it. I would never do anything contrary to what council has approved. What the code word would be is, if you want something in,
I want a code
tell
word.
us in, and you don't say that it's subject to the budget process, that it's just in, period.
So I read...
And all I'm saying is, when we looked at the language when the POMAX report was adopted, there was a reference to, and I don't have it in front of me, but we will get that.
So I guess, okay. In 2014 and 15, the 50 fire prevention officers were not new and enhanced. But in 2016, they are. Why?
No, in 2014 and 15, we did classify them as new and enhanced, and they were in the budget. This year, and we were able to meet they were in the recommended budget,
Yes.
and we were able to meet target. This year, if you notice, you do not have a recommended budget like you have in previous years. This is a preliminary budget. We've told you what's included and at the current tax increase in the preliminary budget, and we said what's not included in the preliminary budget, and we've said, council, budget committee, it's up to you guys to decide what are your priorities and what you want in that final approved budget.
But
we're not saying no, don't do it.
But the
We're just
staff,
saying it
but the
will
staff
need to
proposed
decide.
budget has a $57 million operating pressure. This is part of the $67 million new and enhanced, but the council resolution, based on 2014 and 15 when it was included, means that this should have been part of the base budget pressure, not new and enhanced.
Again, I will get the resolution for you.
Thank you, Councillor Cressy. Councillor Fletcher next.
Just following up on one thing there around the fire protection standard classification rating, with it being at 4, and then 3, and then 2. What is the corporate standard or corporate requirement? And I think that might be a question for Mr. Rossini or Mr. Livy, actually, not the fire chief, but what is who would like to answer that? Mr. Chair, could you stop my time, please? Hello, Mr. Chair.
Right.
I'm just trying to get who's going to answer that, so I don't want to...
I apologize. Can you?
That's okay. I don't mind. I just need you to stop so we can get the right person who's going to answer that question. That's all.
Unfortunately, I didn't hear the question because I was speaking.
Oh, yeah, and it is basically the fire protection standard classification rating 4 to 3, and the goal being 2. I just have to ask, irrespective of the fire chief, what is the corporate requirement for the rating? Do we have a corporate requirement? In other words, the city really needs to be at a 2, or city needs to be at a, or we don't care, we don't need to care. It's different than what they want. It's actually a corporate requirement.
So I'm going to refer to the chief, but I'll start. The underwriter survey and their rating is a commercial rating that they do that is independent from the standards that we would have at the city. It helps inform us. It helped inform us in our master plan. So the council-approved master plan is probably the operative document that you're looking for.
So I do get that, but there's no corporate, like AA, if our bonds are plummeting, that we have to step in quickly.
Well, again, the AA rating of Moody's and Dominion, et cetera, is an indicative implication for the city in terms of the cost of borrowing. It's not our standard, it's a standard that they provide for people providing
Right.
money market
It does
advice.
trigger certain actions that the city proactively, if that rating starts to go, just as I think I'm trying to find out what, rather than leaving it as a council responsibility, what is the kind of corporate responsibility to meet that underwriter's guide?
There isn't a direct connection between the underwriter survey and a corporate policy, other than through, more directly, the fire master plan, which deals with our aspirations to be at level 2. Yeah.
Thank you. This just on the false alarms and to the chief. As far as false alarms are concerned, I'm sure you're tracking that. How many were there again? Remind me of the number. And while you're at it, let me know about the tracking. Are you tracking by frequent flyer? That would be buildings in which there are a larger number, and also tracking by the type of building. In other words, some buildings that we know about, let's take Toronto Community Housing or some of my wood green buildings, house people that are vulnerable and not performing at the highest standard. Is there a correlation between those buildings and fire alarms? And have you, if you can't tell me that, have you done that?
Through yourself, Mr. Chair, that was a lot of questions. I'll try to answer them all.
Okay. How many
I had all
alarms?
the answers,
How
but
many false alarms?
false alarms in 2015, I have the up-to-date data for the year 2015.
Okay.
We had 23,979.
Okay, how many of those were in the same building?
That I don't have in front of me, but we have tracked it. We've tracked what we call, as you said, frequent flyers. We're now looking at any building that has had 5 or more actually going out with inspection and education staff and understanding why they have multiple calls. If we have more than 3 calls in a period of time, we do the same.
I'm really trying to get to the nature of the buildings. Do you have any idea that that building is housing people that are vulnerable and may be predisposed to pulling the fire alarm, compared to ones where it's just a prank? Do you have that nuance in your tracking?
That's correct, we do.
You do, okay. So I can find out what that looks like from you?
Yes.
Okay, the last question is, what the policy for all 3 services attending any emergency, is that still in place?
It's a tiered response agreement that all 3 services abide by, and it is in place.
And Mr. Rossini, what's the cost of the tiered response agreement? That no matter what, you get fire, police, and ambulance? You've never costed that? We've never costed that in the city? Has anybody ever costed that?
Whether it was done before I was here, in the last 3 years.
A tiered response agreement is,
I'm not talking about the agreement, I'm talking about the response, having done a cost analysis of that tiered response. For example, at Bridgepoint Hospital, everybody arrived at the hospital on Sunday. I think, first of all, people are wondering why everybody's at the hospital, but irrespective of that, what are the police doing at the hospital? What's everybody doing at the same place, and what's the cost?
but I guess with all due respect, Councillor, if we didn't respond, we still have people on staff who are being paid. There's no difference in cost. I'm not sure how you'd create an additional cost for them to do that element.
So you're looking at that, well, there is the truck that's running, and there is all the rest of it, so there are just issues, and nobody's ever costed tiered response. That's what I'm hearing. Mr. Chair, that you know about?
Not that I'm aware of, and I don't think the answer is I don't think we are aware of that.
Thank you.
Thank you very much. Seeing no other, oh, did I miss? Oh, I'm sorry.
It's all right. It's okay, it was that scribbly writing.
Deputy Mayor, it's all yours.
Last question, I think, is around this year's work on the high-rise safety for high-rise residents, and whether or not that will continue and is in the budget for next year. I'll just give you all my questions at once because they're all related to that. How you chose the buildings, was it written or building meetings? Was it done with councillors? Was it done in many languages? So if I could just ask those sorts of questions, Because I'm just not aware of any in my area, and I have quite a number. So
Through
could I
yourself.
ask you that?
Through yourself, Mr. Chair, to members of committee, we started the high-rise program in 2014. At that time, we looked at buildings in areas where we had a high incidence of calls, false alarms and/or fire calls. We expanded the program in 2015. We will be expanding it again in 2016. My goal is to continue to expand the program. Now, with our new modeling tools, we're able to look at pockets of high call volume as well as pockets of high false alarms. So those are the areas we're focusing on, and where we have additional high-rise numbers of people, vulnerable populations, and those that require our services to a greater degree. So that's typically how the choices are made, is really based on activity levels.
And would I be able to get an outline of that, and particularly because I don't know that it was in Oak Street Apartments or whether it was in St. Jamestown? I'm just not aware. And if it did happen, then it wasn't in conjunction with our office, which would have been useful as well, right? So if I could just get the outline of that program, I can have it offline. I'm perfectly happy with that. And the buildings in Ward 28, at least, that were in the program.
Yes.
Thank you. Thank you.
Thank you, Councillor. Thank you very much, Chief, for your time today.
We had a terrific one when we first started on that.
I hadn't planned on a second round. Is it possible to do that question offline? Okay.
There's a question.
Thank you. It is 4 o'clock, and we have 5 more divisions to go.
Thank you.
We're doing MLS, Municipal Licensing and Standards. Questions from committee members. I will go to Councillor Carroll first.
Yes, I'm just in there now. So MLS, I'm kind of surprised. We haven't made a lot of progress on making this a cost recovery department. And I'm wondering if does this budget actually give you the staff you need? Given that we aren't allowing you the positions you've asked for to finally put to bed the ground transportation review, are there the resources there for the other initiatives? For instance, my New Year's resolution is that we make some progress on suburban rooming house. So can we do rooming houses? Can we do landlord licensing? Can we do all the other planks in the MLS platform if we don't give you the resources you need to get ground transportation done separately?
So through you, Mr. Budget Chief, you're referencing the 1.8 million that was on that, the new and
10
enhanced
positions.
direction from council. So that arose out of the last ground transportation report in September, and it was very contingent upon the decisions of council whether or not we're going to have a regulated regime that includes another service provider in ground transportation, thereby additional volume, thereby potential revenue source, thereby enforcement, versus not having it. Undertaking the review we're doing now, we're doing enforcement in respect to the unpermitted operators, we all know who that is, in addition to the review work we're doing. So I would say in respect to the policy work, which is the greater portion of these efforts on rooming house, ground transportation, we have staffed up using some temporary resources and are dedicating a fair bit of time of my staff to those initiatives to bring the reports forward. So, we're managing the enforcement at a reasonable level in respect to ground transportation. I really think that answer will come better when we bring the report back this spring.
Bring the report back on which?
On ground transportation. The other piece you mentioned around cost recovery. So MLS is approximately 57% cost recovered through user fees.
Right.
The one component that is most significantly sitting on the tax base is that of property standards, which includes our MRAB program. You did mention the licensing of landlords. We do have a body of work that we're going to be bringing forward this year.
You have enough resources to do that?
It's policy staff, and yes, we do.
Okay. So the rooming house piece, there is the piece, the consultation piece being executed by a consultant. But when it comes time, is there's an initial report coming in 2016?
Yeah, so
So
through...
there, that's going to be another policy staff need, is it not?
That's possible. So through you, Mr. Budget Chair, the consultation undertaken in 2015 was paid for by City Planning, MLS, and Shelter Support and Housing for those consultants. We are working on bringing a report forward that outlines a framework that we will be doing further consultation on. So when we bring that report back, I believe that would be the point where we identify what the next steps are and if those next steps require additional resource or additional funding. So again, I believe that ask ought to be tied to the outcomes of the report when it is presented to council.
Okay. And while we're waiting for that policy work, we've now had a death from fire in precisely the kind of house where we have this problem in Scarborough, not too far from my area. In fact, when watching the news, I thought, oh my God, that is Cairnside Drive, and then discovered it was another street. But this is very prevalent, the type of living situation that resulted in that death from fire. So the question is, while we're waiting to get this policy work done, have you got enough enforcement staff to be really proactively responsive? Because the community immediately picked up the phone and said, are people enforcing these? That's going to happen in the house next door to mine. Do we have that, or do we have enough resources for that?
Right. So through you, Mr. Budget Chief, I had the same reaction, Councillor Carroll, when I saw the fire and the fatality that occurred. There's really a shared accountability in respect to enforcement in housing. In this particular case, Toronto Fire definitely has a role and will be fulfilling that role. Toronto Building has a role, as do we. Our role in respect to this land use is the contravention or compliance with zoning.
Right.
We had been at that premise previously, and it had not been under that type of use. So as far as enforcement goes, we're in a bit of a nebulous situation here because we are undergoing this review work to determine what the future state will look like in permitting rooming houses. Certainly, again, that will depend on the outcome of that report. Ultimately, the direction of council will speak to then what level of enforcement or what enforcement is required, whether it is enforcement focused on life safety to ensure people have the proper quality of life, or is it enforcement relative to people operating in an unpermitted, non-compliant way, is a very different conversation. Right. So I would suggest that, it's, of course, everybody would like to have more enforcement staff. We're never there when you need us, but we are when you don't want us, somewhat like policing. But I think the responsible thing to do in these efforts is, as these reports are coming forward, understand what the outcomes of council are, and then determine what the impacts on staffing will be going forward.
Thank you.
Okay.
Thank you very much. Any other questions from committee members? I'll start with Councillor Pasternak, then Layton.
Thank you, Mr. Chair. I guess council decided to issue 100 new Toronto taxi licenses. Have they all been issued?
Through you, Mr. Budget Chief, we're currently in the process. We've issued letters and received acceptance for the 100 drivers on the driver's waiting list. So those people are now going through training and will be issued once they receive the accessible vehicles that are required.
So was that done on a lottery basis, or?
No, we maintain a driver's waiting list. It has been for decades, where people wait on the list awaiting city issuance of a taxi license. That is how taxi licensing has been done since, I think, with the first taxi license in the 1800s, 1900s. It would indeed.
So it's before our time?
Indeed, sir, it is.
What's the fee tied to taking on of a new plate?
So the initial issuance fee on the application for a TTL is approximately just shy of $5,000. That's the first year on issuance. The renewal fee thereafter is approximately just under $1,300.
And is there a restriction on the resale of these 100 new licenses, either a sunset or a
so through you, Mr. Budget Chief,
encumbrament of some sort?
Our taxi cab licenses are not sold. They are issued to drivers on the waiting list when the city issues. There's a secondary market for the sale of taxi cabs, They are permitted to sell their taxi cab to any licensed taxi cab driver. We will then transfer the license to the purchaser of the taxi cab such that they, as long as they have complied with all the requirements, i.e. have a taxi cab driver's license.
So when it comes to the sale of the taxi cabs, it's, there's no minimum holding period. They could do it within a couple of weeks, or...
Through you, Mr. Budget Chief, so my recollection on our revised regulation, I believe we said 2 years on the Toronto taxi license. Your question about a sunset clause or an ending, that was not held up in the courts when we defended the last taxi bylaw in 2014. So anyone who's issued a taxi cab license today or is in possession of a taxi cab license, it is theirs until they so choose to not have it any further.
When it comes to issuance of orders through your department, usually on the order there's a fine and court fees attached. Is that correct on?
No. So through you, Mr. Budget Chief, it depends on which notice of violation or a charge or an order. So we have a multitude of enforcement tools available to us. If we issue an order, let's say a property standards order, it gives the property owner responsibility to comply. It doesn't issue a charge or fine. With licensing enforcement, our licensed businesses where we have set fines, we issue provincial offenses tickets. Those have fines.
Right. No, I understand that the fines and the fees won't kick in until there's non-compliance. They're given a certain amount of time to comply, and then they...
No. So...
They would go to court. They could potentially go to court.
It would help. Are you talking about a property issue or a licensing issue?
Well, it would be the ones that are coming on my desk are the property issues.
Okay.
Where people are given a...
So when we
period
issue
of
an order to comply, it does not have a fine or a court date or anything of that nature. It's an order for them to bring whatever deficiency is in place into compliance. If there's willful noncompliance, there's a series of steps we could take. One includes us conducting remedial action. We do the work, we fix the deficiency, it gets billed back through taxes to the property owner. Depending on the situation, we could issue a ticket for noncompliance. But so it really depends on a situation-by-situation basis what the most appropriate enforcement mechanism is and whether or not that attracts a fee. The one part I will say on property standards, we do apply a reinspection fee where there has been noncompliance. So maybe you're referencing that.
And how is our collectibles on that? Either on the reinspection fee or the issuance of an order of noncompliance?
So when we apply a reinspection fee, it gets applied to the tax roll. And I think we've got a pretty good recovery on that. It certainly stays on the tax roll until such time if the property is sold, then we would recover then. I don't have my AR outstanding on re-inspections. We can find that for you if you'd like.
Okay, thank you, Mr. Chair.
Thank you. Councillor Layton next.
Thank you very much. I was actually looking for something else in the budget around reporting on animal bites, and I think you probably know why, and we've worked together on that issue a couple of times. But what I found on page 22 that doesn't come out in the analyst notes as a service level change is the projected and the targeted response times and the reduction in response times for licensing and permit enforcement, waste bylaw enforcement, parks bylaw enforcement, and animal bylaw enforcement. It went down from 2014 to 2015, the approved response times, and it will, again, for the category of waste bylaw enforcement, for illegal dumping will go down another 10% to 80% being responded to in 48 hours. But the actuals are on all the categories are coming in quite a bit lower year over year. So first I'm curious why it didn't show up for that category as a service level change. Because we are reducing it quite a bit. And then I'm concerned that we're actually reducing, like our actuals like we're 10% underperforming on each. And I read the note at the bottom that I think it says why, and I'd like you just to give us some background as to why aren't we able to achieve our service level standards so badly that now we're going to change one of them?
Okay, so first of all, through you, Mr. Budget Chief, in respect to dog bites, that is not captured under bylaw enforcement in the animal bylaw enforcement. That's dealt with still through animal services, animal mobile response, and that's where we actually changed the service levels, I believe, last year to be a 24-hour response to dog bites, or animal bites, primarily dog bites. So that standard has not changed in respect to the bite issue. The matter in respect to parks and waste, certainly we've had challenges in the waste enforcement group. That's one of our groups that has some of our more senior employees, also employees who came off of solid waste management duties many years ago, and we have a higher incident of absences due to illness in that group. Also, that is the group that experiences a greater number of vacancies when staff look to transfer. So it's an entry point in many cases for enforcement officers, but it's also the one people try to exit at the same time. So what we've done is looked at reflecting our service levels accurately based on what our complement is for this group. Having said that, we are also looking at how we can better use tools to target the enforcement, and we certainly do put a priority on the complaints. So I think we spoke to it last year on that change. It was more reflective of historical actuals. Other things we're doing to try to achieve these standards is cross-training our staff. So where we have an increase in complaints in parks for dogs off leash, maybe we can pull some of our waste staff. So we're really trying to be flexible with the deployment of our staff across all.
So the licensing and permit enforcement, why is it that in 2014 we only achieved a 50% when our target was 100? We reduced it to 90, we still only achieved 75% response within 48 hours.
So through you, Mr. Budget Chief, I think it's safe to say, Councillor, that the demands and the requests we've received in respect to targeting enforcement in certain areas, for example, a taxi takes up almost 50% of our time now, has always kind of been around that. The street food was an increase in requests. That was about, maybe 8% of our work. Problematic restaurants, areas of issue, we've focused, done some targeted work there. So
these are all important things that when we set standards, we hope that they're achieved.
Yeah.
The problem is we're not achieving them. How would we go about achieving them?
So, before we say we throw more bodies at it, I think there's opportunities for us, as we are doing, to look at how the deployment's happening, still targeting, sending people where we need to send them, when they need to be there, so it's meaningful work. We've made progress in that respect. We've also expanded some hours and changing some shifts to address when complaints come in. I'll also say on waste and parks for this year, 2015 past, we just integrated with 311. So certainly the ease and the ability for people to make complaints is improved. So we'll see what those volumes shake out at as the years go on.
Do you think you have adequate resources to achieve the targets that have been set?
I believe that we have opportunity to use the staff that we have in a more effective way. I believe we have some of the tools we need. We're going to develop more tools that we need to do that, to respond to this. And I think the responsible thing for me to say to you is we need to exhaust all these efforts before we say we need 20 more people.
Thank you. Any other questions from committee members? Councillor DiCiano, it's all yours.
Thank you, Mr. Chair. Good day, Ms. Cook. How are you?
Reminded me of my vacancies as well. I'm well, sir. Thank you.
Good. How was your holidays?
It was fabulous. It was
Wonderful.
pretty quiet. Nothing went on in MLS.
Maybe we should.
And yours?
Budgetary questions. I'll just remind you.
I'm having a
Wanted to
sixth
ask.
grandchild, if that you like to
Fantastic.
Christmas. Yeah, hey, I know.
Congratulations.
Thank you. I know I don't look old enough.
I've been on sort of a pattern with respect to talking about the use of technology at the city level in all our divisions, and it's become pretty clear that we are certainly, if not in the Stone Age, is pretty close to it. But tell me a little bit more about MLS. Where are we going with the use of technology, and can it be incorporated to allow you to serve the people of Toronto better, in essence, do more with less?
Thank you for asking that question. To you, Mr. Budget Chief. Certainly, we have had challenges with the systems that we've had. They don't do everything that we would like them to do in this current day. We're utilizing what we have, and we're doing not bad as far as some analytics go. But what we did do in 2014 was set aside the time to develop a strategic plan for IT for the division. Out of that plan, we've developed a number of business cases and set out a vision for what the division needs. So we have 5 projects currently in flight relating to, if I was to put them into buckets, service delivery. So we transitioned our staff from big laptop bricks that were supposedly called remote computing systems and cell phones to a smartphone, and it's actually amazing what you can do with a smartphone these days. So we've already done that. As well, we're providing the tools. We've created an online policy data warehouse so they have access to information. So on the service delivery side, giving them the mobility. Customer service side, we've got a number of enhancement projects going on to the existing systems we have to enable online with animal services, with licensing, and a goal would be on the property standards exemption side. I think one of the biggest pieces where you're referencing is the development of analytics and how we use what we're doing to direct what we're going to do in the future. We have a project that's underway, a data mart project. So we're taking our 3 systems data, cleansing them, and we're going to be building out what our business requirements are for a true business intelligence, business analytics tool. So that is certainly currently underway. We've also used technology, surveys, et cetera, to get public engagement at pretty significant rates. We've had great feedback on that. So, we're looking to use technology in a variety of different ways. I think the key has been that we took the time to set out a strategic plan. We identified the resources we needed on the business side to support and be ready to roll out what we need, not just punt something to IT and say, make this happen, without a fully documented and comprehensive business case and the readiness on our side. So we've dedicated some of our staff resources to do this work, to be more strategic going forward. So we may be shy a couple of folks out in the front line, but that's going to pay off dividends long term as we build out these programs. So, and we've had great support from IT in that respect. We are looking at 311 as well, the business analytic tools that they have, and how can we integrate the use of that. So I think we're doing a fair bit, and it's going to take us a bit of time to get through it all because it is a lot, but at the end of it all, we're going to have good data and usable data, and that's going to help direct service delivery for the division.
Great. Now, with respect to increasing the online tools, so that people don't actually have to come to the city to buy a license or get a license plate sticker, all that kind of stuff. What is the timeline or the investment? When is the money coming so that you can go forward and make those investments?
So we actually were approved for our first phase on that particular piece for licensing. We don't issue the VAL tags. Service Ontario has a great system I've used for that. So we've actually been supported through the e-city programs and the funding through BEC to do our first phase of documenting what our business requirements are. Then we're going to be looking at a new solution, changing what we have, maybe procuring a cloud-based service. So we're starting that now. We're in phase 1. By the end of this year, hopefully we'll know what it is we need to enable online licensing. In the meanwhile, we're also looking at piloting some other different approaches for licensing and putting some in a satellite office in Etobicoke. So in the meanwhile, try to mitigate some of the impacts at 850 Coxwell and provide service outside of just that one location. So online as well, we're looking at enabling address changes and some simple things that people can do with the existing system while we document what we need going forward. So I'm hoping next year we'll know what it is we need and then where do we get it.
Okay, thank you very much.
Thank you, Councillor. I have a couple questions myself. Tracy, I received a letter from the mayor, I believe a couple days ago. I don't know if other councillors received it. I think they did, on freezing the taxi fees for this coming year. Can you describe, first of all, how much that would be and how and what you're doing to sort of deal with that on the budgetary side? And really, is this something, again, I don't even know how much it is, but is this something that is this going to have to be new and enhanced, as we've seen with the adding on to that list, that we have to do the give and take somewhere, or how are we going to deal with that?
So to you, Mr. Budget Chief, our revenue number that relied on that 2.56% increase on taxi licenses only is approximately $222,000 for the year. I think given the nature of what's going on currently in respect to the ground transportation review and the report we are going to be bringing back, it's at that point where the conversation about what the impact is going to be to the division, plus or minus, will really be more informed. I believe over the next few months until we get to that point, we can deal with this shortfall sufficient enough if council deems it appropriate and wants to freeze the fees at the 215. So we can manage the couple of months of that 2.56 reduction pending the outcome of the ground transportation review report and where that will lead us.
Okay, so you'll need some direction from Budget Committee.
Absolutely. We applied the automatic inflationary increase pursuant to the bylaw and the user fee policy. And, you know, that was done as a matter of course. And I think it's a fair assessment and a fair act to undertake at this time, given the report and the work that we're doing and coming back with in respect to this industry. And
Okay.
we'll figure it out.
Okay, thank you. And by the way, I just want to appreciate your comments about it's not just about adding bodies to achieve and improve service levels. It's very refreshing to hear that. So thank you.
No, thanks.
Any other outside councillors' questions? Seeing none, thank you very much, Tracy. Appreciate all the work you've done. Okay, where are we here on our list? PPF&A, Policy, Planning, Finance, and Administration. Questions? Council members? Outside members? Yes, we do. Councillor Carroll is here. Seeing no questions on that division, I thank everybody for waiting, and unfortunately there are no questions, which is generally a good sign. We'll go on to Engineering and Construction Services. Questions from committee members? I believe Councillor Carroll may have a question or two.
I actually don't have a lot, except that I just wanted to, because I was looking at this versus previous budgets and just wanting to understand, this budget started out years ago when it was still called Tech Services, that everything was a charge back to other budgets. But we have a core budget here of 7 million. And I just want to understand, we're growing a department here that we don't get to bill everything back to contractors. How's the decision made? What's going to be billed back and what's not?
Through the chair, as you noted, about 10% of our budget is tax supported. The balance, our time and costs are charged back to capital projects. And so capital we deliver, we're a service provider to Toronto Water, Transportation, Solid Waste, TTC, Economic Development. And so staff time, for example, on the engineering and the construction of those projects is charged back to those capital jobs. We also do recover fees, for example, in the review of development applications. We're not fully cost recovered, but a good portion of our fees are recovered. We have staff that are supporting the Metrolinx projects, and those costs are fully recovered. We have staff that are being proposed for our 2016 submission to help support the Bell Smart City Initiative, and again, all of those costs would be recovered as a charge back to Bell.
Okay, so, and that was one of the ones I was going to ask you about next, was the issue of when you have to sign off on development. Often in a development application, we'll collect the funds from them, and a road has to be built, or a water pipe has to be built. Do we have a policy that we execute it and they pay? And in that case, why is it only partially recovered from them?
Through the chair, the partial recovery is with respect to the staff time in the review of those applications.
Just in the review?
Just in the review, correct.
But if they're ordered, a new road will be built here, you manage the contract for them?
Typically, it's through the developer. We will oversee the design, we will review the design, and we will provide on-site inspection services to make sure that the road is built in accordance with our standards and specifications.
Right, but then they contract and manage the project themselves?
That's correct.
So we're not picking up any of those costs.
That's correct.
So is there an ongoing review such that just review of development applications, that the eventual goal is that those costs are being absorbed into the plan to make planning cost recovery?
Through the chair, as the chief planner noted earlier on, that review is taking place as we speak, and it is our hope. In engineering, we do track our time. We have a software in place where all the staff time associated with the review of a given application is tracked. We have metrics against the time that it should take, and so all of that has been logged now for the last couple of years, so we're able to quantify what the level of effort is against the review on a given application.
Okay, good. So you are tracking that. So if we're going there, you'll be able to rationalize that with the hard data. So the only other one then that interests me in terms of making sure that everybody's paying their share, if you are engaged in a project where there's multi-government funding, you know, if we get federal funding to help us with the hybrid or, sorry, what? Oh, okay. If there's a multi-government funding source project, do we then get to bill them for some of your expertise, your department's expertise and cost to further absorb your costs?
Through the chair, that's a great question. So the one that comes to mind, obviously, as the deputy city manager mentioned, is the Gardner project.
Yeah.
And our preliminary discussions that we've had with the federal government, again, as you know, that we will be making an application to them for the costs associated with the construction of the project. Part of the construction will mean our staff time, the project management fees and costs. So the 6 staff that we've identified to help frame the Gardner project office, we hope to submit to them for cost recovery purposes of the staff time associated with the oversight of that project.
Okay, so we would submit, this is what it would cost to contract this work, and this overhead from our department will be part of that. Okay.
Sure, exactly.
Okay, thank you.
Thank you, Councillor. Councillor Layton.
Thank you very much. The service standards on page 17, when you look at the service levels in the chart, our target is 75 and has been consistently since 2013, correct?
Through the chair, that is
75% compliance.
with
Right.
with the start timelines.
Sorry, this is development application review and acceptance.
Through the chair, that is correct.
Engineering drawings, 75% compliance. Then third-party application review and acceptance, 90% compliance within 20 working days.
Through the chair, correct.
And that's reviewing applications that you get from planning.
Correct. As the chief planner noted, there's a number of party stakeholders that are involved in the review of development applications. Engineering construction services will review the engineering submissions. As the CFO mentioned, part of those submissions will also require stormwater management reports that are reviewed by our engineering staff. It's all part of the review of the specific development applications and the nature of the development.
So the target is 75%, but we've been doing quite a bit better than that. You've been doing quite a bit better than that.
Through the chair, over the last couple of years, we've made some internal changes, part of our restructuring within the division. And so to your point, yes, that over the last couple of years, we've done significantly better than 75%.
Last couple, 3 years in a row, you've gotten above 90.
That's correct.
We just setting the bar a little too low? Are you doing this just so you can say, like, look how great I am? You guys have like a circle you get in, say, who was above their target? And Mr. Buckley says, well, I was 2% above, and you say, yeah, I was 15. Well, when your target's 50, no, seriously, are we setting it a little too low here? Should we just be up? Is there a downside to increasing your service level?
Well, through the chair, those standards were set by council, and so, you know, we were obligated to work to achieve those delivery rates, and we have exceeded, and so we're proud of the fact that we've done that. I guess in the end, it becomes a council decision, but whether to make those timelines more stringent.
So you go to like municipal conferences and infrastructure conferences and people bragging about their rates, and then you brag about yours. But are other municipalities, do they have do they have compliance rates that are significantly higher than ours? Targets?
Through the chair, I'm not aware that other municipalities are tracking. Again, this is on the engineering review of the development applications.
You know what? For thousands of years, engineers have told the captain of the Starship Enterprise that they'd do it in twice as much time. And they do it in half. That's how Scotty from Star Trek got away with this, because engineers saying, oh, that's going to take 10 days, and you said, I need it in 5. Then they go, oh, yeah. And because they can do it in that amount of time. You ever see that Captain Kirk episode? I guess that was my final question, and congratulations for achieving such a great rate above your. I don't think that the chair is paying any attention, so we can just keep bantering about Star Trek if you want.
I can do that. Did you see it?
That's Star Wars.
Yes, so if you have briefing note requests, get them into the clerk. And, but yeah, it'll be Monday. Okay, you finished, Councillor Layton? Is he done? Okay, sorry, I was talking to the clerk there. Okay, any other questions? Seeing none, okay, thank you. Okay, Councillor DiCiano has a...
My colleague next to me is too loud. Okay, you mentioned that you track the time of your employees. Is that correct?
Through the chair, a few years ago, we instituted what's called the Project Tracking Portal, PTP for short, and our staff time is tracked irrespective of the activities that they're working on. So the core of our business is design and construction. So for a given project, we are tracking staff time associated with the delivery of that project, whether it be the design or the contract administration or the inspection costs associated with the delivery of that project. So we're able then to quantify what the cost of engineering is against a given project, no differently than what the private sector does. So it's a private sector approach applied in a public sector setting.
And how long have you been doing that?
We've been doing this for the last 3 years, but it's in earnest in the last couple of years is where it's really come to fruition. Associated with that, we developed our key performance indicators. We have key performance indicators that drill down to the individual staff. The staff have their mini dashboards, if you will. There's a roll-up to the manager, to the director, and then ultimately to myself, tracking performance across the division.
So because of the introduction of PTP, you then were able to gather information and data and patterns to your information and data to come up with new KPIs.
Through the chair, essentially correct. We developed KPIs. It was really a measure, a number of objectives there, ultimately to look at driving performance within the organization. Also looking at equitably distributing workload across the organization. So the way that our organization is set up, we have staff working on similar projects, and in an effort to ensure that there's an equitable distribution of workload, that was another way. So as I said, for each of the individual staff, particularly the engineers and the project managers, we're able to track their performance at any point in time, not just at the end of the year.
So what has this been able to do for you? What's the end result?
Well, through the chair, for us, it's been able to drive performance a higher level because everything is being tracked now. To the question that was raised earlier on, we're able to track and gauge what the level of effort is on a given activity. As a result of the monitoring that we did, we're able then to establish user fees that are true cost recovery for anything that we do external to the service that we're providing to our internal clients.
Can you measure your top performers versus those that may need additional training?
Through the chair, that's exactly one of the outcomes of what we have. We've got a fulsome training program that is being developed and is really to bring the lower performers up to a new standard, if you will. We've changed internal processes, and our hope is that we raise the bar across the entire organization that way. And one of the ways of doing that is to drill down to identify those that are going to need some additional support, some additional training, if you will.
So, I asked these same questions earlier today, and some of the directors answered that there wasn't technology to do exactly what you just said you're doing. Who else in the city is using PTP?
To some extent, Toronto Water is. I believe facilities, some groups and facilities have now started to use it. And I believe Parks, Forestry, and Recreation, some groups within PFNR are also considering adopting that as well.
Would you recommend the city go citywide with these types of technologies?
Through the chair, I think it's going to depend on the individual activities, the type of work. As I said, PTP has done its job for us. There are other software tools out in the market. PTP has been configured. It's been an in-house product, if you will, working with corporate IT. It serves our needs. We're continuously developing and updating it to, again, meet the needs of this division. But, it's there for consideration for others that are looking at tracking time against specific activities and projects.
Okay, thank you very much.
Thank you, Councilor DiCiano. Seeing no other questions, thank you. Last on the list today is transportation services. Oh, sorry, Toronto Building. Toronto Building is next. I know. I did the same thing with TRCA. I apologize. Toronto Building is next. Do we have questions from members? Councillor Carroll.
Just a quick one, because I'm looking and we're really catching up here. And in terms of it, I was asking questions offline, and some of the things from the Auditor General's report are on track. The travel is actually, it's gone down, but in fact, we're actually auditing and still ending up getting more inspections done in a shorter amount of time. My question is around the briefing note on the expenses and places where we're meant to reduce. All these expenses are getting covered by fees. This is all being absorbed by user fees, is it not?
I don't think, yes, they are.
Yeah. So here the cost recovery model has really worked. So really, it's really the most important function to Toronto Building at this point. It's not really budget, but audit. As long as it's accountable and it's being audited, we're getting results and all those recommendations are being acted on. This is not a division that we need to spend a lot of time on in budget.
That is correct.
Okay. So the only other thing is based on what we heard. We spent a long time on planning this morning, and they expect the trend in a great deal of busyness in planning to continue. They have a lot of applications that are sort of on hold that will probably proceed since we're making transit progress now. Do you have the resources? Does the cost recovery model allow you to keep pace? You can keep the same service levels. If you needed to hire staff under the cost recovery model, could you go ahead and do it if there's a sudden trend in year, or would you have to wait till the following budget year?
Yes, the cost recovery model would handle that, but we would have to wait through budget to bring that up again.
You'd still have to go through the budget year cycle?
That's right.
Okay. A possible policy discussion later on. Okay, thanks.
Thank you, Councillor. Any other questions? Seeing none, we'll go on to transportation as the last division of the day. Questions from committee members? On transportation. Councillor Carroll.
I don't need to do a huge deep dive, but I'm looking at advertising and promotion. We do some very clever things. Who's answering the transportation question? Oh, there he is. He's back. I'm looking at the briefing note on advertising promotion. Can I assume this is where the please slow down sign campaign would have come from?
Through the chair, that is correct.
Okay.
It's actually a pot that we've used for several things in the past, and Again, with our safety program, we're always trying to ensure that we're trying to make it as effective as possible, which is always difficult to measure. In the past, we've done things like advertising campaigns where you're running something simply for 4 weeks on 200 transit vehicles, and it will cost you literally $100,000. So we're looking at different ways to try to get the message out.
Would you know offhand the all-in, how much that program cost? Because it happened without ever having come to council.
Yeah, so again, just like all of our advertising programs every year, it's funded as part of our ongoing safety education program. Again, in previous years, we had spent upwards of $30,000 on an advertising campaign and $100,000 on purchase. Those signs are $2 a piece. So we did roughly 20,000 signs for roughly $40,000.
But how much did it cost you? But then you sent trucks out to collect them all back up again.
No, I mean,
So when I say all in, I want to include that cost.
yeah, I mean, we probably did a day or two of distribution with staff. So
Distribution, but then you went out to collect them all back up again. We were getting complaint calls, where did my sign go?
Oh,
And
no.
it turns out there was an expiry date on them so that they'd be out of the way for snow removal season.
that is not true, Counselor. We basically, they're the property owner's property. We asked them to remove their own signs during that time. We did not collect them. As part of the instructions,
Well,
it
when we
basically said,
inquired as to why the signs had disappeared on behalf of constituents, that was the answer given by your staff.
I'm not really sure who on our staff would have said that. We did not, there was never any intent to collect them. The instructions clearly said that we asked folks to have them removed by the end of November, knowing that during the winter months, they would become susceptible to damage and, being stolen and things like that.
Right. Politicians know all about that. So my question is this, because the problem is, the other thing that politicians know is that the cost of signs goes far beyond the $2 to buy them. They are a big, labor-intensive pain in the neck. The question is that program going to be evaluated? Are councillors going to be asked about it? Can we ensure that that never does happen again without coming to council?
Through the chair, we were directed by Etobicoke Community Council to look into a program like this. Having not just give it to them, but offer it to the entire city was the intent. So councillors, there were, I'm sorry?
So a community council suggested you look into it, and then it just happened.
Yes.
The problem is, I'm not sure if you got this feedback. Did staff let you know that, in fact, there was great offense taken by the Georgia Walsh sign program that already existed, is coordinated by parents and schools and communities, and suddenly this second sign of a different design showed up, when in fact they had have a self-funded, self-administered program with which they would have been very happy to partner with the city if the city wanted to expand the program. Did that feedback make its way to you?
We have not heard, in my office, we have not heard one response to that effect, Councillor.
But councillors have given you that feedback. Did
I have
the
not
staff
received
members that we gave that feedback to get that information to you?
Yeah, currently, we actually issued a survey about 2 or 3 days ago to all the councillors asking for feedback on the program.
Okay, so I will put this in writing for you, and I suspect that probably Councillor Burnside in the Leaside community, where that sign program began, because of the death of that child, he would want to provide this for you in writing as well.
Thank you, Council. Any other questions? Councillor Layton.
Yes, thank you very much, Mr. Budget Chief. On page 9 of the analyst notes, the revenue changes. An increase in utility cut repair revenue to address the backlog.
Correct.
That's for the utility companies and anyone else breaking our concrete, right?
That is correct, Councillor.
Now, will that come or any of that money be spent in the monitoring of the quality of the repairs that are being done?
We're actually in the process of doing a top-to-bottom road rehabilitation review. We literally expect a final deliverable in the end of, I think, March, at which point we'll report back to council. But we're sort of reviewing everything from pothole repairs to utility cut repairs to all of our capital specifications and delivery. And so sort of a soup to nuts on all of these elements is being reviewed by an outside consultant in consultation with staff and other experts. and we'll be reporting on that, on recommendations to improve that process.
I can find a picture. I have one of Dundas Street in Councillor Cressy's ward where someone clearly put a 2x4 underneath the cement as they, or the asphalt as they repaid over it. Not the best utility cut repair, I
So, no, in most cases, Councillor, they are, the utility companies are responsible to do a temporary repair, and in most cases, the most problematic ones that we've seen have been the temporary repairs.
Well, no, this was there for about a decade as I cycled
Oh.
past. But it's now since been fixed, and it's now a beautiful
please
road
call us.
to Oh, that's right, because you were elected, Dundas was fixed. Thank you, Councillor. I'll submit my complaint to our current member of parliament.
Who's liberal?
The reduced contribution from the Road and Sidewalk Reserve Fund,
Yes.
that's the draw that we're taking. That's going to decrease because
The reserve expired. It's out of money at this point.
it's out of money.
Correct.
Any plans to put money back in it?
Again, I'll refer to the financial folks on that front. I think in the past, we had sort of collected some funds that we had never used, and in the past 2 years, due to the harsh winters, we had tapped into that to actually do many of the repairs that they were intended to be used for. At this point, though, this season, the number of complaints that we had after the winter came down a bit. I think a lot of it's due to the good work of, we're getting to some of the worst streets in the city. So we're putting less effort in on the maintenance side because we're making the capital investments.
On page 10, I quite like transportation's vision of what inflation looks like. You win the award for highest number for inflation so far reviewed at 2.4%, rather than a 1.4%, which seemingly is pulled out of thin air, a 2, which I think was just rounded, and 2.4. So where'd you get your number, and why is it different?
Through you, Chair. Similar to what we do for every program, we look at the basket of goods that are required to deliver that service and what the inflationary increases are associated with that. There could have been associated with the cost to deliver the service, certain contract escalation costs that are higher than the CPI rate of inflation and other factors coming into play. And this is the end result of all those costs.
Our American GM of transportation is purchasing in American dollars. That's the only explanation I can find.
So in short, I think as Mr. Capote was saying, is that because of things like construction costs, which may accelerate at a different pace than over general.
Sure. Yeah, that's good. That's good reason. On page 11, the enhanced service priorities, the bicycle parking strategy, that's included in the base.
Yes, it is.
And why is that?
It's being funded, actually, it's being incorporated into our street furniture program. So right now, we have roughly 15,000 bicycle parking pieces of infrastructure out there. We don't have a good inventory of them, and we don't have a good strategy about how we put them out there. So this is about getting the assets documented, ensuring that as many of them expire, we have a plan to sort of replace them in kind. So it's funded out of the street furniture reserve.
So is the plan to change the number or the rollout of ring and posts of bicycle parking in 2016?
We still have funding from that's in the actual cycling infrastructure group, but this is primarily about the asset management number. We've typically put out 500 new each year and replaced 500 that needed repair. So
And that's not
roughly
changing?
1,000.
That's not changing?
No, it is not.
Okay.
But again, coming out of the asset management strategy and the plan for this, we might have a different recommendation.
If I changed a street in my ward from a 40-kilometer-an-hour to a 30-kilometer-hour sign, what budget, specifically what budget, would that one sign change come out of?
Signs and markings.
Signs and markings?
Correct.
For the Toronto and East York District?
No, that's a citywide.
Citywide budget.
Essentially.
How big's that budget?
If I remember the entire budget, I think it's in the range of 12, but it's a little mixed at times because things, sometimes there's some elements that can be funded out of capital.
Okay, thank you.
Thank you, Councillor Layton. Any outside councillors for questions? Deputy Mayor McConnell.
It was a follow-up actually to that, and it was on my list. So if you've asked for $400,000 additional dollars to put up the signs in the Toronto East and East York Community Council area, for the 30-kilometer. If you don't receive that, that would allow you to do it in 1 year. Is that right? That would accelerate it.
Through the chair, this one's a little complicated because we actually, we had requested 4 temporary bodies that are not currently in the operating budget. Council can decide to change that, but there is money in the capital budget for the actual purchase of the signs themselves. So I believe there's $1.5 million that has been put in there for materials. Of that, we were going to direct $400,000 into 4 temporary staff that is currently not approved. So right now, over the past 3 months, we've been able to get the signs rolled out in roughly 3 of the wards. Based on internal staffing and the fact that the weather's been mild and we've been able to rededicate some resources. At this point, we likely could deliver the entire program with the capital dollars and the staff that we have, though. Right. So the capital dollars will need to be approved as part of the budget, but we likely can, I'll say, absorb the operating cost of it.
Excellent, okay, so you can do the job without the additional money, that's...
Or the 40 to 30 right now. The 50 to 30 has not, was not accounted for at the time because it was only passed in October.
Okay, yeah, but there's not many of those, we'll figure that one out next. Yeah, okay, thank you. I think that was it.
Thank you very much, Councillor. Councillor Cressy, you didn't have any questions? Okay. That's it, folks. Thanks. Oh. Okay. Listen, I appreciate everybody's time. You can all take tomorrow off, and we'll see you on Friday.
Efficiency, exactly.
Tomorrow is the back-to-back.
Yeah.